All right, good evening, and hello, dear students. How was today's paper? We've already got the first reactions, and everybody thinks that this was a moderate to easy and much better than last time. So we are hoping for a much better result, and hopefully all of you will reach that magic number. And we are just hoping for the best, and the initial reactions are extremely positive, so that's a really heartwarming thing that we've got. The initial reactions have been very, very good. All right, and how was physiology? Again, physiology, what I have been told is that generally most of it has come from class notes. We've got very few recalls in physiology, unfortunately, because I have a theory for that. If the questions are too easy, then generally recalls do not happen immediately. All right. Hello, Nishat. Hello, Vikash. Hello, Adarsh. Yes, Tetsuya, we have started, and so we will start with physiology first. And a brief introduction, I'm Dr. Anupama Chaudhary Devgan, your physiology faculty at NExT. All right, so a general feel of the exam. Let's have a reaction from you, the ones who are watching. What is the general feel of the exam? Yes, do you agree everything was good, it was so easy, a lot of questions from physiology and integrated. Excellent, excellent. I'm so glad that generally everybody seems to be relatively happy from, I'm comparing it with what happened last time. Last time was a little tough paper. Yes, and hopefully we'll get fantastic results, the best ever result. That'll be great. That'll be just fantastic. So let's have a look at the physiology questions which have been asked. Now, this is one question, the first one, which says, what is the dynein protein? Yes, what is dynein? Now, kinesin and dynein, these are molecular motors, and I generally discuss this. These are both molecular motors. They have ATPase enzymes, and these molecular motors are involved in axoplasmic transport. Axoplasmic transport. Yes. So this is what is axoplasmic transport? Now, within a neuron, see what happens in the case of a neuron is that the cell body and the end of the neuron are very far away from each other. There's a long axon in between. So there is a need for a transport system in neurons, and that is known as axoplasmic transport, and this involves molecular motors, kinesin, dynein, and there is another molecular motor which is known as myosin 5. And there is also microtubules are required. These molecular motors move on microtubules. What are microtubules? They literally serve as tracks. And when I'm describing this in class, I always tell you that the microtubules are like a rail ka patri, and what is moving on the microtubules are the molecular motors. And which are the molecular motors? Kinesin, dynein, and myosin 5. All right, so Shinde Krupa says, hello ma'am, thank you so much. All questions from your notes. That's excellent, and that is so heartwarming, and so I feel very happy that you did get the questions from the notes. No one expected so many questions from physio, but Nehal Ahmed, I haven't got too many recalls. I have a recall of only 4 questions. So then, like I said, this is my theory that if the questions are relatively simple, then you do not get the recall. Shinde says, pass ho jaunga. Fantastic. And that's exactly what we want, isn't it? We want you to clear this and move on to the next thing, isn't it? And which is NEET PG. All right. Okay. So the 4th option was molecular motor. Oh, fantastic. So then that is your answer, that this is a molecular motor. Right? If the 4th option was molecular motor, then that is excellent. That is your answer. All right. Okay, you cannot wait too much. Okay. All right. Central veins, which type of cells in the center? Yes. What is your answer to this question? Central veins have which type of cells in the center? So basically, when you have large veins, The kind of large blood vessels, the flow in large blood vessels is laminar. And what is laminar flow? That means blood is moving in sheets and the maximum velocity is in the center. Least velocity is on the sides. And when the maximum velocity is in the center, then cells tend to occupy the fast moving central stream, right? They tend to occupy the fast moving central stream. So RBCs will be found, RBCs are the most numerous cells in the blood, and these will be found moving in the central stream. So the answer to this question would be RBCs. Okay? All right, that's right. So central moving stream. The central moving stream is a faster moving stream and cells tend to occupy that. So this is RBCs. Okay. So even if platelets was the option, then still I will go with RBCs. Okay. Let's have a look at the next question. A patient has decreased iron level and is taken iron medication. Which of the following decreases iron absorption from the gut? Yes? Which of the following decreases iron absorption from the gut? So food rich in vitamin C will help in iron absorption. Why will food rich in vitamin C help in iron absorption? Because the ferric iron which is present in food, this is converted to ferrous iron by vitamin C, right? Vitamin C, right? And iron is absorbed in the ferrous state. Iron in the ferric state cannot be absorbed. So food rich in vitamin C is amla, lemon. These are both rich in vitamin C. Now tea unfortunately will interfere with iron absorption because tea has got tannins. Tea has got tannins, right? And tannins decrease iron absorption. Decrease iron absorption. And if the first option was phytates and oxalates, one of the options, tea. Okay. Tea has got, and generally phytates also will decrease the iron absorption. So tannin, tea I think appears to be the best. Anything which is rich in vitamin C is going to help in iron absorption. Okay, tea tha. All right. Future doctor, Dr. Muhammad, 230 guarantee. Well, that is a very nice and very, all right. Yes, tea does decrease the iron absorption because tea is rich in tannins, yes, which will decrease the iron absorption. Okay. Skeletal muscle and adipose tissue have which of the following glut? And that is, skeletal muscle and adipose tissue will have the insulin-dependent glut. Insulin-dependent glut. Right? Insulin-dependent glut is which of the following? And that is going to be GLUT4. Right? GLUT4. And this is a question which we discuss so often, and the distribution of the different gluts is extremely important because GLUT1, remember one brain, so GLUT1 becomes extremely important. This is in the brain. Of course, it is also in the placenta, RBCs, colon, kidneys, but brain definitely GLUT1. GLUT2 in the kidneys, in the small intestine, liver, beta cells of pancreas. GLUT3, brain, placenta, kidneys, right? And GLUT4, which is the insulin-dependent glut, will be on adipocytes, skeletal, and the cardiac muscle. And this is the question which has been asked, right? Adipocytes, cardiac, and skeletal muscles will be GLUT4, insulin-dependent glut. Okay, GLUT5 is a specific fructose transporter which is present in the jejunum and sperms. GLUT6 and 7. Yes. Rajiv, okay, be fast. All right. 25-year-old patient All right, 25-year-old patient after head trauma presented to the emergency room. On neurological examination, he was found to have normal handwriting, could copy shapes of objects but could not speak. So obviously here the motor aspect of speech has been affected. Motor aspect of speech is affected, and that is going to be the Broca's area. Wernicke's area is concerned with the comprehension of speech, right? And if there is a lesion of the Wernicke's area, it is a fluent aphasia. He's able to speak, but most of that does not make any sense. It's a fluent aphasia. But when the lesion is in the Broca's area, which is a motor aspect, which is concerned with the motor aspect of speech, the lesion is going to be non-fluent, expressive, or the motor aphasia. So here the lesion is going to be Broca's. All right. Okay, so these were the physiology questions, and these are the recalled which I have. If there are any other questions, then please. Okay. All right. Okay, so these were the physiology questions whose recall I have, and hopefully 270 for sure. Okay, great. 250 plus. All right. So we're waiting for our next faculty to join in, and that is pediatrics. Dr. Dipali will be coming with the pediatrics question. ठीक है? और बताइए. Just give us 5 minutes for Dr. Dipali to be ready with her questions. Yes? If you want me to explain more, please remember Wernicke's area is concerned with comprehension of both the spoken and the written word. So a lesion of the Wernicke's area means he's not able to comprehend. He will be able to speak, but that speech will make no sense, and that is known as fluent aphasia. But if there is a lesion of the Broca's area, where is the Broca's area located? This is in the inferior end of the motor cortex, and a lesion of the Broca's area will cause he will not be able to articulate, he will not be able to speak, right? So the lesion is going to be non-fluent or okay. So one more question that I can see over here is temperature control. So temperature control is a function of the hypothalamus, the ability of the body to maintain the body temperature at 37 degrees Celsius is done by the hypothalamus. There are two parts of the hypothalamus. There is the posterior hypothalamus. Posterior hypothalamus is your heat gain center. Heat gain center. When I say heat gain center, this is active in winters. Nowadays, when the outside temperature is very low, it is the posterior hypothalamus which is going to help to maintain the body temperature at 37 degrees Celsius. And the other part of the hypothalamus is the anterior hypothalamus, including the preoptic nucleus. This is your heat loss center, which is active in winters, right? So this is your, this is active in summers. And how do I remember this? AC. AC is required in summers, so anterior hypothalamus is your heat loss center. So temperature control, hypothalamus. This should not be a problem. Okay. Okay, so this was thalamus, pons, midbrain, and hypothalamus. There's another question which I can see over here. It says, thiazides work on which pump? Thiazides will work on which pump? Now, thiazides act on the DCT, right? They act on the DCT, and they will act on Na plus Cl minus co-transport. Right? Na plus Cl minus co-transport. Remember, as far as sodium absorption is concerned, maximum absorption is in the PCT. This is by secondary active co and counter transport. Then about 30% is absorbed in the thick ascending limb. That is secondary active co-transport. That is Na plus K plus 2 Cl minus co-transport. And Lasix, loop diuretics, act on the thick ascending limb. But thiazides act on the DCT, and they act on the Na plus Cl minus co-transport. Absolutely right. Okay. Hemibalismus. There was a question on hemibalismus. Now, hemibalismus is because of a lesion of, okay, one question, there was amygdala in the options, but what was the question? Okay, it says left upper limb, some flinging movement, which nucleus is going to be involved? So this in hemibalismus, the lesion is in the subthalamic nucleus of Lewis. Subthalamic nucleus of Lewis, and this is hemibalismus. There is violent movement of one half, right, one side, and that is subthalamic nucleus, and the neurotransmitter secreted here is glutamate. Okay, so the options was amygdala, striatum, subthalamic nucleus, right? Amygdala, striatum, and the subthalamic nucleus, and your answer would be, okay. Okay. So we've done these extra questions. Anything else that you can think of? Okay, there was one question which says, what maintains the asymmetric concentration of ions across the cell membrane, right? And for that, my better answer is going to be the cell membrane, right? Cell membrane. Cell membrane at rest is more permeable to potassium, but it is not permeable to sodium, right? All right. Though of course I should, if I can know all the other options, I will be in a better position to answer. All right. So these are your physiology questions. Ma'am is ready. All right. So Dr. Dipali ma'am is ready, and we can move on to physio. जैक स्पैरो सेज बहुत था मैम, रिकॉल नहीं हो रहा है, तो इसका मतलब हो गए होंगे, इसका मतलब सही होंगे क्वेश्चंस, तो अब बिल्कुल चिंता नहीं करनी है. आई एम प्यूरिन इज मेड फ्रॉम, ये बायोकेमिस्ट्री क्वेश्चन है, तो सर विल टेल यू अबाउट इट. ओके, गिब्स डॉनन इफेक्ट वाज आल्सो देयर. ओके, जैक स्पैरो, आई विल नॉट try to attempt this answer till I know the complete question and all the options, है ना. फिर जनरली क्या होता है कि जब तक पूरे ऑप्शंस ना मालूम हो तो देन इट इज डिफिकल्ट टू आंसर दैट क्वेश्चन. ठीक है, अगर सारे ऑप्शंस आपको पता है तो बता दीजिए. ऑल राइट, we will come back with a proper recall. This is a recall which is being done, to get an immediate feel of the exam. Chalo, thank you very much. ठीक है, and I can see from आग लग गई. All right, that's also, I can see from your reactions that the paper was good, and I'm so glad to hear that, and wish you all the very best. And we will meet once again after the results are over, results are out, and we have a lot of success stories with us. Thank you very much, and God bless.
Hello friends, good evening. Welcome to the recall of pediatric questions that came today in FMG 2024. So we are very sorry we could get just a sketchy sketchy outline of the questions, and some might not be authentic. Please help me. I apologize in advance if any question, if I discuss with you, had not actually come. So we will come back again with a proper recall later on, but this is what we could lay our hands upon, and kindly help us, right? So good evening once again, and let us get going. So the first question which came to me was, there were two questions on Turner syndrome, and I was so delighted because in Guess the Paper series, that was the last topic I had very nicely covered with you. And the first question which was told to me was, a teenager was brought to, okay, so a teenager was brought to OPD with complaints of delayed puberty and secondary sexual development. On examination, it was diagnosed as Turner syndrome. It was already given. Which chromosome is involved in Turner syndrome? So very nicely it was discussed with you in the Guess the Paper series which we had done last month. And here we all know that it is the XO chromosome, which is involved over here. There is deletion of one X chromosome, and the genotype is XO, and that is responsible for the Turner syndrome. So that was one question. I hope this was the question which had come. And the second question which came with regards to Turner syndrome was regarding its features. So one of the students told me that, ma'am, कई सारे features दे रखे थे, regarding the Turner syndrome, but only one was right, and the one which was right was webbing of the neck. So of course, yes, that student is absolutely correct. Webbing of the neck is a feature of Turner syndrome. We had discussed in detail. So this is the pick from our Guess the Paper series, where we had discussed that the child has wide carrying angle and shield type chest, widely spaced nipples is there. Then of course low hairline is there, webbing of the neck is there. Then you have the nevi, all brown nevi all over on the body, and of course you have the rudimentary ovaries or the streak like ovaries, and that is probably responsible for the delayed puberty and delayed menarche or absent menarche, right? Then there is poor breast development and poor secondary sexual development of the secondary sexual characters is definitely delayed, and that was what was given in the first question. So this was discussed in detail, and again here the correct answer was webbing of the neck, although I could not find out the other the other features of Turner syndrome which had come. So I hope this was only the correct feature which was mentioned, and this is the correct answer, right? Okay, then okay, then let us move forward. Next question was, so these are all the features which we had discussed, and of course the commonest congenital heart defect is, we had discussed at that time, bicuspid aortic valve, and the second commonest is the coarctation of aorta. So remember, coarctation of aorta is not the commonest heart defect seen in Turner syndrome, right? So this you should be very clear with. So let us now move forward. This was again the question which was told to me that it was an image based question. The child, a newborn, or maybe in the infant period, presents to you with some swelling which is noticed some time after birth, and this swelling was given, and what is the diagnosis they had asked. So it is very clear from the swelling that the swelling was cephal hematoma. Okay, and okay, Turner पे क्वेश्चन था, कलर वन चाइल्ड विद डायरिया सिम्टम्स ड्यूरिंग, ओके वी विल डिस्कस दैट ऑल्सो. डॉक्टर मूवी जोन, टर्नर पे दोनों क्वेश्चंस मेरे ठीक हो गए. गुड 45 एक्सो. Okay, so let us discuss this question, and then we'll come to your question also, because actually I'm waiting updates from you. So what was the identify the below given condition? So this is cephal hematoma. Of course the other options could be caput succedaneum and subgaleal hemorrhage, because they are the close differential diagnosis over here. And luckily we had discussed this question also in Guess the Paper series, and here you can see that yes, I had given you the image of cephal hematoma, both the radiological image and the actual image. And we had discussed this question, that cephal hematoma, it is the swelling which is there on one bone. It is a swelling because of the collection of the blood in the subperiosteal region. The bridging veins which are there in the subperiosteal region, they rupture, and that is why the collection of blood is seen, right? So okay, so this is it. Okay, so चलो आगे चलते हैं. The image was that of hygroma. Okay, hygroma भी आया था, cystic hygroma. Somebody is saying, okay, this wasn't there. So cephal hematoma was not there. चलो कोई बात नहीं, ठीक है, आज हमने पढ़ लिया, ठीक है. Let's hope आपको ज़रूरत ही ना पड़े next time, to attempt again the FMG exam at least, and probably this will help you in your NEET PG examination. So let us get going forward. Anencephaly occurs due to inability of neural tube to close in which week of intrauterine life? So this was the question which was again given to me, and this was probably this was the first question which which was put in front of me कि मैम ये pediatrics से आया है. And I was so again glad because this was very clearly discussed in notes with you, that all the neural tube defects which are also referred to as dysraphism, in obviously anencephaly is a neural tube defect, occurs because of failure of neural tube to close spontaneously between the 3rd and 4th week of in utero development. So definitely over here the correct option is going to be 4th week of life. Yes, so 4th week of life, this is the correct option. And because the neural tube fails to close spontaneously between the 3rd and 4th week of intrauterine development, these were the options, and of which see, 3rd, there would be either one between them. Between 3rd and 4th week there should be the one option only. So if we just go by one option, there would be something either the 4th week or the 3rd week. Both options could not have been given in the question, right? So that we have to take care of. Okay, then next question which was which was given to me was, identify this child with the lump over here. Again we had discussed this question again in detail. I hope this was there in your paper, and this is this something which protrudes out of the abdomen and is covered by a covering. So this covering actually tells you that this is omphalocele. So I had seen in your chat ki omphalocele pe question tha. Of course we had again discussed omphalocele in our guess the paper series. I had given this question, identify the condition, ki bachcho सीधा सीधा ये question आता है. The distinguishing features would be that there would be intestinal loops, there can also be protrusion of organs like liver and spleen, but it would be covered by a membrane which we all know by the name of peritoneum. So if you have the peritoneal covering, then the diagnosis becomes omphalocele. Otherwise the diagnosis, if it is exposed, then the diagnosis becomes gastroschisis, right? So I hope this was there in your this thing. So I hope this question was there in the paper, and of course the correct answer to this is omphalocele, which I hope everyone has done it correctly, right? Okay, now let us move on to the next question. So the next question was, so this was the, we had discussed at that time difference between gastroschisis and omphalocele. Coming to the next question, stranger anxiety appears at what age? Again, bachon, stranger anxiety, I cannot see your chat actually. Okay. Okay, ma'am, omphalocele या omphalomyxantric cyst था. Okay. तो बच्चों अगर ये if the diagram given was this, then this is omphalocele. Omphalomyxantric duct होता है, that is something different, जिसमें कि अलग सा picture होगा, but this is definitely omphalocele over here, right? Chat नहीं दिख रहा मुझे, एक बार देखना. Okay, then stranger anxiety appears at what age? This was what was told to me. Was this the question there, guys? Please tell me, girls and guys sitting over there. Okay, so stranger anxiety, we all know, comes by the age of 6 to 7 months. Okay. सो स्ट्रेंजर एंजाइटी कम्स बिटवीन द एज ऑफ 6 to 7 months. अगर आपका ये क्वेश्चन आया है तो इसमें करेक्ट आंसर इज गोइंग टू बी द 6 months कि स्ट्रेंजर एंजाइटी, बच्चा स्ट्रेंजर को देख करके, अगेन वी हैड डिस्कस्ड इन गेस द पेपर सीरीज दैट यू नो स्ट्रेंजर एंजाइटी कम्स एट अराउंड 6 to 7 months, right? Okay, then I hope this question was there. The picture was not there, ma'am. Of course, yes, the picture was not there. तो डॉक्टर गरिमा क्या था, बिकॉज आई वॉज टोल्ड दैट स्ट्रेंजर एंजाइटी था. Okay, then next is features of angular cheilitis, stomatitis and glossitis is seen in which vitamin deficiency? तो बच्चों ये बताओ, विटामिन डेफिशिएंसी ये आया था क्या? ग्लोसाइटिस, cheilitis, angular cheilitis, this is seen in which vitamin deficiency? Was this the question? हाँ, आई एम कमिंग टू दैट. डॉक्टर असगर गोरी टेल्स मी वन हैंड ऑब्जेक्ट ट्रांसफर था, ठीक है, सोशल एक्टिविटीज नहीं थी. ओके ओके, वन हैंड ऑब्जेक्ट ट्रांसफर था एंड सोशल एक्टिविटीज नहीं थी. वी विल कम टू दैट क्वेश्चंस ऑल्सो, वो भी क्वेश्चन मैंने इंक्लूड किया है. ओके, सो बताओ फीचर्स ऑफ एंगुलर cheilitis, stomatitis, glossitis seen in which vitamin deficiency? Was this question there? If this question was there, again we have discussed, this is classic deficiency of vitamin B2, that is riboflavin. अब वो vitamin B2 था कि riboflavin था, वो मुझको you know आप नहीं पता कि ये ऑप्शंस में था कि नहीं. So if it was there, okay, so riboflavin, yes, Dr. Yashwant says riboflavin. Okay, yes, so this is riboflavin deficiency or vitamin B2 deficiency. Xerosis था, Dr. Rudra Sinha says xerosis था. अगर conjunctival xerosis है तो even conjunctival xerosis, remember, can be seen. Corneal vascularization and cataracts are a feature of vitamin B2 deficiency या riboflavin deficiency, ठीक है. and अगर एक night blindness का question था, वो तो सीधा सीधा vitamin A deficiency पे था, ठीक है. साथ में इस क्वेश्चन नेकलेस पैटर्न वाला क्वेश्चन, हाँ, कसाल नेकलेस वाला क्वेश्चन भी करेंगे, डोंट वरी, वो तो यू नो वी हैव इंक्लूडेड. ओके, देन विच, सो दिस इज द कसाल नेकलेस. क्या ये क्वेश्चन आया था जहाँ पे कसाल नेकलेस दिया हुआ है? दिस इज बिकॉज ऑफ विच विटामिन डेफिशिएंसी? डॉक्टर सोहेल खान, नेकलेस पैटर्न ऑल्सो इन द सेम क्वेश्चन, कसाल नेकलेस था. So this everybody knows कि अगर ये question आया था which vitamin deficiency was this, so this is because of, everybody knows this is because of niacin deficiency. अगर niacin नहीं लिखा था तो vitamin B3 deficiency लिखा होगा, so vitamin B3 deficiency था. ओके, ठीक है, niacin था. डॉक्टर अल्ताफ इज सेइंग niacin था. ओके, देन बर्निंग फीट सिंड्रोम इज ड्यू टू विच डेफिशिएंसी? क्या ये क्वेश्चन आया था? बिकॉज आई वॉज गिवन दिस इज अगेन बिकॉज ऑफ पैंटोथेनिक एसिड डेफिशिएंसी. डोंट वरी गाइज, ठीक है. अगर आपको लग रहा है दिस रिकॉल में सारे क्वेश्चंस इंक्लूडेड नहीं है, वी विल कम अप अगेन विद अ जेन्युइन रिकॉल. दिस इज व्हाट द स्टूडेंट्स गेव अस, वी हैव नॉट मैन्युफैक्चर्ड दीज क्वेश्चंस, राइट. सो बर्निंग फीट सिंड्रोम अगर आया था, सो दिस इज बिकॉज ऑफ द पैंटोथेनिक एसिड डेफिशिएंसी और एज वी ऑल नो यू नो विटामिन B5 डेफिशिएंसी. सो अगर बर्निंग फीट सिंड्रोम था तो ट्रिप्टोफान भी पूछा था. यस, सो अगर ट्रिप्टोफान, अगर ये पूछा था कि नियासिन किस से मैन्युफैक्चर होता है, तो वो ट्रिप्टोफान से होता है इन द बॉडी. बट रिमेंबर, ट्रिप्टोफान का 60 पार्ट्स ट्रिप्टोफान लगते हैं, तब जाके 1 मॉलिक्यूल ऑफ नियासिन मैन्युफैक्चर होता है. तो इट इज़ नॉट अ वेरी एफिशिएंट दिस थिंग मैन्युफैक्चरिंग टेकिंग प्लेस इन द बॉडी, ठीक है. तो कुछ कह रहे आया था, कुछ कह रहे नहीं आया था. चलो एनीवेज, तो बच्चों अगर नहीं भी आया था, यू नो जस्ट पे अटेंशन, दिस माइट कम, यू हैव मेनी एग्जाम्स टू गिव लेटर ऑन, नीट पीजी भी देना है, वहाँ पे आ जाएगा, कोई बात नहीं, नथिंग टू वरी. वी विल अगेन कम अप विद अ जेन्युइन रिकॉल, डोंट यू वरी, राइट. सो दिस इज बर्निंग फीट सिंड्रोम इज पैंटोथेनिक एसिड डेफिशिएंसी. फिर वन हैंड टू अनदर ट्रांसफर, ये अभी किसी ने बताया, साथ में था विद नो सोशल एक्टिविटीज, मतलब नो सोशल इंटरेक्शन. तो वी नो सी सोशल इंटरेक्शन यूजुअली स्ट्रेंजर एंजाइटी जैसे हम कहते हैं 6 to 7 months पे आता है, एंड वन हैंड टू अनदर हैंड ट्रांसफर कब आता है? 6 months पे आता है. तो यहाँ हमारा जेन्युइन सा आंसर यहाँ पे होगा 6 months, राइट. ओके, दो क्वेश्चन थे, वन वॉज ट्रिप्टोफान के बारे में एंड सेकेंड वॉज पेलेग्रा. तो बच्चों अबाउट ट्रिप्टोफान, थैंक यू डॉक्टर अल्ताफ. ट्रिप्टोफान के बारे में आई एम श्योर डॉक्टर अमित द बायोकेमिस्ट्री फैकल्टी विल डील विद इट. एंड जहाँ पे पेलेग्रा के बारे में था, डर्मेटाइटिस हो गया या कैसल नेकलेस हो गया, तो वहाँ पे वी हैव ऑलरेडी सीन कि दिस वॉज बिकॉज ऑफ नियासिन डेफिशिएंसी. सो वन हैंड टू अनदर हैंड ट्रांसफर्ड विद नो सोशल इंट्रैक्शन 6 months यहाँ पे होगा. ठीक है, कुछ और आप बता सकते हो. इफ यू वांट टू गिव सम अदर इनपुट्स, आई एम रेडी फॉर दैट. कमिंग टू द नेक्स्ट क्वेश्चन, नाइट ब्लाइंडनेस इज कॉज्ड बाय विच vitamin deficiency? So night blindness is caused by vitamin A deficiency. We all know this. We have already, this thing discussed it in detail. Night blindness आपके because of the WHO classification में भी आता है XNFS, and XN stands for night blindness. So that is because of vitamin A deficiency. Next was bleeding gums are a manifestation of which vitamin deficiency? Again this was vitamin C. It seems सारा vitamin के बारे में ही पूछ लिया है. ठीक है, any other pediatric questions अगर आए थे तो मुझे बताइए. ठीक है, we will discuss that. If you want to give me any inputs. ठीक है, अगर डायरिया पे कोई question I saw in the past कि कोई डायरिया पे question था. So क्या डायरिया पे कोई question था? अगर था तो प्लीज़ मुझे बताइए. Okay, any question on diarrhea? Okay. So Dr. Surbhi Gupta had given me a question. If jaundice persists beyond 2 weeks, so what do we think? Of course, you have to think about the prolonged jaundice, and prolonged jaundice में one of the common features or is the presence of a conjugated hyperbilirubinemia, and one of the reasons for conjugated hyperbilirubinemia is biliary atresia. तो अगर ऐसा कोई question आया था persistent jaundice के बारे में, persistent jaundice means persisting beyond 2 weeks of illness, then biliary atresia can be one of the differential diagnosis. So that's what we have just seen over here. Okay, then so Dr. Altaf is saying xerosis था, not night blindness. So we know that conjunctival, अगर conjunctival xerosis भी है, समझ लो ये हम अगर काट लें और conjunctival xerosis करें तो even conjunctival xerosis occurs because of your vitamin A deficiency, and that is your in fact stage 1A. We know this, right? तो उसमें भी vitamin A ही आएगा. Okay, फिर है ये था ही नहीं question. Yes ma'am, some stage was asked. Some stage of diarrhea was asked. So can you just tell me कि diarrhea में क्या क्या inputs दिए गए थे, क्या clinical features था, तो then I can help you. Somebody had said, so if the child, very importantly बच्चों, अगर if it was being mentioned in diarrhea that if the child is drinking eagerly water, then this is your some dehydration. Remember that. ठीक है, अगर drinking बिल्कुल भी नहीं थी, if the child was not in his senses, was stuporous, was drowsy, then this is severe dehydration. And if the child was not having other features of dehydration and was drinking normally, then it is most likely no dehydration. क्या कुछ और था? Can you help me with this? डायरिया डर्मेटाइटिस पे क्वेश्चन था विद नेकलेस पैटर्न, बट साथ में ग्लोसाइटिस भी था. इट वाज आस्क्ड अबाउट डेफिशिएंसी ऑफ विच. ओके, सो डॉक्टर सप्रम शुभम हैज मेड इट क्लियर दैट देयर वाज अ क्वेश्चन ऑन डायरिया डर्मेटाइटिस विद कैसल नेकलेस का पैटर्न, एंड साथ में ग्लोसाइटिस भी था. ऑफ कोर्स ग्लोसाइटिस कैन हैपन विद नाइसिन डेफिशिएंसी. इट आस्क्ड अबाउट विच विटामिन, सो देन यू हैव टू गो फॉर नाइसिन डेफिशिएंसी बिकॉज डायरिया डर्मेटाइटिस 3 Ds जो हमारी जो होती है, दे आर अ फीचर ऑफ नाइसिन डेफिशिएंसी, राइट? डायरिया, डर्मेटाइटिस एंड डिमेंशिया. सो ये तीनों Ds, 3 Ds आर अ फीचर ऑफ नाइसिन डेफिशिएंसी. सो गाइज, since you people are good number over here, so therefore obviously your recall, the recall which we get from here is more authentic. हमें handful of बच्चों ने recall दिया, so probably we are not up to the mark and we'll definitely come back. Okay, then child was thirsty to drink. Okay, अगर child was thirsty था तो then it is some dehydration, because thirsty, drinking eagerly, then that means that is some dehydration. ठीक है. Okay, so partner treatment. Okay, then congenital jaundice. Color child was thirsty. Ma'am, question was how many days jaundice should get resolved normally. So very good. Dr. Altaf is asking me, agar if this was the question, normally the jaundice gets resolved by 2 weeks. Okay, normally it is 10 to 15 days. So normally it should get resolved by 2 weeks, but there is no rule as such. It all depends upon in which scenario they are asking. Of course, if the jaundice persists beyond 15 days or 14 days or 2 weeks, then we call it prolonged jaundice, and then we have to look at what kind of jaundice it is there, whether this is conjugated hyperbilirubinemia or unconjugated hyperbilirubinemia, and then do investigations accordingly. But otherwise, please remember, definition of prolonged jaundice or persistent jaundice is jaundice persisting beyond 2 weeks of life, that is first 14 days of life के बाद भी अगर jaundice रहता है, then we have to look with a different angle, specifically focusing on congenital defects like biliary atresia or neonatal hepatitis, and the cause of neonatal hepatitis is intrauterine infections very notably. ठीक है, okay, फिर yes, 2 weeks is correct. Okay, Dr. Naushad Ali says 2 weeks is correct. Thank you, Dr. Naushad Ali. Anything else? Anything else you want to tell me? Any other questions from pediatrics? Beta trichomoniasis needed partner treatment. These, my next faculty is going to come, obs-gynae faculty would take over that question. Any other question of pediatrics if you want to discuss, kindly send me on the messaging and I'll definitely discuss it with you, right? So that is it from the pediatric recall. I apologize again if some questions were not matching. We would come up again with a definite recall, and then probably that would be more helpful to you. In the meanwhile, if you have any other more questions of pediatrics, then feel free to ask, right? Okay, you can put it on the chat and we will go through that, right? So that is it. Dr. Dipali Gupta, your pediatrics faculty from NExT, signing off. Thank you.
Okay, so hi, evening friends, evening everybody, bache, evening everybody. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemato-Oncology, AIMS Delhi. And अच्छा लग रहा है degrees बोल के. I am saying so because today you guys have given the paper. And very soon तुम्हारे name के आगे भी you're going to have these wonderful degrees in front of you. It always feels nice, पता है. So before I even start the pathology recall, before I even start the pathology discussion, we have talked with many students, we have gotten few reviews, but this is a very interactive session, so please do tell me, सबसे पहले how was the paper? What we have received is it was a moderate level paper. Mainly the questions that came as usual were from obs gynae. You had lots of questions, I guess about 30 to 35 questions from obs gynae. PSM बहुत सारा था, 30 to 35 questions. Path and micro were on the lower side. Path and micro was probably 6-7 questions. Path had about 10 to 12 questions and so on. But one thing is certain, जो हम लोगों की नैया पार लगाता है ना, it is always, see, when we get stuck, I am sure you guys know this, when we get stuck, we are usually stuck at a score of 135 to 140 to 149. This is the worst score to be stuck, and path, micro, pharma, ये वाले subjects ना हमारी नैया पार लगा देते हैं. So let us start with our pathology discussion. Good things happen in life. Our last time's result, the June mid-year 2023 result was on the lower side. I know many of you gave the paper last time, you attended again and you are giving it this time. But मुझे एक चीज़ पता है, and I am saying this with a lot of positivity. We are going to pass, and this result is going to be मतलब अच्छा सा 38-40% pass percentage. Let us actually keep our fingers crossed for this result. Give me a like or give me a heart if you agree with this positivity कि हाँ सर हमारा पेपर ठीक गया. So good things happen in life. Last time गड़बड़ हुआ था हमारे साथ. The pass percentage was hovering around 8-10%, but this time it's going to happen. Love is real. इस चीज़ पे I'm going to put a question mark. I'm a guy but ever hopeful. But this again is a fact. We will be okay in life. So, श्रेया बच्चे पैथ, आई नो थोड़ा सा ना पैथ के जैसे क्वेश्चंस पूछे गए. एक्चुअली श्रेया एंड मानसी, बच्चे जैसे पैथ के क्वेश्चंस पूछे गए ना, दे वर ऑन द एक्सट्रीम एंड्स. मतलब या तो बिल्कुल बेसिक कंसेप्ट से पूछा गया या अच्छे से पढ़ा हुआ. आई विल बी टेलिंग यू दोज. जैसे ऑक्ट 3 ऑक्ट 4 था. आई नो देखो, basics and concepts are always needed to be successful in life. There is no doubt. देखो, किसी को blame नहीं करना है. नहीं देखो, लाइफ में मुझे एक चीज़ पता है, हम लोग वॉरियर्स हैं, हम लोग फाइटर्स हैं. हम लोग ना लाइफ में कभी भी किसी को ब्लेम नहीं करते, पहली चीज़. दूसरी चीज़, वी आर नॉट गोइंग टू बी स्टक. हम अगर ठीक है पैथ में थोड़ा सा शुभम आए, 100% एग्री. क्वेश्चन थोड़े से डिवाइडेड थे एंड नहीं कोई बात नहीं. लेट अस स्टार्ट विद द डिस्कशन पार्ट. हम लोग किसी को कुछ ब्लेम नहीं करेंगे. लेट अस स्टार्ट. A young male with testicular lesion underwent high inguinal orchidectomy. ये वाला तो अपना PYQ था बच्चे. This was a PYQ because if in a young male if orchidectomy is being performed, तो obviously it is a tumor. So अगर nesting pattern नहीं भी पता तो भी कोई बात नहीं. OCT4 even if we don't know, doesn't matter. Most common testicular tumor, seminoma. So the answer was seminoma. Next, which gene is affected in reuters? I know this is where concepts and going in slight depth comes into picture. HLA-B27, हमें पता ही है. HLA-B27, ankylosing spondylitis, reactive arthritis, reuters syndrome and psoriatic arthropathy. मुझे ना साथ साथ में बताते जाना कि 10-12 ही आए. अंकित, I agree. Rajiv dost, these are the questions that we have gotten by the first recall. So question में कुछ भी variation है तो साथ साथ प्लीज मुझे चैट बॉक्स में बता देना. Next, Ankit, I know you personally also, दोस्त. I know you personally. So, I know path के questions कम आए, तुमने थोड़ा सा कोई बात नहीं, कोई बात नहीं. So, शुभम एंड डॉक्टर हेल्प बच्चे, जो भी क्वेश्चन में चेंज है और जो भी ऑप्शंस नहीं पता मुझे साथ साथ बता दो. Next question, net. This, acha, another thing that we saw was easy NEET PG questions were repeated. इसीलिए whenever we do a class, whenever I do a class with the FMG batch also, last day में ना last 3-year questions are always done. Okay, agreed. Seminoma का question नहीं था. ठीक है, agreed. This was a question that we got by recall. Fair enough. We take this out. Next. यार आई नो जो थोड़ा सा रिकॉल हुआ या आई कन्वे इट टू द मैनेजमेंट में एक बार बात कर लूँगा. आई कन्वे इट टू द मैनेजमेंट. बट आई नो कि इजी नीट पीजी क्वेश्चंस ना जो लास्ट 3 years के थे वो चीज़ें कवर होनी चाहिए थी. आई हैव अ टॉक. अभी हम लोग द ओल्डर स्टूडेंट्स एंड द स्टूडेंट्स जो हु हैव स्टडीड विद मी, लेट्स हैव अ लुक एट दैट. नेट न्यूट्रोफिल extracellular traps. Neutrophils are getting trapped extracellularly in a fibrillary meshwork. तो ये कहाँ पे देखा जाता है? Infections में देखा जाता है. It is seen in bacterial sepsis. I am telling you कि इसके right answers क्या क्या हैं. ये NEET PG last year NEET PG question था. इसमें nuclear DNA होता है. It was न्यूक्लियर डीएनए. फाइब्रोएडिनोमा की स्लाइड थी एक. ओके शुभम, मेरे पास दोस्त वो स्लाइड वाला नहीं है, बट आई हैव अ ब्रेस्ट क्वेश्चन, हम उस पर जाएंगे अभी. सो न्यूट्रोफिल एक्स्ट्रासेलुलर ट्रैप्स में न्यूट्रोफिल्स एंट्रैप हो जाते हैं फिब्रिलरी मेशवर्क में इन अ केस ऑफ बैक्टीरियल सेप्सिस. कौन सा न्यूट्रोफिल किल हो रहा है? क्योंकि न्यूट्रोफिल इज ट्राइंग टू किल द बैक्टीरिया. सो बैक्टीरिया भी कुछ न्यूट्रोफिल्स को किल करेगा, तो न्यूट्रोफिल का न्यूक्लियर डीएनए ट्रैप हो जाता है एंड इट इज अ साइट ऑफ एंटीबॉडी फॉर्मेशन. सो ऑटो इम्यून डिजीजेस कहाँ से, जैसे SLE की कहाँ से स्टार्ट होती हैं? न्यूट्रोफिल एक्स्ट्रासेलुलर ट्रैप से. नेक्स्ट, हर पेपर में एक फिलाडेल्फिया क्रोमोसोम के ऊपर तो क्वेश्चन आता ही है. फिलाडेल्फिया क्रोमोसोम, आई एम श्योर एवरीबडी वुड हैव बीन राइट. ट्रांसलोकेशन 922. प्रोटीन कौन सा बनता है? BCR, ABL. और इसमें वो क्लिनिकल बेस्ड क्वेश्चन भी आता है ना कि स्प्लिनोमेगेली, हाई TLC विद शिफ्ट टू लेफ्ट विद स्प्लिनोमेगेली, CML. तो ये वाला तो हम सबका ठीक होना ही था. नेक्स्ट, अब आई नो कि ये वाला क्वेश्चन, इसमें व्हाट हैपेंड वाज कि आइडेंटिफाई द इमेज. अब देख के ही पता चल रहा है कि ये कैंसर का इमेज है. सो स्क्वामस सेल कार्सिनोमा तो है नहीं, एडिनो कार्सिनोमा भी नहीं है. एडिनो में ग्लैंड बनते हैं, स्क्वामस में केराटिन पर्ल आता है. इसमें क्या आ रहा है? ब्लू कलर के सेल हैं विद पेरिफेरल पैलिसेडिंग ऑफ ट्यूमर सेल्स. बेसल सेल कार्सिनोमा. लास्ट ईयर्स नीट पीजी क्वेश्चन. रामेश्वर, आई नो दोस्त, बीच में हाँ FMG सेगमेंट में जो कुछ स्टूडेंट्स ने जिन्होंने नए, मतलब आई टुक द फर्स्ट बैच, जो नए स्टूडेंट्स ने ज्वाइन किया था, थोड़ा सा इशू आया. we'll have a talk. So identify the histopathological image. This is last year's NEET PG question. Peripheral palisading of tumor cells, that is basal cell carcinoma. Next question. Teenager was brought to OPD, delayed puberty with delayed secondary sexual characteristics, widely spaced nipples. Last year FMG का PYQ, Turner syndrome का diagnosis भी, examiner told you it is a case of Turner's. So mutation in chromosome, that is, it is trisomy 13. Fair enough. This is what Turner's looks like. You know that कि widely spaced nipples हैं, cubitus valgus है, peripheral edema at birth, प्राइमरी एमेनोरिया. सो एक और क्वेश्चन आया था जिसमें हाँ आके दोस्त ये वाली इमेज नहीं पूछी गई थी, बट द क्वेश्चन वाज कि टर्नर सिंड्रोम के फीचर्स कौन से हैं. तो उसमें देयर वाज एन ऑप्शन ऑन वेब्ड नेक कि टर्नर सिंड्रोम इज एसोसिएटेड विद वेब्ड नेक. एग्रीड. अगर 45XO होता लिखा हुआ तो दैट इज ऑल्सो टर्नर्स. Okay, Adnan, so tell me, Rameshwar, I am again saying this and I'll say this to everybody. बच्चे, you guys, चलो ठीक है, पैथोलॉजी में जो भी नए फैकल्टी ने जो भी पढ़ाया, जो भी नहीं पढ़ाया, जो भी था, कोई बात नहीं। जिन स्टूडेंट्स ने मेरे साथ पढ़ा है या रिकॉर्डेड आप देखा है, यू गाइज आर कंफर्टेबल। हम लोगों ने इजी वाले नीट पीजी के क्वेश्चंस भी, 3 जो क्वेश्चंस थे हमने वो भी करे हुए हैं। कुछ गड़बड़ नहीं होने वाला, डू नॉट वरी, मतलब नथिंग इज गोइंग टू गो रॉन्ग। द मोर पॉजिटिव वी आर इन लाइफ ना, जितना हम पॉजिटिविटी के साथ जिएंगे उतना हमारे साथ अच्छा होगा। आई नो कि ऑन द एग्जाम वाला दिन वी गाइज आर ऑलवेज की शिट, कि 2 दिन आके पढ़ा के गए या कुछ गड़बड़ किया उन्होंने, ये वो, कोई बात नहीं। शुभम एग्रीड दोस्त। टर्नर्स के 2 क्वेश्चन थे, अगर एक में 45 100 था तो वो आंसर बन गया, एक क्वेश्चन में क्लिनिकल फीचर्स थे, इसीलिए मैंने क्लिनिकल फीचर्स की स्लाइड दिखा दी। इट इज एसोसिएटेड विद लो वेब नेक, वाइडली स्पेस्ड निपल्स, स्ट्रीक ओवरीज, दैट इज प्राइमरी एमेनोरिया, cubitus valgus and peripheral edema at birth. This is Turner's. तो फीचर्स में हाँ विदाउट डायग्नोसिस। अच्छा मोहित परफेक्ट। तो क्लिनिकल फीचर्स लिखे हुए थे एंड उसके ऊपर कैरियोटाइप था 45 100। एग्रीड दोस्तों, एग्रीड। बट हमारा एक चीज ठीक है कि हमारा ये टर्नर्स के दोनों क्वेश्चन सही हो गए। सी एंड में ना हम लोगों को एक ही चीज से फर्क पड़ता है। आई नो, आई लव यू गाइज एंड आई लव यू एनफ टू से कि आई डोंट वांट टू सी यू एवर अगेन इन एन एफएमजी क्लास। हम लोग मिलेंगे नेक्स्ट टाइम और हम पीजी सेगमेंट में मिलेंगे, मतलब दिस इज अ फैक्ट। और ये चीज ना मैं बिल्कुल तुम्हें अपने मन से बता रहा हूं, दिस इज अ फैक्ट। नेक्स्ट, अब एक क्वेश्चन सिकल सेल एनीमिया पे आया हुआ था। सो इफ यू गाइस कैन रिकॉल कि क्या ऑप्शंस थे। फर्स्ट इज, आई विल टेल यू कि इसमें 6th कोडॉन, अगर कोडॉन म्यूटेशन कुछ लिखा हुआ है, पेशेंट रिपीटेड ब्लड ट्रांसफ्यूजन एंड गॉट हाइपोटेंशन। आई नो, कोई बात नहीं, आई नो बीच में फैकल्टीज रिप्लेस करना गड़बड़ था, थोड़ा गड़बड़ था। जय श्री बच्चे, आई नो पर्सनली I will convey this. Next, Shubham, iron deficiency anemia, increased TIBC. We have that question. This was 2022 NEET PG question. Parkinson's syndrome. जैसे ही सिकल सेल एनीमिया का हमारे पास वो आएगा, ऑप्शंस आएंगे, I will be telling you. Then is लिखा हुआ था कि पार्किंसंस डिजीज है, पेशेंट इज सफरिंग फ्रॉम पार्किंसंस डिजीज, आइडेंटिफाई द हिस्टोपैथोलॉजिकल फीचर। अगर तुम्हें पार्किंसंस में हिस्टोपैथोलॉजिकल फीचर नहीं भी पता, याद है हम लोगों ने लाइव क्लास में भी बॉडीज की लिस्ट बनाई थी। लुवी बॉडीज, पार्किंसंस डिजीज, लुवी इज पार्किंसंस। नेक्स्ट क्वेश्चन, Parkinson's, बच्चे, Shubham, Parkinson's is Lewy bodies. Next is 5-year child with lesion in right eye, flexner intestinal rosettes, Homer-right pseudo-rosettes, neuroblastoma, flexner intestinal rosettes, retinoblastoma. So Homer-right, अगर Homer-right rosettes आया है, then it is a case of neuroblastoma, flexner intestinal rosettes, retinoblastoma. एक ग्रे कलर का नो स्लाइड वॉज गिवन। अच्छा ठीक है, एग्रीड। पार्किंसंस में लेकिन लुवी बॉडीज लिखा तो हुआ था ना, सो इट इज अ केस ऑफ न्यूरोब्लास्टोमा। नेक्स्ट, ग्रे कलर वैक्यूटेनर यूज्ड फॉर ग्लूकोज मिक्स इज ग्रे कलर, तो इट इज G फॉर ग्रे, G फॉर ग्लूकोज, G फॉर ग्रे, G फॉर ग्लूकोज, पोटेशियम ऑक्सलेट एंड सोडियम फ्लोराइड। सो this is Sumit dost, this is the first recall. These are the options, these are the questions जो हम लोगों को बताए गए हैं. So this is what I am doing. I know some, because the faculty was changed, so we are slightly low, but this is the recall that I have received. Next, which is, अब ये वाला peripheral smear में I guess the image was, अगर सुमित मेरे दोस्त, अगर नहीं आए क्वेश्चन, देखो तुम दो चीज़ों को रियलाइज करो सुमित, अगर ये वाले क्वेश्चन नहीं आए तो तुम मुझे बताओ क्या आया है। बाकी आई हैव 165 स्टूडेंट्स हु आर एग्रीइंग कि ये वाले क्वेश्चंस आए हैं, या जो ऑप्शंस मेरे पास नहीं है दे आर एडिंग टू द ऑप्शंस। लाइफ हम लोग ना हमेशा पॉजिटिविटी से जी सकते हैं, सो नेगेटिविटी में नहीं। सो वी विल हैव टू बी पॉजिटिव इन लाइफ। फ्लोराइड अगर सिने ऑप्शन में था, देखो अगर सोडियम फ्लोराइड या सिर्फ फ्लोराइड भी ऑप्शन में लिखा हुआ है तो हमारा आंसर फ्लोराइड बन गया। एग्रीड। इमेज नहीं थी ठीक है गार्गी, इफ एनीमिया विद बिलो पेरिफेरल स्मीयर फाइंडिंग, इमेज नहीं थी, ठीक है, अगर वो हाइपर सेगमेंटेड न्यूट्रोफिल अगर उन लोगों ने वैसे लिखा हुआ है तो इट इज अ केस ऑफ मेगैलोब्लास्टिक एनीमिया। देखो बच्चे, एक वो आयरन डेफिशिएंसी एनीमिया वाला पिक्चर अलग है। अगर हाइपर सेगमेंटेड न्यूट्रोफिल, इफ दिस इज अ सिंपल केस ऑफ हाइपर सेगमेंटेड न्यूट्रोफिल, मोर देन 6 लोब्स इन वन न्यूट्रोफिल, तो वो बन गया मेगैलोब्लास्टिक एनीमिया। एक क्वेश्चन जो मुझे अभी रिकॉल में शुभम ने बताया है कि TIBC वाज इंक्रीज्ड, उसमें साथ में सीरम आयरन लो या कुछ वैसे भी था। अगर सीरम आयरन लो लिखा है तो TIBC इंक्रीज्ड है, सो वो केस बन गया आयरन डेफिशिएंसी का, आयरन डेफिशिएंसी एनीमिया। प्रोफाइल में एमी क्या क्या दिया था? ब्लड प्रोफाइल में TIBC अगर इंक्रीज्ड है, सीरम आयरन रिड्यूस्ड है, सो फैटीग की हिस्ट्री थी। एग्रीड दोस्त, अगर एनीमिया है, सी इन अ केस ऑफ एनीमिया फैटीग की हिस्ट्री थी। अगर वेजिटेरियन मदर है, सो सी आई कैन ओनली टेल यू कि दिस इज द रिकॉल वी गॉट, so proper recall questions with proper options. Obviously TIBC increased, that is iron deficiency anemia. Perfect. Transferrin भी reduced है, शुभम perfect दोस्त, serum transferrin is reduced, that is iron deficiency anemia. देखो दोस्तों, इस रिकॉल का सीरम आयरन reduced, ferritin reduced, TIBC and transferrin ठीक है। सो ओके, मेगैलोब्लास्टिक एनीमिया का नहीं था। आई नो थोड़ा सा ही यार मुझे नहीं पता, देखो मैंने वी विल हैव अ लुक, बट जो तुमने मुझे आयरन प्रोफाइल बताई है दैट वाज अ केस ऑफ आयरन डेफिशिएंसी एनीमिया। देखो दोस्तों, वेजिटेरियन मदर दूसरा क्वेश्चन था, तो 2 क्वेश्चन थे ना एनीमिया पे। सो वेजिटेरियन मदर हो गया B12 डेफिशिएंसी। देखो दोस्तों, सब कुछ छोड़ो, मैं कहता हूं सब छोड़ो, मुझे ना एक चीज पता है कि वी गाइज आर वॉरियर्स एंड हम लोगों को ना कोई दबा सकता है, कुछ कोई गलत कर सकता है, बट इन द एंड वी आर टुगेदर इन दिस जर्नी। आई कैन रिलेट टू योर सेंटिमेंट्स कि जिस दिन हम पेपर करके आते हैं ना, हम लोगों के सेंटिमेंट्स पीक पे होते हैं। एक आईडी का क्वेश्चन था, एग्रीड। तुम समझो मैं क्या कहना चाहता हूं, मतलब आई दोज ऑफ यू हु नो मी पर्सनली ना, आई से दिस कि जब मैं पेपर करने गया था उससे 3 दिन पहले आई वाज सो सेंटिमेंटल कि मैं अपने मेस वाले से झगड़ लिया था कि व्हाई हैव यू मेड सच बैड रोटीज, रोटी बनानी नहीं आती तो मैं कुक कर देता हूं यार। अवर सेंटिमेंट्स आर एट इट्स पीक ऑन द डे ऑफ द एग्जाम। रिजल्ट आएगा, सब कुछ अच्छा होगा एंड जिन्होंने जो भी किया, जो भी नहीं, व्हाटसोएवर, we are going to be winners in life and nobody can stop us on that. So on this positive note, bestest of luck dear friends. Thank you. ओके, आई नो कॉमेडी हमें नहीं देखने, वो हम जाकिर खान को देखेंगे कि कॉम्पिटिटिव एग्जाम्स को हम लोग अच्छे से पढ़ेंगे। डन। अच्छा गाइज, दीपाली मैम, आई विल बी गिविंग द माइक टू दीपाली मैम। डन, एंड वी विल बी इन टच। थैंक यू एंड टेक केयर।
Hi guys, so I just went back and saw the chat and there was one question I think which we did not discuss, and that was the color was asked about the dehydration. So I don't know whether you know this or not. There is, you know, there are 3 categories of dehydration: no, some and severe, right? So the color coding according to IMNCI is no dehydration, very easy to remember, this is green color, right? So no है, green है, everything is okay. Some dehydration का color होता है yellow और severe dehydration का color होता है pink. तो मैंने अभी जाके, you know, when I saw the chat and I saw that you know, now you were asking me about the color of dehydration which was asked in the exam, I wanted to clarify this was green, yellow and pink. Green, again I repeat, was for for no dehydration, and for some dehydration was yellow color, and for severe dehydration it was pink color. तो आपसे क्या पूछा गया था? I think the child was moderately thirsty, was drinking, was eager to drink. That means the child had some dehydration, and if they had asked the color, the correct answer in this case should be the yellow color. Right, so the yellow color goes for some dehydration. I hope that sets the things clear. Any other questions which you want for pediatrics to be discussed, kindly put it on the chat and we'll surely get back. Thank you. Now I am handing over the mic to my colleague Dr. Ankit. He will take over the anatomy recall questions. Thank you.
So, hello everyone. I hope the exams went well. Welcome to this recall session. So, recall session is basically for two people. एक तो जो एग्जाम दे के आए हैं, देख लो यार कितना सही है कितना नहीं है, एंड फॉर मेनली बट मोर इम्पॉर्टेंटली उनके लिए जो कि आगे एग्जाम देने वाले हैं, जो कि आपके जूनियर्स हैं, सो दैट दे गेट अ ग्रिप ऑफ द न्यू टॉपिक्स व्हिच आर बीइंग आस्क्ड एंड हाउ द क्वेश्चंस आर बीइंग आस्क्ड. वेलकम एवरीवन, आई एम डॉक्टर अंकित खंडेलवाल, योर फैकल्टी ऑफ एनाटॉमी इन NExT. एंड चलिए कुछ रिकॉल देखते हैं विदाउट वेस्टिंग एनी फर्दर टाइम. So here we start with anatomy. The question over here which recalls, पता है ये recall questions are from all the students over here. So first question over here is the location of the upper border of umbilicus. So जैसे we were discussing all the important topics में एक हमेशा होता है vertebral level. So here's the question, upper border of umbilicus. Now umbilicus, remember, अगर इसकी बात करें vertebral level की, जो कि हमारे वीडियोस में भी हमने एक्सप्लेन कर रखा है. So here we have the screenshot of the videos which you can see. So upper border of umbilicus, or you can say the umbilicus lies around L3 L4. एक नॉर्मल ह्यूमन बॉडी में अराउंड L3 L4 इज वेयर द अम्बिलिकस लाइज. सो अगर ऑप्शन ये थे और यू कैन को पता है, यू गाइस कैन गिव दी, अगर यू आर कॉन्फिडेंट कि सर ये ऑप्शंस थे, अगर यू आर 10% कॉन्फिडेंट तो डू राइट इन द कमेंट बॉक्स, तो अपन उसको थोड़ा सा एडिट कर लेंगे, है ना, तो उसकी देयर इज नो बिग इशू फॉर दैट पार्ट. सो ओवर हेयर अगर हम बात करें L4 की, सो इट इज अराउंड L4 वेयर वी हैव द अम्बिलिकस. ठीक है, इट इज अराउंड L4 वेयर वी हैव द अम्बिलिकस. अगर ऑप्शन L3 था, L3 वुड हैव बीन अ बेटर आंसर देन L4. ठीक है, L3 would have been a better answer than L4, so it is L3 L4 level we have the umbilicus. इतनी बात याद रखिए and then you are good to go. ठीक है भाई, चलिए तो एक क्वेश्चन ये हो गया. लेट्स मूव टू द सेकंड वन ओवर हियर, एनेनकेफेली. नाउ सम टॉपिक्स आर ऑलरेडी ओवरलैपिंग, सो आप परेशान मत होना कि ये दोबारा आ रहा है या फिर नहीं आ रहा है. सम टॉपिक्स माइट बी देयर. So anencephaly occurs due to inability of neural tube to close in which week of intrauterine life. So here are the screenshots we have covered. चलिए उसकी बात बाद में, but we have to know this question कि what they are trying to ask. So anencephaly is a, obviously we know it's a neural tube defect, है ना, and in the neural tube we know that we have what, we have a neural tube in which there are two openings. एक हो गया हमारा anterior neuropore and the other one is the posterior neuropore. Anencephaly is a defect in the cranial neuropore, है ना, anencephaly defect है cranial या anterior neuropore का, and this closes on which day? On day 25. Embryonic period में it closes on day 25. Now day 25 is which week? Is which week of intrauterine life? We all know. Weeks की बात करें तो till 7 days we have week 1, till 14th day we have week 2, till 21 day we have week 3. So it is week 4. It is week 4. So here we can say कि हाँ जी 4th week could have been the better answer over here. ठीक है ना? So this would be about the anencephaly question on neural tube defect. Embryology question है ये, and also can be discussed on other subjects as well. So perspectives of subjects का ले लीजिए. Coming to the next one, core anatomy question. कोर बोनी अटैचमेंट क्वेश्चन, बट रिमेंबर यहाँ पर हमें क्वेश्चन देख के हमें ये फॉर द जूनियर्स परेशान नहीं होना है कि सारी बोन याद करनी है। कुछ ही बोन्स हैं इंपॉर्टेंट बोन्स, एंड इन दोज बोन्स देयर आर फ्यू इंपॉर्टेंट फीचर्स, एक्सटर्नल फीचर्स, उस पर ध्यान देना होता है। फॉर एग्जांपल इन दिस क्वेश्चन दे आस्क्ड क्या विच मसल इज अटैच्ड टू द लेसर ट्रोकेंटर ऑफ फीमर। अब लेसर ट्रोकेंटर ऑफ फीमर में हियर इन द स्क्रीनशॉट्स वी हैव डिस्कस्ड there are two muscles which join, or the tendon which joins is the tendon is of iliopsoas। कौन सा टेंडन है? iliopsoas। it has the iliacus and a psoas major, है ना। तो देख लो उसमें से ऑप्शन कौन सा है। here we have the psoas as the option, therefore psoas बन जाएगा हमारा यहाँ पर, psoas बन जाएगा हमारा यहाँ पर the answer। about the other options भी देख लीजिए, the gluteus major, gluteus maximus होना चाहिए वैसे तो, gluteus maximus, medius minimus, they are joined where the gluteus maximus की अगर बात करें, the gluteus maximus joined the gluteal tuberosity also in the iliotibial tract। तो ये अलग हो गया, ये iliotibial tract and the gluteal tuberosity। the gluteus medius और minimus ये कहाँ जाते हैं? they join at the greater trochanter, है ना। lesser trochanter answer is the psoas। चलिए let's move ahead, the next recall, identify the bone। Now for those who have attended our classes, my classes particularly, I always say carpal tarsal पे ध्यान दो, focus on carpals and tarsals identification, and luckily this direct question from that part, identify करना पड़ता है, and here we have discussed many a times in our classes also। So already we all know the mnemonic goes from lateral to medial। अब इसमें lateral medial कैसे पहचाननी है? See the trick over here, the lower wider end ये radius होगी, forearm bone, and this one has to be the ulna। तो ये हो गया lateral side, this is the medial side। Now coming to the mnemonic क्या था? She looks too pretty, try to catch her। So here we have scaphoid, lunate, triquetral and pisiform। और अगर distal row में जाते हैं, if you go distal row, we have the trapezium, trapezoid, capitate and hamate। So if the arrow was on this bone, we know it is the bone, क्या नाम है इसका? trapezium। So here we have the answer over here as the trapezium। I hope all of you are giving the correct answers। तो याद रखिए carpals and tarsals, very important, and trapezium over here is the answer। This we all have discussed in our, अब you can look at the videos, you can see the classes, सब कुछ हो गया वहाँ पे डिस्कस। पर चलिए let us see other options or the questions over here। ear sinus develops from which pharyngeal arch। कुछ ऐसा क्वेश्चन था, you can write over here कि exact correct line क्या थी क्वेश्चन की, but there was a question। यहाँ important है बेटा आप लोगों को समझना कि हम टॉपिक पे ज्यादा ध्यान देना है। It will look mainly on the topics, है ना। क्वेश्चन की लैंग्वेज इधर हो सकती है, बट टॉपिक ध्यान दीजिए। टॉपिक we all know pharyngeal arches is the topic over here in this question। pharyngeal arches में we have the branchial cyst, branchial sinus, वो सब यहाँ बनते हैं, है ना। sinuses are developed over that part। तो किससे बनता है? obviously it is the pharyngeal arch 2, क्योंकि pharyngeal arch here we have discussed many a times। you can look in this image, ये इमेज में देख लो, the pharyngeal arch 2 is the one that is going down। pharyngeal arch 2 जाती है, यहाँ पर हमारे sinus बनने के the chances they have increased, है ना। all these are sinuses over here in these various images, so यहाँ पे they have increased, है ना। तो if the topic को ध्यान देना, pharyngeal arches is the topic। आर्चेस टॉपिक है, क्वेश्चन आया साइनस, प्रॉब्ली कुड हैव बीन ए ब्रैंकियल साइनस, उस तरह क्वेश्चन भी आते हैं। हियर वी हैव दिस pharyngeal arch 2 ओवर हियर। ठीक, चलिए लेट्स मूव टू द नेक्स्ट वन। और देखेंगे रिकॉल जनरल एनाटॉमी, सब टॉपिक ऑफ एनाटॉमी, 2-3 मेन टॉपिक्स हैं। द मोस्ट इंपॉर्टेंट टॉपिक इन जनरल एनाटॉमी इज जॉइंट, जॉइंट्स, बोन्स एंड जॉइंट्स, टाइप्स ऑफ जॉइंट्स। Here the question is carpometacarpal joint। The carpometacarpal joint, I am not sure कि which carpometacarpal joint, because there are 5 metacarpals। We have the first, second, third, fourth, fifth, 5 metacarpals हैं। But normally they ask, or the most important is the first CMC, first carpometacarpal joint, by which we know कि thumb का movement, why is thumb different from other fingers? Movement बहुत ज़्यादा है, because the joint over here, the joint over here is a multi-axial joint। Joint is a multi-axial, किस variety का है? Saddle variety। So answer over here, if they have asked about this carpometacarpal, first carpometacarpal, answer होगा आपका saddle। अगर let me clear that also, if they have asked about the second CMC joint or third CMC means carpometacarpal, then we could have thought of plain synovial। तो ये आपको ध्यान देना है। all have been discussed already in our videos। ठीक है, all have been discussed in the videos। तो याद रखिए यहाँ पर we have this, if they are asking the first CMC, then it is the our saddle, and if a second, third CMC are mainly the plain type of synovial joints। So this you have to remember। So let's see the next one। हाँ, again the evergreen question, evergreen topic we should say aphasias। Aphasias, and in anatomy हम पढ़ते हैं brain में और cerebral में what are the areas, what are the Brodmann's number areas, aphasias। So question कुछ इस तरह से आया था, the person who isn't able to speak has defect in which area of the brain। Now who isn't able to speak मतलब क्या? It is a motor aphasia। किस टाइप का aphasia? It is a motor aphasia। and these are few screenshots. मैं ये नहीं कह रहा हूँ, these are only few. We are discussing everywhere. जहाँ पर you can look at the previous YouTube में the question series, the gas series, और आप वीडियो देख लीजिए, हर जगह ये डिस्कस इन डिटेल इन एनाटॉमी particularly about the Broca's and the Wernicke's area. So motor aphasia टॉपिक है. motor aphasia किसकी वजह से होता है? which area? the Broca's area. the Broca's area. Broaden number क्या है इसका? anyone? Broaden number over here is 44, 45. है ना? So here we can go with the option as Broca's area over here. यहाँ पर आ जाएगा हमारा Broca's area. Right? Wernicke's aphasia is sensory aphasia. All the differences of Broca's, Wernicke's वो एक separate topic, but remember motor aphasia is Broca's. Broaden number 40, 45. अगर आपसे ये पूछा गया कि ब्रेन में कहां पर है, inferior frontal gyrus. Inferior frontal gyrus is the location where we have the Broca's area in our left, mainly dominant hemisphere. ये आपको ध्यान देना है. चलिए और देखें क्या है. Again evergreen topic. Evergreen topic कुछ नहीं कर सकते. Anatomical snuff box related question आना ही आना है. Which ligament or which ligament बोल दे, which tendon they would have been asked, which tendon or which ligament is found on the medial border. Basically क्या पूछ रहे हैं ये, what is the, do you know the boundaries of anatomical snuff box? So boundaries of anatomical snuff box medial border में क्या होती है? We have extensor pollicis longus. Somehow this image was given, not, I'm not sure, but here you can see the dissected part. So if they have asked you कि ये कौन सा tendon है, this is extensor pollicis longus. It forms the medial boundary of the anatomical snuff box. अब anatomical snuff box कहाँ है? It is right over here. ये area है anatomical snuff box का. These tendons over here, these are forming the lateral boundaries. कौन से tendons हैं ये? EPB, extensor pollicis brevis, and APL is abductor pollicis longus. अब must know evergreen topic for any exam, FMGE लो आप, NEET PG लो, कोई सा exam लो, anatomical snuff box. Many a times we have discussed it. I am sure the other options would have been abductor pollicis longus, extensor pollicis brevis, abductor pollicis brevis, इस तरह के और options होंगे, right? But over here, medial boundary is extensor pollicis longus. Let me tell you, अगर आप thumb extend करते हैं, you can feel this tendon. This tendon is going to the distal phalanx as well. चलिए खैर, चलिए let's see the other one. Identify the disease over here. Again overlapping topics, so don't worry. Now over here, if see, there are two things over here. Let me directly come to what we have discussed already. If you have a amniotic membrane covering, ठीक है, if you have amniotic membrane covering, it is probably omphalocele. अगर वो नहीं है, अगर सीधे आपको पूरा गट सामने दिख रहा है, it is probably a gastroschisis, है ना? I am sure that the recall we have got, there was an amnion covering over it. The answer would have been through the omphalocele over here. ठीक है? So omphalocele gastroschisis, the differences between these two conditions is very important, very commonly asked. So ये भी हमें ध्यान देनी है. High yield topic है, important topic है, has been asked many a times, right? चलिए, let's see any others. Heart ventricles, there was a question. I'm not sure क्या question था, but if they would have asked you to identify कौन सा ventricle right है कि left है, we all should know that left ventricle thickness is around 3 times than the right ventricle thickness. In this image, sort of image जो दी हुई है, so exact recall अभी हो जाएगा कुछ time में, but obviously this is the LV and this is the RV, right ventricle. LV we all know because it has to pump blood to the whole body, so resistance ज़्यादा है, so the muscles are more thicker in layer, वहाँ पर जो हमारे left ventricle है, ठीक है? So about that. Now coming to another question. Now this topic again, topic क्या है यहाँ पर? topic को ध्यान देना है. The topic over here is ever inguinal canal हो गया, inguinal hernia हो गया. This is the topic. I'm sure in surgery also the clinical part of inguinal hernia has been asked. पूछते ही पूछते हैं. It is a must ask topic, है ना? पूछे तो lateral boundary of Hasselbeck's triangle they have asked this time. So Hasselbeck's triangle again you can see over here in the discussions we have discussed it number of times. Okay, है important, क्या कर सकते हैं? So lateral boundary क्या है? If we try to draw a inguinal canal over here, है ना? And over here we see this muscle is the rectus abdominis. यहाँ से just medial to the deep inguinal ring we have an artery going above. ठीक है? Where is Hasselbeck's triangle? This is the Hasselbeck's triangle. तो lateral medial क्या है? This is the medial side, that is the lateral side. This is the lateral boundary. Which vessel it is? It is inferior epigastric artery or inferior epigastric vessel. Here we have the option. We can go with inferior epigastric. Do remember it is a branch of external ilia कि आगे भी आ सकता है ना? So topic क्या है? Inguinal canal anatomy inguinal canal. So that was this question. Carotid artery felt at, I mean there could be have been other options over here, but carotid artery कहाँ मिलती है? Obviously we feel it over here. याद रखो over here that we have a hyoid bone. If I draw it like this, then below this we have this thyroid cartilage. We have the thyroid cartilage and below we have the cricoid cartilage. Do remember the common carotid artery is bifurcating at the upper border of thyroid cartilage. अब उन्होंने कहा carotid artery है ना, carotid artery, obviously this is the area where we have the laryngeal prominence. यहाँ पर क्या बना, this is the laryngeal prominence area, so obviously just lateral to it on both the sides. On both the sides we can feel its pulsation. अब angle of mandible ये रहा, angle of mandible slightly more posterior, है ना, though at the lower border of mandible we feel another artery, कौन सी है, here we feel the facial artery, right? So probably if we look at the other options, or we can, or when we will get the complete, complete framework of the question and the options, then we could have reach a better answer over here. But remember the topic क्या है, topic याद रखिए, topic asked यहाँ पर था, do you know where the pulsating arteries, do we know what is the surface marking? जितनी body में 9-10 arteries which we can easily palpate, है ना, palpating arteries, not the pulsating but the palpating arteries, we should know where is their exact location. So palpable जितनी भी arteries हैं, 9 arteries or 10 arteries on one side, same on the other side. So here they ask about the carotid artery. Again a high topic, याद रखिए. Next, very good question. Very good question. Identify the given arrowed tendon. I am not sure कि tendon यहाँ पर किस तरह से आया था, but fine. Okay, I am just started to. Okay, so the tendon over here, है ना. So always do remember tendons in front of the wrist. Tendons in front of the wrist. ये मैं जानना, this already we have discussed over here. Now tendons in front of the wrist. Previous there was a question that was asked about the radial artery. We all can feel the radial artery. Radial artery lies lateral to which tendon has been a very famous question. The radial artery lies lateral to flexor carpi radialis, that is on the lateral aspect of the wrist. So अगर arrow हमारा lateral side में है, on the wrist arrow is on the lateral side towards the thumb side, वहां पे tendon पूछ रहे हैं, tendon is probably the flexor carpi radialis. अगर arrow बीच में आ रहा है, on the, you can say in the middle of the width of the wrist, it could have been a palmaris longus tendon. Arrow अगर medial जा रहा है, it could have been a flexor carpi ulnaris. If the arrow probably was on the lateral side, then we could think of the flexor carpi radialis over here. And remember, उसके just lateral में, just lateral to it, this location we will have the radial artery that we normally palpate over here. Another beautiful question, right? Okay, so these were the important questions, and I hope the important topics that we have covered. All the rest, remember topics याद रखिए, टॉपिक्स संभाल के रखिए. यही टॉपिक्स हैं, हाई टॉपिक्स जो कि आने वाले 6 महीने, साल, 2 साल, इन्हीं की चर्चा होगी. विल बी डिस्कसिंग अराउंड दीज ओनली, बिकॉज दीज हैव सडनली बिकम वीवीआईपीस हो गए. चलिए, दैट्स ऑल फ्रॉम माय साइड. आई विश यू ऑल द बेस्ट फॉर योर रिजल्ट्स. सी यू वेरी सून विद फ्लाइंग कलर्स. दैट्स ऑल, एंड थैंक यू फॉर योर टाइम. मेरा वो तो दिया ही नहीं, मैं सब Hi dear students, I'm audible. So hello everyone. So this time there were a lot of questions from biochemistry, and I hope they were all doable, right? There were a lot of questions from vitamins, right? A lot of questions from the other topics. So definitely there were a lot of questions, but I am able to collect right now few questions, and I believe that you will be able to just add on some more questions to my this PPT, right? And once I have all the questions together, I will come up with more detailed discussion later on, right? And before that, I believe that you all guys will pass the exams, right? So let's take a look. Okay. So our first question is a patient, so probably this has been discussed already. A patient come with a glossitis, cheilitis and burning sensation in the feet. So this condition is found in which of the following? So guys, the answer for this probably, because looking at the question, glossitis and cheilitis is there, that is angular stomatitis can also be there, and guys peripheral neuropathy, that is burning sensation, is peripheral neuropathy. Okay, so the best answer here is riboflavin. Okay, riboflavin. Guys, riboflavin present with the triad of the three symptoms. What are the three symptoms we have? The three symptoms we have is, number one is glossitis, right? We can remember a mnemonic, that is great flavor. So flavor means riboflavin, and glossitis, then guys, glutathione reductase test is also there. Fine. But what we have to remember is the three symptoms: glossitis, cheilitis and corneal neovascularization. So these are the 3 points only that we have to remember. Okay, and if there was a separate question on the burning feet syndrome, then B5 or the pantothenate was the answer, right? Probably that will be the answer. Correct, guys? If there was a separate question on burning feet syndrome, then it will be the answer. And guys, if there is a question only on peripheral neuropathy or the burning feet sensation, so that burning feet syndrome is a different thing, burning feet sensation is a different thing. Burning feet syndrome is B5 or pantothenate, right? B5, 5, so feet has 5 fingers, just remember like that. But burning sensation, that means it's a peripheral neuropathy. And guys, peripheral neuropathy more commonly occurs because of B12 deficiency, which is not in the option right now. But B12 is one of the most common cause I have to answer. If this question you see anywhere in future, B12 is the best answer for peripheral neuropathies like burning sensations, right? In feet, in fingers, in thumbs, wherever it is, right? Okay. Guys, next question is niacin is derived from. So the answer for this question, again a question which is very common and very repeated PYQ, that is tryptophan. Right, 60 milligrams of tryptophan gives us 1 milligram of niacin. So we have discussed that already in class. So most of the questions that we have here, we have already discussed them in class. Right, which of the following amino acid, was this the question? Guys, you can always correct me if something is, okay, if something is not there. Yes, if this question is incomplete, then please let me know. There were two questions on niacin, right? There were two questions. One was they asked the name of the amino acid, or if there were similar question, then it was, guys, the necklace type of dermatitis, right? This was given, that is Castle's necklace. Okay, if this was a one question, then again tryptophan is the answer. Correct. So guys, I request you, if you find the question is, if you see the question is incomplete, then I'll be glad to add the points here. Fine. Okay. Which of the following amino acid helps? So this question I have discussed so many times in classes also, that purines and pyrimidine, they differ in the glycine, if this was the question exactly. So guys, the answer will be option number A, aspartate, glutamate and glycine. Glycine is not required in pyrimidines. Okay, pyrimidines do not require any glycine. So that is the only difference, right, between the purines and pyrimidines, if I say regarding the sources of nitrogen or amino acids, right? Okay. For exome sequencing, okay, what were the options, Divya? Let me know. If there was a question on genome sequencing or exome sequencing, what was the options were given? Okay, this is a very simple question now. Skeletal muscles and adipose tissues have which GLUT? So some students said that insulin dependent was also mentioned, so answer is GLUT4, right? Even the heart has the GLUT4. So again a very common and repeated PYQ this was. So guys, answer is GLUT4 here. Clear? When a child has a thick skin, right, that is something that we don't know, right? But we know the ear pinna hyperpigmentation, right? And you know, hyperpigmentation is seen out of the three options here what I have. The only disease where the hyperpigmentation is seen is the alkaptonuria, right? So even if I don't know about ear pinna, but if I remember hyperpigmentation, that yes, definitely, you know, on the palms, on the soles, on the ear pinna, on the tip of the nose, right? So there are a lot of areas where the hyperpigmentation can occur. So that is alkaptonuria, right guys? O-chronosis is the other name. So if alkaptonuria is not mentioned, then O-chronosis is the other name for the same disease. Fine guys? Okay. Fine. GAG, what was the question, Rakshit? Please let me know. What was the question on Pellagra question, exome sequencing? Divya, let me know the question on exome sequencing. They asked the technique or something else. What was the question? So if they ask a technique like, you know, sequencing of the, a DNA nowadays we can do by the next generation sequencing, NGS, next generation sequencing, or we can do Sanger sequencing. There are a lot of techniques are available. So what was the option basically that matters? Okay. So a type 2 diabetic patient comes to the family doctor and is found to have a very high cholesterol levels. The doctor prescribed a drug which inhibits the rate limiting enzyme. So guys, what is the rate limiting enzyme of the cholesterol synthesis? That is the HMG-CoA reductase. Statins inhibit this enzyme. Clear? We all know this. HMG-CoA synthase, right guys, this is the enzyme which is also found in cholesterol synthesis, but it is not rate limiting. But guys, this is the rate limiting enzyme of the ketone body synthesis, right? For the ketone synthesis. So that is the rate limiting enzyme, okay, for the ketone synthesis. Clear? Fine. Lyase again is not, it is part of the only, what you can say is ketone synthesis, not the part of cholesterol synthesis, right? But what is the common between ketone and cholesterol? That is HMG-CoA synthase. Correct guys? ये question नहीं था. Okay. So please correct me. What was the exact question? It was Ishtiyaq Alam. Please let me know. Right in the comment section. But yes, there was a question regarding the HMG-CoA reductase. A person present with a necklace like so, guys. This question we have already discussed. If it was a one question only, then answer is again tryptophan. Okay. A patient, guys, this question I need your help. I have taken this question deliberately because I got no options here, right? But the question says that it has patient has hyperammonemia. See guys, hyperammonemia, yes, then it can be urea cycle disorder. If it is hyperammonemia only, right? But guys, in urea cycle disorder, there is no lactic acidosis, okay? There is actually, you know, if I say increased ammonia levels, yes, urea cycle disorder. Then guys, there is a respiratory alkalosis. You know why? Because what happens, the ammonia damages the brain and induces hyperventilation, and because of hyperventilation and CO2 washout, the respiratory alkalosis occurs in urea cycle disorders, not the lactic acidosis. So this cannot be the answer, right? Then again the patient has jaundice, and again the urea cycle disorder patient doesn't present with jaundice, right? Okay, there even the LFT may not be deranged, correct? So I don't know what exactly was the question, but why I took this question to tell you that urea cycle disorder present with hyperammonemia plus respiratory alkalosis, okay, not with any acidosis. So please remember this always, right? Okay, this can help in your future exams like NEET PG and all. So remember this. Fine. Okay. Then guys, other symptoms are also required, like there is a hypoglycemia or not, something like that. So if there is a hyperammonemia, lactic acidosis, hypoglycemia, then it can be PDH deficiency.
congenital lactic acidosis. Age of the patient is also not given. So there are a lot of things missing here, but yes, remember it's not urea cycle disorder. Okay, if this was the MCQ, then it is not urea cycle disorder. Okay, chalo. Guys, bleeding gum again, it's very simple, vitamin C. And what is the other feature of vitamin C deficiency that you must know? That is perifollicular hemorrhage, that is bleeding around the hair follicle. Okay, so this is actually very important one, perifollicular hemorrhage. So if this was bleeding gum, then vitamin C is very simple answer. Guys, this was a very simple question again, that they simply asked that which of the following cell cycle stage has DNA synthesis. So obviously S phase, synthetic phase, right? DNA replication, I mean to say DNA synthesis occurs in S phase of the cell cycle, right? So that will be our correct answer, right guys? Okay, so these were the questions, right, that I found in a correct state with some options. There were some more questions, right, that I have not included. There was some question on like which of the following is a mitochondrial enzyme. So can anyone just can anyone mention the name of enzyme of mitochondria? Guys, gray vacuum thinner, there was a question, and fluoride must be the answer there, right? Fluoride. And okay, so if you have any other questions, then please let me know. These are the questions which were because I consulted with multiple students and they said these were the questions available. Well, I'll come back again with all the detailed, questions and answers, right? Till then, I wish you all the best. So stay calm and enjoy your time. Bye-bye. Done. बच्चे अब
Hello students, good evening. I hope you have done your paper very well and many questions have come from the guest paper series which we have discussed on the NExT live. Okay, so I am Dr. Harmeet Goyal. I am taking up your Obs and Gynae faculty. I am taking up the Obs Gynae recall questions which I have collected from the students. So you can keep on adding your comments on the chat box. like if there is any additions in the questions, because you are the ones who have given the exam, so you are a better judge what were the exact form of the questions. So whatever I could collect from the students, I have added up those questions, and many of the questions I have got it from the students. So first question in obs and gynae was 22 weeks contraceptive failure came for abortion. New MTP Act, that is New MTP Act 2020. The upper limit for MTP is 24 weeks. It is as it is question which we have been discussing in the guest paper series as well as in the rapid fire revision of obs and gynae, as well as the previous 5 years PYQs, as well as in my class. So I hope most of you must have done it very correctly. A very good evening to all of you, those who have just joined, and I'm just looking at your comments. So what correct answer you have marked? So I have already told you when during the session in the MTP Act, opinion of one doctor is needed when MTP is to be done up to 20 weeks. Okay, when MTP is to be done from 20 to 24 weeks, then opinion of 2 doctors is required. Okay, so the correct answer is opinion of 2 doctors is required. If the pregnancy goes beyond 24 weeks, it is a case of rape, a special case, a rape victim, then what is to be done? That case where the pregnancy has gone beyond 24 weeks, that goes to the medical board, and medical board consists of a gynecologist, a pediatrician, a radiologist, and a gazetted officer appointed by the state or union territory. So the correct answer to this question is opinion of 2 doctors is needed. We will not mark the answer as this, take the permission of medical board. Medical board permission is needed when there are special cases like rape victim and the pregnancy has gone beyond 24 weeks. In that case, legally the doctor cannot do MTP. The medical board, which consists of a gynecologist, a radiologist, a pediatrician, and a gazetted officer appointed by the state or the union territory, will decide. Okay. Next question, question number 2. AMSELS criteria is used for. Again, AMSELS criteria I have been discussing in my session on vaginitis, that is a genital tract infection, where in the vaginal discharge I discussed about trichomoniasis. 3 questions have come from this small topic. That is why whenever I take up a session, I always tell the students we should focus, as we are focusing on the long topics, we should focus on the small topics as well. And there are 3 questions, one is on the candida, and one is on the bacterial vaginosis, and one is on the trichomoniasis, right? Am I right, students? So trichomoniasis, second one I taught you was the candidiasis, and third one I taught you is the bacterial vaginosis. And in the cervicitis, that is part 2 of the genital infection, I discussed about gonococcal infection and I talked about chlamydia, because these 2 organisms are responsible for cervicitis. Fine. And these are the organisms which are causing the ascending infection, sexually transmitted, and they can cause, except the bacterial vaginosis. Bacterial vaginosis occurs whenever the lactobacillus, which is the normal flora of the vagina, that has been replaced by the Gardnerella vaginalis, Mycoplasma, and other microorganisms. Fine. So AMSELS criteria is seen in bacterial vaginosis. What is AMSELS criteria? AMSELS criteria is when pH is more than 4.5, clue cells are seen in the sample made from the vaginal discharge, and like we see under the microscope, so the cells and there are bacteria attached. That is what is then image of the clue cells. Number 3 is the whiff test is positive in bacterial vaginosis. What is whiff test? You take the sample and you add KOH and there is a fishy smell. Fishy smell. So that is what is Amsell's criteria for bacterial vaginosis. Now next question, question number 3. A pregnant female with asthma and hypertension, which drugs can be given? So they are asking about hypertension occurring in pregnancy, and we have already discussed hypertension occurring in pregnancy. Labetalol is the drug of choice if it is like preeclampsia, and number 2, when it is hypertensive crisis, even then we prefer giving the labetalol because it is an alpha beta blocker, and this drug labetalol can be given by oral route or by the IV route. ACE inhibitors are totally contraindicated in pregnancy. It is contraindicated in first trimester because it causes teratogenic effect, that is proven. It is also contraindicated in second and third trimester because it causes placental insufficiency leading to fetal hypoxia. So whenever you get stuck up, okay, so try to rule out the options. Okay, nifedipine is preferred in pregnancy, but we will not be preferring in this case. IV labetalol we will only give when there is a very acutely raised blood pressure. So in this case, according to me, if these options were given, then oral labetalol should be the preferred answer. Moreover, it will be discussed by the pharma faculty. Next, malaria falciparum in pregnancy. What is the drug that is preferred? What is your answer in this question? What have you marked, students? Malaria falciparum, malaria in pregnancy. The options given to me are quinine, primaquine. What have you marked? Yes, it is the quinine which is preferred drug. Next, a mentally ill pregnant female who will give the consent for MTP? Who will give the consent for MTP? Is it the doctor consent? No. If she is mentally challenged, then patient cannot give the consent for herself. Then among the guardian or legal parents, were these two options given in the exam? Students, you have to write down in the chat box. Guardian as well as the legal parents were written in the option. Okay. Was guardian or legal parents both were given in the option? Because what I feel, there might have been one. Okay, so what is the exact language of question? You can tell me, Dr. Ansari. Okay. Husband consent will not be considered in case it is, like mentally ill patient. Okay, there was no legal guardian was written. Legal guardian was written. So if it is, was the age of the patient mentioned in the question? Was the age mentioned in the question? Acha, legal guardian asked together. And doctor was written in the option, self was written, doctor and self are almost ruled out. Is it legal guardian and husband? These were the options in the exam question, husband or partner. See, there are different answers students are writing. See, self and doctor is ruled out. So what have you marked as the answer? What have you marked was the answer? Legal guardian was there in the option. I think then if legal guardian was there in the option, then I think See, students, different students are writing different options. How should I select? See, if husband was written, husband can also be the correct answer. If husband was not written, just the partner was written, then I think that we should mark legal guardian. So this is still query because students are confused whether legal guardian was written or the parents were written or it is the husband. So I move on to the next question. If I get the correct options, again we can take up this question again. So next question is 25-year-old lady came to OPD with unprotected sex. After 5 days, what is the most likely contraception that is suggested? So postcoital contraception everybody knows, and we have been discussing in our session that contraception, disorders of menstruation, gynae questions are very, very important, and you can get full out of full questions very correctly. See, if Dr. Tanu is writing partner, legal guardian, doctor and self, so I would mark legal guardian as my answer. I would mark legal guardian as my answer. Okay. Okay, so legal guardian will be the answer. If there is any confusion, you can ask from the FMT faculty, forensic medicine. Okay. So let us take up this question. Postcoital contraception, that is emergency contraception, is of two types. It is hormonal, that is to be given within 72 hours of unprotected coitus, and it is IUCD, that is to be given within 5 days of unprotected coitus. Now in the hormonal, it is the LNG pill which is been given, and it is a single dose. Number 2, it is OCPs. Number 3, it is Arufuratex. So since the history is she has come 5 days after unprotected coitus, okay, is it 5 days or it is before? So misoprostol is never a drug for emergency contraception. OCPs, levonorgestrel pill is almost ruled out, so answer will be the IUCD, that is Copper-T. Copper-T is the best emergency contraception because we do not know that this act of coitus has led to fertilization or not. Even if the fertilization has taken place, the mechanism of action of IUCD as a contraceptive is it prevents implantation. Okay, so IUCD, that is Copper-T. And also remember that Mirena is not an emergency contraception. If you talk about IUCD, then it is Copper-T. Fine. Now which other emergency contraception can be given within 5 days of unprotected coitus? That is Ulipristal. 30 mg is the dose, and it is given in 5 days of unprotected coitus, which is selective progesterone receptor modulator. Okay, but availability is a problem, so we prefer putting up the IUCD if it is, you know, like crossed 72 hours of unprotected coitus. But if in India the most acceptable emergency contraception is levonorgestrel pill. But since it has come after, you know, like 72 hours, so levonorgestrel pill cannot be given. Next, question number 7. McRoberts maneuver was failed. The question was, a pregnant lady has delivered, is delivering, and there is a shoulder dystocia that happened. So that means it must have been a macrosomia baby, and it must have been an unbooked patient जिसने कभी कोई antenatal checkup नहीं कराया, कोई ultrasound नहीं कराया. She has just come up in the labor room for delivery. So in that case, the head of the baby is born and the shoulders are the one which get stuck up. So this is called as shoulder dystocia. कि shoulder से deliver नहीं हो रही है because the weight of the baby is more. Okay, so the base acromion diameter is more than the diameter of the maternal pelvis. So the first maneuver that is to be done is a McRoberts maneuver. McRoberts maneuver. In McRoberts maneuver, we do the flexion of the thigh and abduction. Flexion and abduction of the thigh of the mother so as to increase the space so that shoulders can be delivered. But if it has failed, the next maneuver that should be done is the Wood's corkscrew maneuver. So answer to this question according to the options given to me are Wood's corkscrew maneuver. If Mac-Roberts maneuver fail, then Wood's corkscrew maneuver should be tried. Question number 8. In which infection treatment for both the partner is needed? Bacterial vaginosis? No. Bacterial vaginosis is not STD. So trichomoniasis is the answer, where treatment of the partner is also needed, and we give tablet metronidazole 400 milligrams BD for 7 days to both partners, and it is STD, sexually transmitted disease. What type of discharge is seen in trichomoniasis is greenish color vaginal discharge. There are strawberry spots in the vagina, and it is STD. Organism is actively motile. It is flagellated microorganism, and itching is the most common feature. Itching is present, whereas itching is absent in bacterial vaginosis. Okay. Next. Question number 9. A female of 80 years age used to do strenuous exercise and complaining of involuntary passage of urine during the workout. So that is what is stress urinary incontinence. So this must have been a case of genital prolapse. Genital prolapse occurs because of the atonicity and asthenia. Atonicity and asthenia occurring after menopause. Atonicity and asthenia occurring after menopause. Okay. So the ligaments have become lax. So there is a bladder neck which is prolapsing in the vagina, that is leading to stress urinary incontinence. That means whenever the lady coughs, laughs, strains, she urinates. Now what is the treatment for stress urinary incontinence is TOT or TVT, transobturator tape or transvaginal tape, which has been put. Next. Question number 10. A pregnant woman feeling like fainting while lying down, but it's better while sitting or turning to the side. So which compression occurs? So when there is a pregnant lady, okay, there is gravid uterus. There is gravid uterus which is compressing upon the inferior vena cava. Gravid uterus which is containing the baby, so that is compressing upon the inferior vena cava, so the venous return to the heart is decreased. So female has a feeling of like fainting sensation or a syncope like of sensation. So it is always advisable that the pregnant lady should lie down or take rest in left lateral position, so as to avoid the inferior vena cava compression. So the answer to this question is inferior vena cava compression. I hope you must have written it very correctly. Question number 11. Folic acid therapeutic dose. Now students, I really want to know what are the other two options in this case. Therapeutic dose of folic acid is 4 mg and it is given in the first trimester of pregnancy. And if your patient is a case of already diabetic, that means pre-gestational diabetes mellitus, and she is planning a pregnancy. So always it is advised to start 2-3 months a dose of folic acid, that is therapeutic dose 4 milligram, and she should continue in the first trimester. Or if there is history of any neural tube defects or history of previously an anencephaly baby or any history of congenital malformation, then she should start at least 2 2-3 months before planning the pregnancy and continue in the first trimester. Now, what are the other third and fourth option given in the question? Was something like abruptio placentae written in the option, or was neural tube defect written in the option, abruptio placentae written in the option, or something like IUGR written in the option? What was the other options? What were the other options? Because folic acid, you know, like you gave when there is some history of diabetes or blood sugar were raised before planning the pregnancy, or history of you know, like she is a diabetic patient and now she wants to plan the pregnancy, or if there is a history of delivery of a previously, you know, like neural tube defect baby, something like other. So what are the other two options? Unless until the other two options are given, it will be difficult for me to tell you, because folic acid we give as a, you know, like in combination with you know, like with iron, that is iron folic acid combination from the second trimester, in the third trimester and in the lactation. First trimester we give it as it is, okay, just to prevent the neural tube defects, but there has to be a history. Diabetic tha, so if diabetic was there in the option, so the correct answer will be diabetes, because there is a risk of congenital malformations, okay. Yes, there is a history of caudal regression syndrome, that is what is diabetes. Either there is a history of a baby of caudal regression syndrome. Caudal regression syndrome is very characteristic feature. If a baby born with caudal regression syndrome, 100% his mother is going to be diabetic. So if diabetes was given, that is the correct answer, or if caudal regression syndrome in the previous delivery was given, that is the correct option. Fine. Next. Question number 12. Students, you are the better judge, because you are the ones who are giving the exam, and we are just, you know, like according to what questions you send us for recall, only that we are discussing it here. Fine. So, next question. A female presents with curdy white vaginal discharge, and organism causing this condition presents with pseudohyphae. Identify what is the disease. Is it Gardnerella vaginalis, trichomoniasis, or candidiasis? I think it is a simple straightforward question. Thick curdy white vaginal discharge is candidiasis, okay. And in the microscopic examination you see pseudohyphae, you see a pseudohyphae, that is a fungal infection. Now candidiasis is common if the patient is pregnant and she is having vaginal discharge, in diabetics, in HIV positive and immunocompromised patients. Fine. Then fungal infection like vaginal candidiasis is common. Itching is also an important feature. So here we give antifungal, that is oral fluconazole 150 milligram plus clotrimazole vaginal pessary daily at night for at least 7 days to the patient. Okay, oral fluconazole tablet and clotrimazole antifungal vaginal pessary. Okay, one option was history of glucose intolerance. Definitely if there is a option like, ठीक है Dr. Robin, I agreed कि मैम diabetes नहीं था, but other student is writing there was a history of glucose intolerance, that itself signifies there is something, you know, like diabetes, so we should give folic acid therapeutic dose. Fine. So that is what I said कि कुछ ना कुछ diabetes से related होगा, तभी हम therapeutically जो है folic acid देंगे, या फिर कोई history होगी previous neural tube defect baby, then we will give therapeutic folic acid. Next. Question number 13. A mother brought a girl 15-year-old complaining of not attaining the menarche, and there is a history of primary amenorrhea with no breast development. I think it is a very, very straightforward answer, and every one of you I think must have marked it very correct. Karyotype was asked. So whenever a young female presents with primary amenorrhea, there is no breast development and there is no menarche. So that means there is ovarian dysfunction. That means because for the normal breast development, estrogen is needed, and estrogen is a hormone secreted at the time of puberty and during the reproductive years of the female, and estrogen is known to cause the development of the breast. So the karyotype in this case is 45XO. This is a case of Turner's syndrome. So I have already been telling in my classes that Turner syndrome में पक्का जो है question, ठीक है, कोई बात नहीं, अगर आपका एक आध कोई क्वेश्चन अगर डायबिटीज था या नहीं था, गलत हुआ है, कोई बात नहीं. प्लेंटी ऑफ द क्वेश्चंस इन ऑब्स गायनी आर देयर एंड आई थिंक मेजॉरिटी ऑफ यू आर मार्क्ड इट करेक्टली. फाइन. नेक्स्ट. This is incomplete question, so I don't know what exactly was the question. Fibroid history was given, histopathology was given. What is it? What exactly they had asked? They had either wanted to ask that there is some estrogen exposure, because fibroid, the cause is estrogen. So what was the exact question? It's such an incomplete question, I cannot comment. Fibroid history and histopathological examination, fibroadenoma, but what was the exact language of the question? So it's very incomplete unless until I get the complete question and the options, only then I will be able to discuss this part. Question number 15. Turner syndrome, short stature, other stigmata were given, and there was a long question I think with the history, and it was, they wanted to ask what other feature is present. So it is congenital webbing of the neck. So the Turner syndrome, short stature female with congenital webbing of neck, with cubitus valgus deformity, with congenital heart disease. In the congenital heart disease, it is bicuspid aortic valve, which is most common congenital heart disease. Otherwise, if that's not given, then it is coarctation of aorta. Okay, they had histopath image of the fibroadenoma, but what was its correlation with the fibroid? They wanted to ask something like estrogen exposure. So if I get the correct form of the question, only then I will be able to tell up this question. So I think it's Turner syndrome, short stature, that history was given, and there's a long history which was given, and I think students must have marked it very correct, because it is stigmata is the congenital webbing of neck, cubitus valgus deformity, and there are other features of Turner syndrome. So they have asked one question on the karyotype, that is 45XO, and second question they have asked on the features of the Turner syndrome. Okay. Question number 16. Again, the information provided to me is very, very incomplete. We will keep up another recall session when we are keep on getting the questions in our chat box and in the WhatsApp, and you know, like जैसे ही हमारे को पूरे questions मिलेंगे, we will be able to you know, like make a further recall session. So a primary gravida 1 p.m. was 5 centimeters dilated cervix, and 4 p.m. means 3 hours later the dilatation of the cervix is just 1 centimeter. You know, in primary gravida, the rate of cervical dilatation in the active stage of labor, is 1.2 centimeters per hour. So that way it must have been from 5 centimeter, it must have been gone to more than 8 centimeter, but it has just dilated 1 centimeter. That means either I have told you 3 P's in my class, that is for a normal progress of labor. One is push. Push means uterine contractions. One is passage. Passage means the maternal pelvis, and number 3 is the passenger. So number 3, passenger, is the fetus. If the uterine contractions are mild, then the labor will not progress. Number 2, if in that case we have to start oxytocin or we have to do artificial rupture of membranes. That means if the progress is slow, that means if you are given a partogram where from 4 centimeters there is an alert line, and 4 hours later there is an action line, and there are 3 zones, zone 1, zone 2 and zone 3. So from the, if the curve of the dilatation and descent is left of the alert line, that means normal progress will occur. If it has crossed entering into zone 2, that means the progress is slow and you have to do some intervention. If the contractions are mild, then you have to start oxytocin drip to augment the labor, or you do ARM. Okay, and if there is a contracted pelvis like CPD, cephalopelvic disproportion, the size of the baby is more, all the pelvis is adequate, या फिर जो है pelvis ही borderline है या contracted है, descend नहीं हो रहा, तो in that case you have to do intervention in the form of cesarean section. So if it is, you know, like in what way the question was asked, what was the exact, so अगर intervention लिखा है तो you have to go for intervention. If the contractions are mild and partogram image was given, then it should have gone into zone 2 where the progress was slow. अगर progress slow uterine contractions की वजह से है तो आप increase करेंगे uterine contractions by giving oxytocin, that is medical augmentation, or doing surgical augmentation, that is ARM, artificial rupture of membranes, using the Cocker's artery forceps. ठीक है. If it is, you know, like cephalopelvic disproportion or there is a borderline pelvis descent is not occurring, then you have to take up the patient for cesarean section before it goes into zone 3. Zone 3 का मतलब है obstructed labor. So before it goes into zone 3, आपको intervention zone 2 में ही करनी है because progress is slow. Question number 17. The correct sequence they have asked: mammogenesis, galactokinesis, galactopoiesis, lactogenesis. So first it is mammogenesis. Mammogenesis. Mammogenesis is preparation of the mammary gland for milk secretion. This is mostly brought by estrogen and progesterone secreted by the corpus luteum of the ovary in the first trimester, and in the second trimester it is secreted by the placenta. Now after that there is lactogenesis. Lactogenesis का मतलब है synthesis of milk secretion that is purely done by prolactin secreted from anterior pituitary. Then there is galactokinesis. Galactokinesis का मतलब क्या होता है? Galactokinesis is milk ejection reflex. That is, the baby is born and baby start feeding the breast. So there is a reflex goes to the maternal posterior pituitary to cause release of a hormone that is called as oxytocin. And lastly is the galactopoiesis. Galactopoiesis का मतलब होता है maintenance of lactation. Like baby is going to feed, put on the breastfeed, and baby will be taking the breast milk for at least 1 year. Exclusive breastfeeding for 6 months, but it can be extended up to 1 year along with the weaning. Okay, so maintenance of lactation, this is done by a hormone prolactin. ठीक है. So sequence क्या है? Mammogenesis, lactogenesis, galactokinesis and galactopoiesis. इस तरह की sequence का question first time आया FMG exam में. I'm just coming to that. ठीक है. So I hope this question is clear to you. Next, question number 18. 22 weeks pregnancy period of gestation, ultrasound, there was a marginal placenta. Marginal placenta का मतलब क्या है? Type 2, type 1, type 2, type 3 and type 4. Type 1 placenta is in the lower uterine segment away from the os. Type 2 is it is touching the internal os, that is type 2. This is type 1. Type 3 is it is partially covering the internal os, and type 4 is completely covering the internal os. So this is low lying placenta, this is marginal placenta previa, this is partial placenta previa, and this is central placenta previa or complete placenta previa. So in the question it was type 2 placenta. Okay, type 2 placenta previa which can be anterior or which can be posterior. If it is posterior, then it is a major degree placenta previa. If it is anterior, then it is a minor degree placenta previa. Okay, so whenever there is a definition or a question of placenta previa, the definition of antepartum hemorrhage or placenta previa is after 28 weeks. That means a third trimester ultrasound is must for localization of placenta. उससे पहले आप मार्जिनल है, लो लाइंग है, सेंट्रल है, आप नहीं बोल सकते, बिकॉज जैसे जैसे प्रेगनेंसी ग्रो करती है प्लेसेंटल साइट इज शिफ्टेड अप, प्लेसेंटल साइट इज शिफ्टेड अप. As long as the pregnancy grows, the placental site is shifted up. Okay, placental site is shifted up. So हमेशा एक थर्ड ट्राइमेस्टर अल्ट्रासाउंड रिपीट करते हैं. So अगर ये ऑप्शंस हैं तो हम 32 वीक्स पे अल्ट्रासाउंड करा सकते हैं. ठीक है. अब अगर इसमें थर्ड ट्राइमेस्टर या क्या ऑप्शंस थी, ठीक है, अगर लो लाइंग प्लेसेंटा था या मार्जिनल था या जो भी था, कोई भी अल्ट्रासाउंड जो 28 वीक्स के बाद कराते हैं, प्लेसेंटल साइट गेट्स फिक्स्ड, आपको उसको रिपीट करने की बाद में ज़रूरत नहीं पड़ती है. ठीक है. सो 22 वीक्स पे वी विल नॉट कॉल इट एज प्लेसेंटा प्रीविया. डेफिनेशन स्टार्ट्स फ्रॉम 28 वीक्स ऑनवर्ड्स. नेक्स्ट क्वेश्चन नंबर 19. Condyloma acuminata image was given and asked for the treatment. What were the options given? What were the options? देखो बच्चों, पार्शियल प्लेसेंटा प्रीविया है, सेंट्रल प्लेसेंटा प्रीविया है. डेफिनेशन हम प्लेसेंटा प्रीविया कब बोलेंगे? क्योंकि जो लो लाइंग है वो बाद में जैसे जैसे प्रेगनेंसी कंटिन्यू होती है, प्लेसेंटल साइड भी शिफ्ट हो जाती है. तो जो टाइप 1 वाला है वो नॉर्मल फंडल प्लेसेंटा भी हो सकता है एज द ट्राइमेस्टर ऑफ प्रेगनेंसी प्रोसीड्स. तो कोई भी अल्ट्रासाउंड जो 28 वीक्स के बाद किया है, प्लेसेंटल साइट फिक्स हो जाती है, तो प्लेसेंटा प्रीविया की डेफिनेशन ही 28 वीक्स के बाद बोलते हैं. ठीक है. नेक्स्ट, अब क्वेश्चन है कॉन्डाइलोमा एक्यूमिनेटा इमेज वाज गिवन, दैट इज जेनिटल वॉर्ड्स. सो जेनिटल वॉर्ड्स में हमेशा बेस्ट ट्रीटमेंट होता है लेजर ट्रीटमेंट, अगर लेजर उसमें ऑप्शन में दे रखा था. Moreover, if there is any confusion in the options, you better ask from the dermatology because genital warts का treatment usually venereal disease specialist ही करते हैं. ठीक है. If we get the patients of any syphilis or any like H. ducreyi infection or chancroid, we always shift the case to the dermatologist and they are the ones who are dealing with the venereal diseases. So according to me, the laser treatment if given was the option was the answer. नहीं तो otherwise you better ask from the dermatology. Next, question number 20. What is the gold standard investigation for endometriosis? What have you marked? What have you marked? Laparoscopy, MRI, ultrasound. What have you marked the gold standard? I think it is a straightforward answer. Endometriosis means presence of endometrial tissue outside the uterine cavity. So the most common site is the ovary. Other sites are rectovaginal septum, pouch of Douglas, laparotomy scar, etc. So endometriosis in one way can present as a chocolate cyst of ovary. Number 2, another presentation can be peritubal or peri-ovarian adhesions, peritubal or peri-ovarian adhesions, and third presentation can be scattered endometriotic implants in the peritoneal cavity, scattered endometriotic plants in the peritoneal cavity. So ultrasound can be one of the investigation, but it will not be able to pick up the adhesions. So there is one investigation that is confirmatory and that is gold standard, that is always your laparoscopy. So presentation of the patient, the most common symptom of endometriosis is always pain, and if you ask the classical triad, then it is congestive dysmenorrhea plus there is dyspareunia, that is painful coitus, plus there is infertility. So these adhesions are causing infertility. So presentation can be pain, that is congestive dysmenorrhea, or dyspareunia or chronic pelvic pain. Another presentation of this patient can be infertility, which is quite common. 40 to 50% cases of unexplained infertility, the cause is endometriosis. And third presentation can be, it can present as an adnexal mass. So laparoscopy is the investigation. Laparoscopy is the investigation where, okay, fourth option was histopath, but histopath is never the, investigation that is needed. Okay, so it is fairly the laparoscopy which is the gold standard because it is confirmatory. And number two, when we call investigation to be gold standard in gynae, when it is confirming your diagnosis and simultaneously you are doing the therapeutic treatment. With the therapeutic measure, we can do the fulguration of the chocolate cyst, or if the size of the cyst is more than 4 centimeter, we can do ovarian cystectomy. If there is adhesions, we can do adhesiolysis by the cautery or the laser, and we can burn the endometriotic implants by the laser or the cautery. Okay, so gold standard is laparoscopy. Moreover, जब भी हमारे पास कोई पेशेंट इनफर्टिलिटी का होता है एंड वी आर ट्राइंग टू डू द इन्वेस्टिगेशन रूलिंग आउट द कॉजेज ऑफ इनफर्टिलिटी, सो गोल्ड स्टैंडर्ड इन्वेस्टिगेशन हमारी लैप्रोस्कोपी रहती है, बिकॉज लैप्रोस्कोपी में इफ देयर इज एनी polycystic ovaries, we can do ovarian drilling. If there is adhesions like endometriosis, we can do adhesiolysis. So that is why, and we can simultaneously do the laparoscopic chromotubation, that is checking the tubal patency. So that is why laparoscopy is the gold standard in infertility cases, whereas laparoscopy is again a gold standard investigation when it is tubal and peritoneal factor of infertility. Overall, if you just talk about endometriosis, again laparoscopy is the gold standard investigation. ठीक है? Okay. Condyloma image based question में regime का भी option था. Okay. Question number 21. I think you must be finding it little bit difficult because हम FMG session में जब क्लास लेते हैं, genital prolapse topic पढ़ाते हैं, तो उसमें mainly हमारा फोकस होता है कि किस पैटर्न के एग्जाम में क्वेश्चंस आ रहे हैं. So this is the first time I am seeing this question, that is POPQ classification reference point. POP का मतलब क्या है? Pelvic organ prolapse, यानी कि genital prolapse, pelvic organ prolapse, that is the genital prolapse. So which is the reference point? ये क्वेश्चन FMG एग्जाम में कभी नहीं आया. I'm almost taking classes since the FMG exam began और ये क्वेश्चन कभी नहीं आया. करेक्ट आंसर बच्चों इसका ऑलवेज हाइमन है. POP classification reference point is always hymen. So according to the hymen the classification, नहीं ischial spine fornices ये कोई ऑप्शन नहीं है. करेक्ट आंसर जो है हाइमन है. ठीक है, इसका रेफरेंस पॉइंट ही हाइमन होता है. पेल्विक ऑर्गन प्रोलैप्स क्लासिफिकेशन, POPQ क्लासिफिकेशन कहते हैं इसको. नेक्स्ट क्वेश्चन नंबर 22. एन इन्वेस्टिगेशन ऑफ चॉइस फॉर द torsion, ovarian torsion was given, which is the ovarian tumor that undergoes torsion. सबसे कॉमन किस में है? dermoid cyst में है torsion. दूसरा है mucinous cyst adenoma, mucinous cyst adenoma. सो टॉर्शन में हमेशा जो है हमारा इन्वेस्टिगेशन जो प्रेफर्ड होता है वो अल्ट्रासाउंड. अगर अल्ट्रासाउंड डॉपलर लिखा है, दिस इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन नंबर 23. Maternal side of placenta is formed from. So always I have been discussing कि जब single liners भी मैंने OBG 5 years PYQs डिस्कस किए थे, तो मैंने उसमें कुछ 2023 से स्टार्ट करके 2018 तक डिस्कस किए थे, और जो मैंने 18 वाले क्वेश्चंस डिस्कस किए थे वो लास्ट में किए थे, जो कि ज़्यादातर सिंगल लाइनर बेस्ड थे. और इसलिए मैंने डिस्कस करे थे अपने उस सेशन में जब मैंने FMG लास्ट 5 years PYQs डिस्कस किए थे, जिसमें काफ़ी सारे व्यूज़ हैं, अराउंड 15-16,000 व्यूज़ हैं जो स्टूडेंट्स ने उन सेशन को अगर अटेंड किया लाइव या बाद में देखा है. तो उसमें मैंने पढ़ाया था कि सिंगल लाइनर्स लास्ट में, इसलिए कि बच्चों अगर बाई चांस कोई सिंगल लाइनर्स पे क्वेश्चन आ जाए तो आपके लिए वो फ्रूटफुल रहे, आपको आते हो आंसर. तो हमेशा मैंने बताया था प्लेसेंटा इज फाउंड फ्रॉम मैटरनल साइड, दैट इज डेसिडुआ बेसालिस. एंड वैसे मैं बता दूं किस एग्जाम में ये पहले आया था, ये 2015 में आया था क्वेश्चन, और अब ये रिपीट क्वेश्चन आया. सो इट इज फाउंड फ्रॉम डेसिडुआ बेसालिस एंड कोरियोन फ्रंडोसम. Decidua basalis and chorion frondosum. So Decidua basalis is maternal part, maternal side. ठीक है, chorion frondosum is fetal side. So maternal contribution for formation of placenta 20% होता है, 80% placenta term pregnancy पे formed by the fetus होता है. So जब भी endometrial lining in pregnancy होती है उसको हम वैसे भी decidua बोलते हैं. ठीक है, so decidua के 3 parts होते हैं, decidua basalis which forms the placenta, decidua parietalis and decidua capsularis. Decidua capsularis है which covers the implantation site and decidua parietalis है which is rest of the endometrial lining. So जो basalis वाला part है वो placenta form करता है, जो capsularis है that covers the implantation site और जो बाकी बचता है वो endometrial lining उसको हम decidua parietalis बोलते हैं. तो इसमें correct answer जो है वो decidua basalis है. Maternal side जो है decidua basalis. Next. टॉर्शन में कभी भी एक्सरे का रोल नहीं है. अगर एक्सरे लिखा भी है, एक्सरे एब्डोमेन भी, तो एक्सरे एब्डोमेन का कोई खास रोल नहीं है बिकॉज अल्ट्रासाउंड इज फेयर इनफ टू पिक अप द टॉर्शन ऑफ द ओवेरियन सिस्ट. इट इज फेयर इनफ. नाउ क्वेश्चन नंबर 24. मल्टीग्रेविडा फीमेल प्रेग्नेंट विद हिस्ट्री ऑफ प्रीवियस सिजेरियन सेक्शन. तो आपके पास एक क्वेश्चन है जिसमें प्रीवियस LSCS है, प्रीवियस सिजेरियन सेक्शन लिखा है. कोई ज़रूरी नहीं है कि वो LSCS ही हो, ठीक है, वो क्लासिकल सिजेरियन भी हो सकता है. उन्होंने लिखा है प्रीवियस सिजेरियन सेक्शन, तो प्रीवियस सिजेरियन सेक्शन लेके चलते हैं. अब विच इज़ द बेस्ट फॉर विजाइनल डिलीवरी, यानी ये क्वेश्चन आया वी बैक पे. मैं हमेशा क्लासेस में पढ़ाती हूँ वी बैक विजाइनल बर्थ आफ्टर सिजेरियन सेक्शन. पिछली बार भी एक क्वेश्चन इसमें आया था जिसमें मैक्रोसोमिया प्रीवियस टू सिजेरियन सेक्शन, प्रीवियस क्लासिकल सिजेरियन सेक्शन था. तो मैंने ये गेस्ट सीरीज में भी ये डिस्कस किया था, 5 years PYQs में भी डिस्कस किया था. इसलिए किया था कि दोबारा भी इस पर क्वेश्चन आ सकता है, बट उन्होंने ऑप्शंस थोड़ा सा चेंज कर दिया है. विजाइनल बर्थ आफ्टर सिजेरियन एक पूरा चैप्टर है आपकी बुक में, ठीक है. तो एटलीस्ट मैंने कहा था इंडिकेशन या कॉन्ट्रा इंडिकेशंस आपको पढ़ना है इसमें, अगर हम पूरा चैप्टर नहीं पढ़ सकते हैं तो इसमें प्रीवियस सिजेरियन सेक्शन में आप किस में विजाइनल डिलीवरी अलाउ कर सकते हो या किस में रिकरेंट इंडिकेशन है सिजेरियन सेक्शन की. ट्रांसवर्स लाइक कोई भी माल प्रेजेंटेशन हो, स्कार्ड यूट्रस में हमेशा ही सिजेरियन करना है. सो एनी माल प्रेजेंटेशन इन अ स्कार्ड यूट्रस, माल प्रेजेंटेशन क्या है, ट्रांसवर्स लाइक ब्रीच, इसमें आपको इलेक्टिव सिजेरियन करना है. क्यों करना है, क्योंकि आप ब्रीच विजाइनल डिलीवरी अगर कराने की कोशिश करते हो तो आपको मैनिपुलेशन या मैनुअर्स करने पड़ते हैं, तो उसमें रिस्क ऑफ रप्चर हो जाएगा. तो ट्रांसवर्स लाइन में तो कभी भी आप विजाइनल डिलीवरी अलाउ नहीं करोगे इन अ प्रीवियस सिजेरियन सेक्शन, ब्रीच में भी नहीं करोगे. वर्टिकल सिजेरियन का मतलब क्या है, वर्टिकल का मतलब है क्लासिकल, तो वर्टिकल का मतलब यहाँ पे क्लासिकल है. तो अगर इस प्रेगनेंसी में प्री एक्लेम्सिया यू कैन अलाउ नॉर्मल डिलीवरी. समझ आया. क्वेश्चन क्या कह रहा है, क्वेश्चन ये कह रहा है कि प्रीवियसली एक स्कार्ड यूट्रस है, ठीक है, अब उसमें नेक्स्ट प्रेगनेंसी हुई है, तो नेक्स्ट प्रेगनेंसी में किस केस में आप विजाइनल डिलीवरी अलाउ कर सकते हो. क्या अगर प्रेजेंटली ट्रांसवर्स लाई बेबी है तो आप डिलीवरी अलाउ करोगे, नहीं, मैं तो फिर से सिजेरियन करूंगी. अगर अब की प्रेगनेंसी में ब्रीच है तो फिर क्या करोगे, कोई भी माल प्रेजेंटेशन है स्कार्ड यूट्रस में तो आप उसमें पंगे नहीं लेते हो बिकॉज देयर इज रिस्क ऑफ रप्चर. तो इसमें तो हमें प्लान्ड सिजेरियन करना है 38 वीक्स पे. अब चौथी ऑप्शन जो दे रखी है वर्टिकल सिजेरियन स्कार. वर्टिकल का मतलब क्या है, क्लासिकल सिजेरियन स्कार है. तो क्लासिकल में तो कभी भी आपको जो है यू कैन नॉट अलाउ नॉर्मल डिलीवरी, आपको सिजेरियन करना है. तो इसमें करेक्ट आंसर है प्री एक्लेम्सिया, ठीक है, प्री एक्लेम्सिया. नेक्स्ट क्वेश्चन नंबर 25. व्हाट इज द मैनेजमेंट ऑफ यूट्राइन इन्वर्जन. तो यूट्राइन इन्वर्जन की मोस्ट कॉमन कॉज क्या है, mismanaged third stage of labor. Mismanaged third stage of labor यानी कि प्लेसेंटल डिलीवरी जो है वो हो चुकी है या फिर नहीं हुई है एंड यूट्रस इज आउट. Okay, so in that case no management should be done in the labor room. You have to shift the patient to OT, start the IV line, start the ringer lactate drip, arrange for the blood, shift the patient to OT and perform reposition of uterus back into its anatomical position, okay, in the OT under general anesthesia. This is called as Johnson's maneuver. So Dr. K, whatever you are writing, just let me know what was the exact language of question. You are the one who have given the exam, na? So you should write in the chat box. It is a request. Okay, so you tell me what is the exact questions. You are a doctor, you have given the exam. And you tell me in the chat box what is the exact language of the question. I will write. I will discuss that. Initial management was asked. Okay, Dr. Shubham is writing initial management was asked. Initial management is you have to shift the patient to operation theatre. So please write manual reposition of uterus. Yes, Dr. Shubham is correct. So that is what I am telling you. Reposition of uterus into its anatomical position is what is called as manual reposition of uterus in the operation theatre under general anesthesia. Okay, Johnson's maneuver nahi tha. Okay, I will cut Johnson's maneuver. Now, manual reposition in the uterus. Manual reposition of the uterus is called as Johnson's maneuver. Okay, so I go with Dr. Shubham's option, manual reposition of uterus. So you have to mark manual reposition of uterus. But bachcho, this has to be done in the operation theatre under general anesthesia. Keeping the blood ready. Keeping the blood ready. Okay. Manual reposition by hand, that is correct. Dr. Altaf, this is correct. But it has to be done in the operation theatre under general anesthesia. That is what I am saying. So that is what manual reposition. So that is what reposition के आगे मैं manual लगा देती हूँ तो उसका मतलब वही है, दोनों सेम ही है. उस मैनुअर को बोलते हैं जॉनसन्स मैनुअर. ठीक है. नेक्स्ट. Question number 26, it is an overlap between OBS and Gynae and PSM. Anemia Mukt Bharat, dose of iron folic acid. Is it the dose of iron folic acid that was asked, or is it that one tablet was asked or two tablets was asked? Okay, Dr. K, you tell me. Dr. K, आप option में लिख दो ना क्या option था. I am just trying to help you out. Those who have done their paper and they just want कि हमारे answers teachers के साथ check हो जाएं तो so that हम अपना provisional score बना सकें. Manual reposition था. Dr. Naushad Ali is saying, so I agree with them. Dr. Shubham, Dr. Naushad दोनों ने यही चीज़ बोला है. जिन बच्चों ने अच्छे से पढ़ाई करी है और पेपर अच्छे से अटेम्प्ट किया है वो इसमें चैट बॉक्स में कंप्लीटली लिख रहे हैं क्या आंसर था. ठीक है, तो मैनुअल रिपोजिशन था तो वो मोस्ट अप्रोप्रिएट आंसर है. चलो हो गया. 3-4 स्टूडेंट्स ने मुझे बोल दिया तो मैं एक स्टूडेंट के ऊपर नहीं जाऊंगी, मैं 4-5 जो मेजॉरिटी है उसके अकॉर्डिंग करूंगी. अनीमिया मुक्त भारत में आई थिंक उन्होंने डोज नहीं पूछा था. यस डॉक्टर खुशवंत, आई एग्री, क्योंकि सब लोग सुबह से आप लोग एग्जाम दे रहे हो, सुबह से दे के आए हो, आप थके हुए भी हो और उसके बाद भी आप सेशन अटेंड कर रहे हो. ठीक है, सो 60 मिलीग्राम ऑफ एलिमेंटल आयरन डोज होती है, आपको पता है, प्लस 0.5 मिलीग्राम ऑफ फॉलिक एसिड. ठीक है, तो हमें डेली 1 टैबलेट देनी है अगर उसका हीमोग्लोबिन ठीक है. अगर उसको अनीमिया है तो 2 टैबलेट्स डेली देना है. ठीक है, ओरल. तो अगर या तो डोज पूछा है तो 1 टैबलेट डेली है, अगर ये कंपोजिशन पूछा है तो ये कंपोजिशन है. ठीक है, ओके, बोथ वर देयर इन द ऑप्शंस. ठीक है, हीमोग्लोबिन अगर 10 ग्राम है, फेयर एनफ, देन यू विल गिव 1 टैबलेट डेली. अगर उसका हीमोग्लोबिन माइल्ड अनीमिया है, ठीक है, अनीमिया मुक्त भारत टर्म आई सेड, अनीमिया मुक्त भारत टर्म इज फॉर पीएसएम. बट अगर डोज की बात है तो 60 मिलीग्राम ऑफ एलिमेंटल आयरन प्लस 0.5 मिलीग्राम ऑफ फॉलिक एसिड. बट प्रेग्नेंट लेडीज को देते तो यार गायनी डॉक्टर ही हैं. ठीक है, एंड पीएसएम भी मास डिस्ट्रीब्यूशन में देते हैं टैबलेट्स. ठीक है, नेक्स्ट क्वेश्चन नंबर 27. ये आपका जो क्वेश्चन है फिजियोलॉजी में आई थिंक डॉक्टर अनुपमा ने ऑलरेडी डिस्कस कर दिया है. आयरन एब्जॉर्प्शन इज इनहिबिटेड बाय लेमन एंड आंवला में तो विटामिन सी होता है. विटामिन सी इंक्रीजेज द आयरन एब्जॉर्प्शन. ठीक है, सो आंसर इसमें टी आएगा. नेक्स्ट क्वेश्चन नंबर 28. डायबिटीज इन प्रेगनेंसी. डायबिटीज इन प्रेगनेंसी स्क्रीनिंग, अमाउंट ऑफ ग्लूकोज। हम अगर डिप्सी क्राइटेरिया करते हैं, डायबिटीज इन प्रेगनेंसी सोसाइटी ऑफ इंडिया यानी कि नेशनल गाइडलाइंस, नेशनल गाइडलाइंस के अकॉर्डिंग हमें 75 ग्राम्स ऑफ ग्लूकोज देना है, और हमें जो ये स्क्रीनिंग बेस्ट करना होता है 24 to 28 वीक्स, क्योंकि इस टाइम पे इंसुलिन रेजिस्टेंस सबसे ज़्यादा होता है, और हमें 2 आवर्स के बाद ब्लड ग्लूकोज लेना है, तो उसकी कट ऑफ वैल्यू लेस देन 140 मिलीग्राम पर डेसीलीटर होनी चाहिए। तो कितना अमाउंट ऑफ ग्लूकोज है, 75 हो गया। 50 ग्राम्स जो था, जब ग्लूकोज चैलेंज टेस्ट पूछते थे, तब 50 ग्राम्स ऑफ ग्लूकोज होता था। बट अभी डिप्सी क्राइटेरिया चल रहा है जो कि नेशनल गाइडलाइंस है, तो फिर उसमें तो नेशनल गाइडलाइंस में जो है 75 ग्राम्स ऑफ ग्लूकोज है। क्वेश्चन नंबर 29, डोज ऑफ एंटी-डी इन RH नेगेटिव मदर। ओके, डोज ऑफ, सो अनीमिया मुक्त भारत क्वेश्चन जो भी आपका है वो आप PSM में कवर कर लेना। आई थिंक डॉक्टर अश्वनी विल बी डिस्कसिंग। सो डोज ऑफ एंटी-डी इन RH नेगेटिव मदर पे क्वेश्चन था, तो डोज ऑफ एंटी-डी इन RH नेगेटिव मदर इज 300 माइक्रोग्राम्स ऑफ एंटी-डी इम्यूनोग्लोबुलिन टू बी गिवन टू RH नेगेटिव मदर who has delivered an RH positive baby and she should be ICT negative। अगर डोज पे पूछा था तो डोज 300 माइक्रोग्राम्स देते हैं। ये हम क्यों दे रहे हैं? जो फीटल RBC है, द फीटल RBC which is containing the D antigen on the cell membrane, if during the delivery it enters into maternal circulation, अगर ये maternal circulation में जाएगा it will cause antigenic stimulus, ठीक है, and antibodies will be produced. So before it is causing antigenic stimulus, आपने anti-D immunoglobulin दे दिया है which will block these antigenic sites, so no antibodies will be formed, ठीक है, सो नो एंटीबॉडीज विल बी फॉर्म्ड। सो अगर डोज पूछा है तो 300 माइक्रोग्राम्स है। अगर कोई इन्वेजिव मैनुअर पूछा है तो हम एंटी-डी इंजेक्शन देते हैं। अगर हम कोई केस देख रहे हैं जिसमें MTP या अबॉर्शन है लेस देन 12 वीक्स, तो 50 माइक्रोग्राम्स डोज होती है। आफ्टर 12 वीक्स RH नेगेटिव में कुछ भी हो रहा है तो 300 माइक्रोग्राम्स डोज होती है। किस क्वेश्चन में पूछ रहे हो डॉक्टर अक्षय, 50 mg या फिर 100 mg? ओके, कोरियोनिक विलस सैम्पलिंग अगर कर रहे हैं, कोरियोनिक विलस सैम्पलिंग अराउंड 11 to 14 वीक्स पे करते हैं, तो यूजुअली इसमें जो है 300 माइक्रोग्राम्स डोज आएगा अगर उसमें कुछ पीरियड ऑफ जेस्टेशन मेंशन्ड है, ठीक है, पीरियड ऑफ जेस्टेशन मेंशन्ड है। नेक्स्ट, so that is all from obs and gynae. As long as we will get more correct options with the complete questions, we can come up with another review session. 300 micrograms, milligrams नहीं होता, it is micrograms। देखो मैंने आपको बताया अगर लेस देन 12 वीक्स है तो 50 माइक्रोग्राम्स आएगा, अगर मोर देन 12 वीक्स है तो 300 माइक्रोग्राम्स आएगा। इट वाज 11 वीक्स, अगर 11 वीक्स है तो फिर 50 माइक्रोग्राम्स डोज है। अगर 11 वीक्स यानी 12 वीक्स को क्रॉस कर रहा है तो 300 माइक्रोग्राम्स है। मैंने जो 300 माइक्रोग्राम डोज बताई है वो आफ्टर डिलीवरी के हिसाब से बताई है। ओके डॉक्टर अक्षय, कोई बात नहीं। अगर MTP भी है तो MTP यूजुअली हम फर्स्ट ट्राइमेस्टर में करते हैं तो 50 माइक्रोग्राम डोज होती है, और अगर उसमें जो है पीरियड ऑफ जेस्टेशन मेंशन नहीं था तो फिर 300 माइक्रोग्राम्स मार्क करेंगे। तो यू आर द वंस हु हैव टू टेल द करेक्ट। 11 वीक्स के अकॉर्डिंग 50 माइक्रोग्राम्स आंसर आएगा, और अगर उसके बियॉन्ड है तो फिर 300 माइक्रोग्राम्स आएगा। So that is all I can say. Nuchal translucent best seen at, okay, nuchal translucency जो है हमेशा हम 11 to 14 weeks के बीच में देखते हैं. Any more questions? So this is what we have prepared. All the teachers are preparing this recall session according to the students who have writing questions to us. MTP के क्वेश्चन में ये पूछा था कि जो है 22 वीक्स पे अगर MTP कर रहे हैं, ठीक है, तो ओपिनियन ऑफ कितने डॉक्टर्स की जरूरत है. सो ओपिनियन ऑफ 2 डॉक्टर्स इज नीडेड. Choriocarcinoma, yes. Cannonball appearance, choriocarcinoma. Cannonball appearance on the chest X-ray is seen in choriocarcinoma. Any more question? Any more question? So that's all. I hope you must have done all.
Hello everyone, I hope you had a good exam and you really marked all the questions well. Well, my best of luck for your result. Now in anesthesia, I got total 5 questions. All 5 were very predictable, very simple question. So straight away, without wasting any time, let us come to the question. The first question which was asked, which was given to me, is based on recall, and the question is road traffic accident with severe maxillofacial trauma, airway management. Well, it's an acute condition, road traffic accident, acute injury, and patient had a severe maxillofacial trauma, immediate airway management. If it's emergency airway management just after accident, for irrespective of the type of injury, whether it's maxillofacial, whether it's cervical spine injury or anything, we go for orotracheal intubation because that's the fastest way to secure the airway in these conditions. But if the question was asked that in maxillofacial injury patient who requires old maxillofacial injury patient who requires intubation, that is electively we have to intubate, not emergency intubation, then what is best for that injury? We would do that airway management. And for maxillofacial, the answer had to be tracheostomy. So I exactly don't know what was the language of the question, exact language of the question, but what I got is the road traffic accident with severe maxillofacial injury, immediately came to hospital, and what is the emergency airway management. So thinking this as the question, I'm going for orotracheal intubation as the answer. So as I explained you in my topic airway management, that in emergency, irrespective of type of injury, what we do orotracheal intubation. So we do orotracheal intubation always, whether it is cervical spine injury or maxillofacial injury or any other injury. But if it is elective airway management, so elective airway management, we do what is best for that patient. And in elective airway management for cervical spine, for example, for cervical spine injury, we would answer nasotracheal intubation, right? And for your maxillofacial, elective management, maxillofacial, we would go for answer tracheostomy. Got my point? So here, thinking the question was asked in acute scenario, I am answering orotracheal intubation. Okay. Now next question. Which of the following agent has blood gas partition coefficient similar to nitrous oxide? Well, I told you so many times, you have to remember the sequence. What was the sequence? Sequence from the latest gas which came into clinical practice to the oldest gas, right? So desflurane is the latest one which came in the clinical practice. Then sevoflurane, I am not making this arrow. Sevoflurane, the next gas, then isoflurane came before SIVO, and then first one which came was halothane. Halothane. I told you to remember the sequence, and I told you for blood gas solubility, right? Desflurane has the lowest blood gas solubility, then SIVO, then iso, and then halothane. And blood gas solubility tell us about speed of induction, right? And when I added the blood gas solubility of the carrier gas in it, I added the blood gas solubility of nitrous oxide and xenon. And I told you that xenon has the lowest blood gas solubility, and nitrous oxide and xenon is more or less equal. Nitrous oxide, the blood gas solubility is 0.45. Desflurane, the blood gas solubility is 0.42. Sevoflurane, it is 0.63. Isoflurane, it is 1.2, and halothane, it is 2.25. Xenon, it is 0.11, lowest blood gas solubility. So, which agent has the blood gas solubility near to nitrous oxide? Definitely the answer has to be desflurane. So, answer for this question is desflurane. So, very easy question I know for most of my students, because we have discussed this sequence so many times, and the sequence is just opposite for the MAC. The lowest MAC is of halothane, so halothane is most potent. So, the sequence for MAC is just opposite. Halothane has the lowest MAC, right? Halothane has the lowest MAC, then isoflurane, then sevoflurane, and then desflurane, right? So, that is why halothane is most potent. It is least required to produce the effect. So, halothane is most potent, and nitrous oxide, the carrier gas, has a higher MAC than desflurane. Now, desflurane has a MAC of 6, nitrous oxide has a MAC of 104, and xenon is in between nitrous oxide and desflurane. It's a carrier gas. Xenon, it has a MAC of 70, but it is much higher than our potent inhalational anesthetic agents, right? 6 is of desflurane, 2 is for sevoflurane, 1.3 is for iso, and 0.75 is for halothane. Okay, so remember this. Okay, very simple question. Next question. Again, a very expected question. A patient was given 0.5% bupivacaine for supraclavicular brachial plexus block and suddenly developed hypotension and arrhythmia. Now, patient was given the block, and by block he was given local anesthetic and developed the cardiovascular symptoms. Well, what we will suspect? We will suspect the drug which was given locally for the block has resulted in systemic absorption, and this is local anesthetic systemic toxicity. So, I have talked so many times about this last, local anesthetic systemic toxicity, the CNS symptom and CVS symptom. And I have so many times told you that bupivacaine is most cardiotoxic, It binds to the sodium channel of heart very rigidly. So, it is mostly when we give bupivacaine, the risk of cardiovascular toxicity is highest. And what are the clinical features of cardiovascular toxicity? Well, hypotension is one of the first clinical feature. Then definitely arrhythmias can happen because of the blockage of the sodium channel, which the local anesthetic do. And the patient can go into cardiac arrest as well. Okay. So, and obviously, what is the CNS symptom? We have talked so many times. Apprehension, numbness, perioral numbness, twitches, and seizures. Okay. So, this patient, directly hypotension and arrhythmia was noted. This is definitely cardiovascular symptoms of local anesthetic systemic toxicity. What's the management? Well, management for local anesthetic systemic toxicity, immediate management, do not give any further local anesthetic to the patient. Stop the injection of the drug immediately. If you are still injecting it, call for help. Then manage whatever symptom is coming, manage symptomatically whatever symptom is coming. If it's cardiac arrest, we do CPCR. If it's arrhythmia, we give antiarrhythmic agent. If it's hypotension, we start inotropes. And guys, the rescue drug for local anesthetic systemic toxicity is 20% intralipid emulsion. We start the infusion of 20% intralipid emulsion. Very important. This will do two things. it absorbs bupivacaine, what is present in the blood, the remaining bupivacaine, and it will also let the bupivacaine which is attached to the sodium channel of the heart diffuse out, and it will again absorb that also. The lipid escape of local anesthetic we have talked so many times about. So this is kind of rescue therapy in case of LAST. The dose of 20% intralipid emulsion is for 70 kg. For less than 70 kg, 1.5 ml per kg body weight. For more than 70 kg, the bolus 100 ml is given of 20% intralipid emulsion. So what's the answer for this question? Patient still having hypotension arrhythmia, and option could be invasive ventilation. Patient is not unconscious, patient is not on, I have not intubated the patient. So invasive ventilation is not an option at present. Intralipid emulsion, well, this is the drug of choice, the rescue drug. Soda bicarb, well, it can, we will see if the soda bicarb is required or not later on, but at present patient is not in cardiac arrest, and there is no acidosis reported in the clinical features of the patient, so no role of soda bicarbonate. CPR, until unless patient goes into cardiac arrest, CPR is not required, so CPR would not be the answer. It's just hypotension and arrhythmia, intralipid emulsion, right? This would be the answer. Very simple question. I told you, last, go for intralipid emulsion as the answer. Okay, next question. Which out of the given option, which layer does not get punctured when for epidural anesthesia? So for epidural anesthesia, which is not punctured. So this is the spinal cord, this is the pia mater, this is the arachnoid mater, and this is the dura mater. Just outside dura mater is ligamentum flavum. Then your spines, these are the spines. In between the spines, we have interspinous ligament, and outside this, just on the surface of the spine is supraspinous ligament. And then we have the subcutaneous fossa, and then we have the outermost layer, skin. So this is skin, this is subcutaneous fossa, this is supraspinous ligament, this is interspinous ligament, this is ligamentum flavum, this is the dura mater, this is the arachnoid mater, this is the pia mater. So for epidural, we have to remain outside the dura mater. So when we pierce the ligamentum flavum, we enter the epidural space, right? For your spinal anesthesia, you need to pierce the dura mater and arachnoid mater and then enter the subarachnoid space. So for epidural, which layer is not punctured? The answer is your arachnoid mater. This would be the answer, right? Ligamentum flavum is the last layer to be punctured for epidural anesthesia. So many times this question has been asked. Supraspinatus ligament and interspinous ligament is outside the ligamentum flavum. Okay, so answer has to be your arachnoid mater, right? Now, because answer in the question, it is not getting punctured, right? Now, coming on the last question, the fifth question, contraindication of use of BiPAP, that is bi-level positive airway pressure, right? Which comes under our non-invasive ventilation, Now, I have told you so many times in my topic, the ventilation, right? That for non-invasive ventilation, we need the patient to fulfill two criteria. Number one, the patient has to be conscious and oriented. And number two, patient can protect his airway. If both are not there, what will happen? Patient will aspirate. What do I mean by non-invasive ventilation? We are ventilating, supporting the breathing of the patient with a mask. What do I mean by invasive ventilation? We have put the endotracheal tube. So when I am supporting the patient's ventilation with a mask, patient can cough in the mask. If patient can cough, it's okay, he can protect his airway. If patient will vomit and he cannot protect his airway, all the secretions and the vomitus will go into the respiratory tract. Patient will aspirate. Patient is unconscious, he cannot protect his airway. Patient will aspirate. So most important prerequisite for non-invasive ventilation is the patient should be conscious. So contraindication to the use of BiPAP is unconscious patient. A very interesting question. So many times we have discussed this also. I have told you about BiPAP. I was expecting the question from non-invasive ventilation because invasive ventilation was recently very commonly being asked. So all the 5 questions is our questions which I know most of my students must have answered correctly. So all the best for your result, right? I hope you have marked all the questions correct. Thank you.
Hello students, so welcome to today's radiology discussion of FMGE exam. So I just met a FMG student Shubham and he was really happy that his exam went well, and I hope all of your exams, especially today exam, went well. And it's such a good feeling to see students coming out of the exam centers, meeting teachers, talking to us on the phone. And so first of all, thank you so much for showing trust in us. Thank you so much for coming to us and telling us the questions ourselves. I'll try to recall as much questions as possible. There might be some discrepancies in recall, and for that I sincerely request you all that please tell me in the discussion box, in the chat box, that what was the correct option, what was the correct language of the question, and we'll discuss it simultaneously. Okay, so let's not make it a didactic session. I'll not tell you something, you give me a feedback. Let's make it an interactive session for radiology recall in this FMG January 2024 exam. Okay, now, so at the outset, as I said, that this session is not meant for an exact recall of the questions. I'll do a separate session for exact radiology recall once the authenticity of the question and the options is clear to me, and subsequently I'll upload it on the YouTube channel of NExT as well. My aim of this session today is to touch upon the important topics which were asked, and in an interactive way from you inquire what was the exact language of the question and the options. And so first of all, before starting this recall session, I want to tell you that however your exam went, जैसा भी हुआ तुम्हारा एग्जाम ना, अब नहीं सोचना है उसके बारे में, ठीक है. अब एग्जाम हो गया, वो सबसे बड़ी अचीवमेंट है कि तुम इस एग्जाम में बैठे. पता है इतनी ज़्यादा टेंशन होती है. आई एम अ स्टूडेंट माई सेल्फ, आई विल बी अ स्टूडेंट फॉर लाइफ, यू नो, डॉक्टर्स आर स्टूडेंट्स फॉर लाइफ. एंड सो आई बिलीव दैट गिविंग एन एग्जाम इज इट सेल्फ एन अचीवमेंट. इतना ज़्यादा प्रेशर आपने इन 5 घंटे में आपने देखा, वो महसूस किया, दैट इज़ कमेंडेबल इन इट सेल्फ. सो जस्ट बिलीव इन योर सेल्फ, इवन इफ यू डोंट प्रिटेंड दैट यू डू, एंड एट सम पॉइंट यू विल. ठीक है, जब आपका एक रिजल्ट आएगा तब आपको याद आएगा कि कितनी ज़्यादा मेहनत की थी आपने, एंड हाउ दैट रिजल्टेड इन अ गुड रिजल्ट. ठीक है, सो लेट्स स्टार्ट विद द क्वेश्चन. ठीक है, सो टेल मी, आई डिडंट, वाज दिस द क्वेश्चन दैट वाज गिवन. ठीक है, आई थिंक जितना भी मैंने रिकॉल देखा, बाकी लोगों से पूछा, दे सेड कि सर सीटी हेड की इमेज दी हुई थी, एक रोड ट्रैफिक एक्सीडेंट का scenario tha, and these were the options. So if this was the NCCT head that was given, so this is an NCCT head, correct? Bones are white, so this is a CT. You do not see any contrast in the vessel, so this is a non-contrast CT. And what do you see? You see this concentric, ठीक है, concavo-convex hyperdensity along the right cerebral convexity. ठीक है, so what are the pointers here? It is concavo-convex. Second pointer, it is crossing the suture. So which two important sutures are present in the head CT that we have to see? So anteriorly we have the frontotemporal suture and posteriorly the temporoparietal suture. So it is crossing these two sutures. So this is second pointer, crossing sutures. So tell me, based upon these two languages, what will be the answer? Yes, the answer is SDH, subdural hemorrhage or subdural hematoma. Now, if on the contrary, if this was the image that was given, it is the banana shaped, it is a biconvex shape. It is a biconvex shaped bleed. It is not crossing those two important sutures that I just told you. So in this case, this will be an EDH or an extradural hemorrhage. So I'll write it down here because I think live में नीचे वाला नहीं दिख रहा होगा आपको. So this is an EDH. Why? Because it is biconvex in nature. ठीक है. So I think yes, you are saying that यही pick था sir. And ठीक है, banana shape. So answer यहाँ पर हुआ FDH. चलो next question. So I think most of the students told me that sir एक anatomy वाला question था, images marked थी structures marked थे. So most of the students have told me that this second image was the correct image that was shown. ठीक है, सो इसमें एक बार देख लेते हैं क्या क्या स्ट्रक्चर्स थे. सो जो मुझे स्टूडेंट्स ने बताया कि 3 ऑप्शंस पूछे हुए थे. एक था लिवर, एक था स्प्लीन और एक था पैनक्रियाज. लिवर, स्प्लीन, पैनक्रियाज 3 चीज़ें थी. तो बताओ कौन कौन सी चीज़ क्या क्या है. सो सबसे बड़ा ऑर्गन यहाँ पे ये कौन सा होगा. यस, दिस विल बी लिवर. ये छोटा सा ऑर्गन कोने में रहता है, बिल्कुल स्प्लीन हमेशा कोने में रहता है, तभी हम उसको वहीं पर लेफ्ट साइड पैल्पेट करते हैं ना. सो ये वाला हमारा स्प्लीन हुआ. एंड द स्ट्रक्चर इन द रेट्रोपेरिटोनियम गोइंग टुवर्ड्स द स्प्लीन, दिस इज द पैनक्रियाज. दिस इज द पैनक्रियाज. ठीक है, आई हैव टोल्ड यू दिस both in your videos that are available on the NExT app, in the revision series, in the FMG workbook that we did offline. So I think this part was very well covered. ठीक है, liver, spleen, pancreas, again same picture. ठीक है, so thank you. This was the picture. अब now since we are discussing this picture, I'll tell you one more important structure which will be asked. This is the gallbladder. ठीक है, and ये 37 में कौन सी वेन इन्होंने मार्क कर रखी है. ये कौन सा स्ट्रक्चर मार्क कर रखा है. दिस राइट हियर इज द पोर्टल वेन. ठीक है, तो एक बार बाकी भी वेसल्स देख लेते हैं. बिल्कुल वर्टिब्रा के एंटीरियर, डायफ्राग्मेटिक क्रस्ट के पोस्टीरियर कौन सी वेसल होती है. हमारी एओर्टा होती है. एंड ये छोटी सी वेसल जो यहाँ पर है ये हमारी है IVC. ठीक है, ये सारी नहीं पूछी गई थी, बट सिंस वी आर टॉकिंग अबाउट CT chest anatomy axial, so I thought that I'll let you know some other structures as well. So liver, spleen, pancreas, I think clear हो गया. कौन सा लिवर है, कौन सा स्प्लीन है. ये पूरा बड़ा सा स्ट्रक्चर, ये हमारा लिवर है, ये स्प्लीन है और ये पैनक्रियास. ठीक है, नाउ लेट्स move on to the next question. So again student told me that sir opaque hemithorax was given. Opaque hemithorax. ठीक है, opaque hemithorax अपने आप में एक एंटिटी होती है that one side of the chest x-ray is completely white. Opaque hemithorax. So अब ये वाली इमेज थी कि ये वाली इमेज थी. अब आप बताओ, मुझे स्टूडेंट्स ने बोला है कि सर एक साइड की इमेज, एक साइड की चेस्ट पूरी वाइट थी एंड ट्रेकिया कॉन्ट्रालैटरली शिफ्ट हो रखा था. इनफैक्ट ट्रेकिया एंड मीडियास्टिनम भी कुछ लोगों ने बोला कॉन्ट्रालैटरली शिफ्ट था. सो इफ इट इज एन ओपेक हेमीथोरैक्स, नेक्स्ट स्टेप यू हैव टू सी मीडियास्टाइनल शिफ्ट. ठीक है, मीडियास्टाइनल शिफ्ट में हम क्या क्या देखते हैं, 2 चीजें देखते हैं. ट्रेकिया फॉर अपर मीडियास्टाइनम एंड हार्ट फॉर लोअर मीडियास्टाइनम. सो अगर मीडियास्टाइनल शिफ्ट कॉन्ट्रालेटरल साइड है, मतलब कोई चीज उसको पुश कर रही है उस तरफ, है ना. सो क्या होगा, या तो प्लूरल इफ्यूजन होगा या फिर कोई मास होगा. ना बहुत सारे बड़े बड़े चेस्ट मासेस होते हैं, बच्चों में हम देखते हैं चेस्ट वॉल का ईविंग सार्कोमा, कभी कभी एटकिंस ट्यूमर होता है. ठीक है, बड़ा सा चेस्ट वॉल का ट्यूमर होता है, पूरी चेस्ट को, मीडियास्टाइनम को दूसरी तरफ पुश कर देता है. या मोस्ट कॉमनली जो कि आप क्लिनिकल प्रैक्टिस में देखोगे इज अ प्लूरल इफ्यूजन विच कॉजेस अ कॉन्ट्रालैटरल मीडियास्टाइनल शिफ्ट. सो इफ दिस वाज द क्वेश्चन and the mediastinum was shifting towards the contralateral side, the answer here would be a pleural effusion. But अगर इप्सिलैटरल शिफ्ट है मीडियास्टाइनम का, मतलब जिस तरफ ओपेक हेमीथोरैक्स है उसी तरफ हमारा ट्रेकिया शिफ्ट हो रखा है, मतलब उस जगह पे वॉल्यूम लॉस है. सो इफ देयर इज इप्सिलैटरल mediastinal shift, the mediastinal shift is towards the ipsilateral side, same side, then the answer would be collapse. ठीक है, तो आप बताओ क्या था आंसर. सो सर अगर नो शिफ्ट है एंड एक साइड फुल वाइट था एंड एक साइड थोड़ा थोड़ा वाइट था, ठीक है, एक साइड थोड़ा थोड़ा वाइट था. सो हम तीसरा ऑप्शन देख लेते हैं. अच्छा, मीडिया फाइनल शिफ्ट का आई अगेन राइट हेयर बिकॉज अगेन वहाँ पे इमेज छुप रही होगी आपकी. सो मीडिया फाइनल शिफ्ट, कॉन्ट्रालेटरल साइड एंड इप्सीलैटरल साइड. अगर कॉन्ट्रालैटरल साइड है तो क्या हमारी डीडीज हुए? प्लूरल इफ्यूजन. दूसरा लार्ज लंग या फिर चेस्ट वॉल मास. अगर इप्सिलैटरल साइड है, उसी साइड शिफ्ट हुआ जिस तरफ ओपेक हेमिथोरैक्स है, मतलब कोलैप्स है. एंड अगर नो शिफ्ट, अगर नो शिफ्ट हुआ, मीडिया फाइनल शिफ्ट ही नहीं हुआ, तब हमारा आंसर बनेगा कंसोलिडेशन. ठीक है, तो बताओ क्या है? हाँ, तो अगर कोई शिफ्ट नहीं है तो आंसर कंसोलिडेशन है. अगर सेम साइड शिफ्ट हो गया है ओपेक हेमिथोरैक्स का तो मतलब कोलैप्स हुआ है. अगर दूसरी साइड शिफ्ट हो गया है तो मतलब प्लूरल इफ्यूजन है. सो आप बताओ, डिपेंडिंग अपॉन द इमेज द डायग्नोसिस वुड डिफर. ठीक है, तो अगर आपका दूसरी साइड, एक साइड मान लो वाइट है, एक साइड ओपेक हेमिथोरैक्स है, उस तरफ कोई मीडिया फाइनल शिफ्ट नहीं है, एंड कॉन्ट्रालैटरल लंग में थोड़े थोड़े पैचेस वाइट के हैं, मतलब इन्फेक्शन हो रखा है, कंसोलिडेशन है. सो दैट विल अगेन फेवर कंसोलिडेशन. ठीक है, सो लेट्स मूव ऑन टू द नेक्स्ट क्वेश्चन. So some students told me that there was an image of a urethral stricture also given. Now I'm not sure where the stricture was shown in that particular image. ठीक है, as and when the recalls come through, I'll again take a session and tell you what were the exact questions. But for the purpose of discussion, let's take this image. ठीक है, this is an image of urethral stricture. So first of all, tell me whether this is the image that was given to you in the exam. Tell me. So first of all, tell me the investigation. So first of all, this is an RGU. This is an RGU. The anterior urethra is very well seen and you can see the cannula which has cannulated the urethra. So this is an RGU which is done to investigate urethral strictures. ठीक है, done to investigate urethral stricture. Now, जब भी हम RGU करते हैं ना, रिमेंबर यही इमेज दे रखी थी. ठीक है, सेम इमेज दे रखी है. अब हम इसको अच्छे से डिस्कस करते हैं. तो अगर ये वाला हमारा पार्ट हो गया ब्लैडर का, ठीक है, ये वाला हमारा पार्ट हो गया ब्लैडर का. जब भी हम एक RGU करते हैं, रेट्रोग्रेड यूरेथ्रोग्राम. रेट्रोग्रेड क्यों बोला? यूरिन का नॉर्मल यूरिन की डायरेक्शन क्या है? फ्रॉम ब्लैडर टू आउटसाइड. RGU में हम क्या कर रहे हैं? हम कंट्रास्ट डाल रहे हैं फ्रॉम आउटसाइड टू द ब्लैडर. रेट्रोग्रेड डायरेक्शन में हम कंट्रास्ट डाल रहे हैं. सो द इन्वेस्टिगेशन इज RGU. ठीक है, फर्स्ट ऑफ ऑल नाउ RGU में कौन कौन से स्ट्रक्चर्स होते हैं, यूरेथ्रा के पार्ट्स कहाँ कहाँ होते हैं, लेट्स जस्ट लेबल देम. सो जो ये सबसे बड़ा पार्ट है यूरेथ्रा का, ये पूरा पार्ट, ठीक है, दिस इज आवर पेनाइल यूरेथ्रा, दिस इज आवर पेनाइल यूरेथ्रा. नाउ बल्बर यूरेथ्रा कौन सा पार्ट होता है? ये जो थोड़ा सा डायलेटेड सा पार्ट होता है ना नॉर्मली, दिस इज अवर नॉर्मल बल्बर यूरेथ्रा. इसके अब मैं मेम्ब्रेनस को नहीं लेबल करूंगा, आई विल लेबल द प्रोस्टेटिक यूरेथ्रा फॉर यू गाइस. नाउ ये जो छोटा सा स्मूथ सा आपको दिख रहा है, पतला सा इंप्रेशन पड़ रहा है उसके ऊपर प्रोस्टेट का, दिस पार्ट इज योर प्रोस्टेटिक यूरेथ्रा. एंड फाइनली इन दोनों के बीच में ये वाला जो पार्ट बच जाता है, दिस इज अवर मेम्ब्रेनस यूरेथ्रा. ठीक है, कुछ लोग बोल रहे हैं थोड़ा अलग सा था, कुछ लोग बोल रहे हैं सेम इमेज थी. तो चलो लेट्स कंसिडर दैट इफ दिस वाज एन इमेज दैट वाज गिवन, तो इस केस में हमारा स्ट्रक्चर कौन से पार्ट में है आप बताओ? इस केस में मेम्ब्रेनस पार्ट में है हमारा स्ट्रक्चर. अगर आपको लोग बल्बर बोल रहे हैं इस इमेज का आंसर, तो वो गलत होगा. बल्बर यूरेथ्रा में आपका कहां पर स्ट्रक्चर होगा? बल्बर यूरेथ्रा में इस वाली लोकेशन पर आपका स्ट्रक्चर होगा, यहां पर स्ट्रक्चर होगा बल्बर यूरेथ्रा में। ठीक है, मेम्ब्रेनस यूरेथ्रा जंक्शन पे होती है, प्रोस्टेटिक के जस्ट बाद होती है मेम्ब्रेनस यूरेथ्रा। मेम्ब्रेनस यूरेथ्रा के स्ट्रक्चर इस जगह पर होगा आपका। सो डिपेंडिंग अपॉन द क्वेश्चन एंड द इमेज द आंसर वुड चेंज। सो प्रोस्टेटिक एनलार्जमेंट में, ठीक है, प्रोस्टेटिक एनलार्जमेंट में हम पहली बात कभी भी आरजीयू नहीं करते। अगर प्रोस्टेटिक एनलार्जमेंट होता है, प्रोस्टेटिक एनलार्जमेंट पहली बार अगर वो यूरेथ्रा को कंप्रेस करता है, तो क्योंकि पोस्टीरियर यूरेथ्रा है तो उस केसेस में हम एमसीयू करते हैं और अवॉइडिंग सिस्टोयूरेथ्रोग्राम, नॉट एन आरजीयू। आरजीयू इज यूजुअली डन फॉर एंटीरियर यूरेथ्रा पैथोलॉजीज। ठीक है, सो प्रोस्टेटिक एनलार्जमेंट नहीं होगा इसका आंसर। ठीक है, चलो नेक्स्ट क्वेश्चन वील डिस्कस नाउ। आइडेंटिफाई द लीजन्स सीन इन द फॉलोइंग इमेज एंड this was not the exact language of the question. The question students told me was a big question, proper clinical vignette types, and उसमें question में smoker दे रखा था। ठीक है, so first of all chest X-ray दे रखा है हमें, bilateral well defined rounded radio opacity। so मैंने क्या क्या बोला? bilateral well defined rounded opacities। ठीक है, लाइक अ बॉल। ठीक है, तो जब भी स्मोकर दे रखा है आपको, मतलब पेशेंट इन्फेक्शन की तरफ हम नहीं सोच रहे। ठीक है, तो सेप्टिक एम्बोलाई हम अनलाइकली बोलेंगे, ट्यूबरक्लोसिस हम थोड़ा अनलाइकली बोलेंगे। अब आपको क्वेश्चन में डिफरेंट कंफ्यूजन लग रहा हो कि सर कैनन बॉल मेट्स बोले हैं इसको कि फंगल बॉल्स बोले हैं एस्परजिलोमा की। ठीक है, सो पहली बात, स्मोकर अगर आपको दे रखा है, सो यू आर हिंटिंग टुवर्ड्स अ लंग कार्सिनोमा, यू आर हिंटिंग टुवर्ड्स अ कैंसर। सो उस केस में भी कैनन बॉल मेट्स ज़्यादा लाइकली होंगे। प्लस जो फंगल बॉल के एस्परजिलोमास बनते हैं उनमें हम क्या देखते हैं? हम उनमें मोनॉड साइन बोलते हैं, मोनॉड साइन देखते हैं, या फिर एयर क्रिसेंट साइन, कि एक कैविटी होगी, उसके अंदर एक फंगल बॉल होगी एंड हमें एक्सरे पर एक ब्लैक सी शैडो दिखेगी एयर की इन बिटवीन द कैविटी वॉल एंड द फंगल बॉल। तो इस केस में तो हमें कोई भी ऐसी एयर क्रिसेंट नहीं दिख रहा। सो फंगल बॉल एस्परजिलोमा इज अनलाइकली। आंसर हियर इज सिंपल, कैनन बॉल मेट्स। ठीक है, कैनन बॉल मेट्स, पल्मोनरी मेट्स। ऑप्शंस वर, अच्छा वेट लॉस भी दे रखा था 10 kgs का। ओके, ऑप्शंस वर कैनन बॉल, पल्मोनरी मेट्स। ठीक है, सो डिफ्यूज, हाँ मिलियरी टीबी ऑप्शन में था। ठीक है, ट्यूबरक्लोसिस नहीं होगा, मिलियरी टीबी होगा। मिलियरी का मतलब क्या है? मिलेट्स लाइक। अगर मिलियरी टीबी था ऑप्शंस में, मिलियरी टीबी अगर ऑप्शंस में था तो मिलियरी का मतलब है मिलेट्स लाइक, छोटे 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 छोटे। तो उन केसेस में एक्सरे कैसे दिखता? ऐसे छोटे 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 आपको रेडियो ओपेसिटीज दिखती दोनों लंग्स में। बायलेटरल होता है मिलियरी टीबी। ठीक है, तो हाँ मुझे स्टूडेंट्स ने ये बोला कि सर हमें कंफ्यूजन हो रहा था फंगल बॉल ऑफ एस्परजिलोमा वर्सेस कैनन बॉल मेट्स में। सो ये दोनों का डिफरेंस होगा कि जो फंगल बॉल्स होंगे एस्परजिलोमा के, उनमें एयर क्रिसेंट दिखेगा। प्लस एक जो एस्परजिलोमा होता है ना, इट अकर्स इन अ प्रीवियसली फॉर्म्ड कैविटीज। तो आपको कोई हिस्ट्री दे रखी होगी, पास्ट हिस्ट्री ऑफ ट्यूबरक्लोसिस, आपको अपर लोब्स में यहाँ पर कोई कैविटेशन हो सकता है मिल रही हो उस केसेस में, बट दिस इज सिंपल केस ऑफ अ कैनन बॉल मेटास्टेसिस। ठीक है, चलो नेक्स्ट क्वेश्चन पर आते हैं। विच ऑफ द फॉलोइंग एक्टिव सब्सटेंस इज यूज्ड इन पेट स्कैन? ठीक है, आई डोंट नो दिस वाज द एग्जैक्ट लैंग्वेज ऑफ द क्वेश्चन। टेल मी इन द कमेंट्स सेक्शन व्हाट वाज द एग्जैक्ट लैंग्वेज ऑफ द क्वेश्चन। बट आई थिंक अगर पेट स्कैन की बात कर रहे हैं, पेट की फुल फॉर्म क्या है बताओ? पेट की फुल फॉर्म क्या है? यस, पोजिट्रॉन एमिशन टोमोग्राफी। रॉन्ग क्वेश्चन है। कौन सा रॉन्ग क्वेश्चन है यार कालू? कौन सा रॉन्ग क्वेश्चन है बताओ? तो आप बताओ पेट स्कैन में कौन से रेडियो आइसोटोप यूज करते हैं? स्ट्रेट ऑप्शन है, स्ट्रेट आंसर है 18 फ्लोरोडीऑक्सी ग्लूकोज, 18 FDG, ठीक है, 18 फ्लोरोडीऑक्सी ग्लूकोज, ठीक है, क्यों? बिकॉज इट इज अ positron emitter, this is a positron emitter and hence we use this in PET scan, ठीक है। टेक्नीशियम 99 क्यों नहीं यूज करते हैं पेट में? बिकॉज गामा एमिटर है, ठीक है, गामा रेज निकालेगा एंड गामा इमेजिंग में यूज करेंगे, ठीक है। डीऑक्सी ग्लूकोज अलग से हम नहीं यूज कर सकते, क्यों? क्योंकि वो हमारे पोजिट्रॉन नहीं निकाल सकता। 18 फ्लोरीन इज द एक्टिव कंपाउंड इन द FDG जो कि पोजिट्रॉन निकालता है। एंड आयोडीन 131 अगेन हम पेट में नहीं यूज कर सकते, हम कहाँ यूज करते हैं? रेडियो एक्टिव आयोडीन एब्लेशन में यूज करते हैं, राइट। हाँ, FDG का फुल फॉर्म था ऑप्शन में, सो 18 फ्लोरोडीऑक्सी ग्लूकोज, ठीक है, 18 FDG 18 फ्लोरोडीऑक्सी ग्लूकोज जो कि हम पेट में यूज करते हैं, ठीक है। नाउ नेक्स्ट क्वेश्चन पे जाते हैं। सो स्टूडेंट्स ने मुझे बोला था कि एक CT हार्ट के लेवल पे CT चेस्ट दे रखा था एंड इट वाज अ प्रोन इमेज, सो द हार्ट वाज एंटीरियर एंड स्पाइन वाज पोस्टीरियर। एंड जो स्टूडेंट ने मुझे बोला है कि ये वाला जो कार्डियक चेंबर था, ये वाला कार्डियक चेंबर पूछा हुआ था, यही है क्या क्वेश्चन? ये वाला कार्डियक चेंबर बोल रहे हैं स्टूडेंट्स, ये वाला कार्डियक चेंबर पूछा हुआ था। सो द रिमेंबर, जब भी हमें CT चेस्ट दे रखा हो, ठीक है, CT चेस्ट का एक सिंपल फंडा है कि मोस्ट एंटीरियर हार्ट चेंबर, मोस्ट एंटीरियर हार्ट चेंबर इज योर राइट वेंट्रिकल। मोस्ट एंटीरियर मतलब स्टर्नम के बिल्कुल पीछे, स्टर्नम से बिल्कुल पीछे, ठीक है, इज योर राइट वेंट्रिकल। एंड इसी का उल्टा कर दो, मोस्ट पोस्टीरियर चेंबर कौन सा है? राइट का लेफ्ट कर दो एंड वेंट्रिकल का एट्रियम कर दो। लेफ्ट एट्रियम इज द मोस्ट पोस्टीरियर चेंबर ऑफ द हार्ट। अच्छा, cadaveric image was given, not the CT image. Okay, cadaveric image was given, but the concept is same. Most anterior chamber is the right ventricle and most posterior chamber is the left atrium. ठीक है, सो ये हमने ये लेबल भी कर लिया है कि LA is the most posterior, RB is the most anterior. सो इस लेवल पे हमारी स्टर्नम होगी at the upper level, ठीक है, एंड इसके जस्ट पीछे इज योर RV, करेक्ट। ठीक है, so these were the radiology questions that I could get from the students. So if there were any other radiology questions, so you please mention them in the comment section, comment box, live chat. ठीक है, I'll wait for one more minute. If there are any more radiology questions, we can discuss them happily. So answer here would be LA. Left atrium is the most posterior heart chamber. राइट एट्रियम ना एंटीरियर ना पोस्टीरियर। राइट एट्रियम के साथ हम क्या याद रखेंगे? राइट एट्रियम फॉर्म्स द राइट हार्ट बॉर्डर। ठीक है, राइट एट्रियम फॉर्म्स द राइट हार्ट बॉर्डर, लेफ्ट वेंट्रिकल फॉर्म्स द लेफ्ट हार्ट बॉर्डर। ठीक है, तो मतलब राइट हार्ट बॉर्डर में ना राइट वेंट्रिकल है एंड लेफ्ट हार्ट बॉर्डर में ना लेफ्ट एट्रियम है। क्यों? क्योंकि लेफ्ट एट्रियम पीछे है और क्योंकि लेफ्ट एट्रियम पीछे है हमारा और राइट वेंट्रिकल आगे है, तो वो हमारे चेस्ट एक्सरे पे राइट एंड लेफ्ट साइड ऑफ हार्ट नहीं बना सकते। राइट साइड राइट एट्रियम बनाता है एंड लेफ्ट साइड ऑफ द हार्ट ऑन चेस्ट एक्सरे लेफ्ट वेंट्रिकल। ठीक है, अगर क्रॉनिक स्मोकर से स्टार्ट हुआ, 10 kg वेट लॉस था लास्ट 3 मंथ्स में, फीवर भी अभी आ गया, यार बहुत कुछ डिपेंड करता है क्वेश्चन में कि आपका चेस्ट एक्सरे कैसे था. अगर टीबी होता है ना, अगर टीबी का चेस्ट एक्सरे है तो आई टेल यू टीबी के चेस्ट एक्सरे की क्या खासियत होती है. इट हैज नोड्यूल्स, कैविटेशंस एंड कंसोलिडेशंस. ठीक है, नोड्यूल्स भी कैसे, ट्री इन बर्ड, ऐसे बड़े बड़े मासेस नहीं आते टीबी में. दिस इज वेरी टिपिकल ऑफ अ मेटास्टेसिस. ऐसे बड़े बड़े मासेस अगर आपको दिख रहे हैं बोथ लंग्स में स्कैटर्ड, दिस इज वेरी टिपिकल ऑफ कैननबॉल मेट्स. So with this we'll complete our radiology discussion. If there are any more radiology questions, please put them in the live chat. I'll discuss them happily in a day or two. Thank you.
Hi dear students, the FMGE 2024 is over and I hope you people have done your best. So don't think कि भाई कैसा हुआ, क्या हुआ, क्यों हुआ, बस you have done, that means you have done. Now the most important part is what about surgery? Surgery का जो पेपर था, what I feel it was a good paper. There are a lot of conceptual questions were asked. लेकिन सबसे बड़ी प्रॉब्लम क्या है भाई, मैंने तो पेपर दिया नहीं. I have not given the paper. So what is the problem that I'm not able to recall all the questions. So statutory warning before starting this recall session, don't do my leg pulling. I have tried my level best. From you people only, I have tried to gather the information. Just I wanted to come and discuss few things. That is why I have come and I'm trying to disclose it. Whatever I have just gathered from you people. So there were a lot of questions and I don't know who is behind this 4 years. Almost every session of FMG and last 2 years we have seen this in NEET PG also. We get a question from 4 years gangrene. No one was able to tell me what were the options. So yes, if this was the image or this is the kind of image, this is what is a classical 4 years gangrene. If something could have been created, you could have a high, I don't know about what was the question, but yes, on the other side, if someone gives me this image, I would say 4 years gangrene. Otherwise, if someone gives me a history that, okay, some Kashmiri people, this and that, and living in cold areas, so there could be a chimney sweep ulcer also in this. So that can also have a similar presentation, but high probability that it was a question on 4 years gangrene. Next is, there was a question on RTA. They have, whatever has been recalled has been put up. So RTA, a patient of shock with hypotension. So patient is having shock, hypotension, then E fast is negative. Students, very important. E fast is negative means hypotension cannot be due to cardiogenic shock also. Why cardiogenic shock cannot be there? Because E fast is going to take that window. So hypovolemic shock, yes, is there, but if hypovolemic shock is there, at least the fluid should be seen in the both the thorax also or in the abdominal cavity, which is negative, and thus the answer for this, where no one has recalled the option, I don't know, but neurogenic shock should be the answer. मैं आगे का question ही नहीं पढ़ता, but try to understand. ECG is normal, SpO2 is 93, hypotension with bradycardia. This is what is, someone was saying bradycardia, but here pulse rate is 80, but that is okay, normal. So again, this is a confusion. Whosoever has recalled the information is still missing. But one very important thing is, since the E fast is also negative, the chances of hypovolemic shock without an external source of bleeding is quite rare in this case. Next question, which organ has the highest rate of you can say transplant rejection? Do you know the maximum rate we have is for the lung? The lung transplant is having almost 80%, or you can say 60 to 80% rejection rate, and the least is for the liver. So the least rejection is for the liver and the kidneys, and the highest is for the, you can say, lungs. So order mein agar dekhoge, so it is lungs, then you have the kidneys, then you have the liver. Next is, which structure is spared in the neck surgery? Okay, it should be the neck dissection basically when we talk about the lymph node dissection. When we talk about the lymph node dissection, sternocleidomastoid, yes, we go for. Internal jugular vein, yes, we go for. Then we have the spinal accessory nerve. We also go for the parotid and the submandibular gland. So tail of the parotid is taken and submandibular gland is taken, but carotid is never taken. So carotid is not the answer in this case. Then most common complication of ERCP, I don't know what is, if this was a question. When we talk about ERCP, you know this is what? 11 o'clock is the entry for the CBD, 4 o'clock is the entry for the main pancreatic duct. Now when you want to enter, you have to cut the sphincter. This is what is known as sphincterotomy, and whenever you do sphincterotomy, students, you cannot stop hemorrhage from happening. So hemorrhage is the most common. The second most common will be the pancreatitis. How pancreatitis might happen? You may damage the 4 o'clock also. That is why pancreatitis. So hemorrhage is very common complication. Next is 55-year-old patient underwent Pastillau's. So try to understand what is Pastillau's surgery. Pastillau's surgery, also known as Partington-Rochelle surgery, is done for chronic pancreatitis without any head mass. So simple duct is dilated, and that is why you go for what anastomosis? Longitudinal pancreatico-jejunostomy. LPJ is done. When you're doing LPJ, you are not doing any dissection around the pylorus or you can say the foregut motility or mobility is not affected in this. Generally, what was the click here? Lot of you believe that a patient underwent the phrase, a patient underwent the Whipples. दोनों में difference है. If you do Whipples, you are dividing the first part of duodenum. This is duodenum sacrificing surgery. When you're sacrificing the duodenum, the pyloric nerves fiber are, you can say, a bit damaged, or temporarily they are damaged, and that is why delayed gastric emptying is there, and that is why we go for feeding gastrostomy. So बच्चे यहाँ पर patient ने FJ किया है, the patient has undergone LPJ, longitudinal pancreaticojejunostomy. If I would have been the surgeon, I would have gone for oral feeding. This is what is very, very, very important. Simple oral feeding on the day 1 or day 2 is also accepted in this case. There is no complication. You can confidently go for oral feeding. या बहुत ज़्यादा अगर if RT Riles 2 would have been placed, I would have RT feed. So feeding gastrostomy, why will I do a feeding gastrostomy? Feeding gastrostomy is done only when you have 4 weeks or beyond that. You want to plan something. So either RT feed would have given, or I would have said, भाई patient को simple खाना खिलाओ, पानी पिलाओ. This is what. So oral feeding is the answer. Then a patient with right epigastric pain, serum amylase is elevated. This is the recall. If I believe that this is the recall, the most you can say likely diagnosis, एक ही option दिया. Option भी और recall कर लेते. Anyways, let us see if the pain is radiating towards the back. You should have also evaluated, I don't know, lipase is given in the option or no, acute pancreatitis would have been the answer. बच्चे ये सारी चीजें अच्छे से आपको क्लास में भी पढ़ाई गई हैं. Management of 12 centimeter incisional hernia. I have taken hernia in great depth and detail. Hernia is my favorite topic to do also, to teach also. बच्चे 12 सेंटीमीटर का hernia है. If that is the quality, I know that whatever hernia we have, at least 4 centimeters extra mesh repair should have been done. And what is the surgery? You have to reduce it. Mesh repair. If laparoscopically you will do, I will go for IPOM or extended TAP. If this is not given in the option, recto-rectus mesh repair. What is recto-rectus? Or you can say pre-peritoneal mesh repair. Each and everything has been taught. Hernia pe, I think 2 questions have been asked. So recto-rectus mesh repair, अगर open करोगे mesh और pre-peritoneal. बच्चे anatomical repair इतने बड़े defect के लिए नहीं करते. This is done for a smaller defect. Next is lymphedema and bluish nodules after radical mastectomy. Now I'm still waiting for this, whether this is a recall or no, but I can correlate that if there was an image or anything like that, if there is a history of mastectomy, long-standing history of mastectomy, this could be lymphangiosarcoma. So lymphangiosarcoma could have been the answer, or this is also known as Stewart-Treef syndrome. Students, I really apologize. I don't know what were the options. Rather, the questions were also not recalled properly. One-liner recall is not justified. Next is laparoscopic mesh in inguinal hernia. Remember, the mesh we use is always polypropylene mesh. Polypropylene mesh. Bachche, in class also, in revision also, I have discussed this polypropylene mesh. The quality of mesh should be lightweight macroporous mesh. मैंने क्लास में भी पढ़ाया था ना भाई, अगर लड़की को लड़का पसंद करना है तो कैसा पसंद करेगा? हल्का. Then मोटा की हल्का. The second is macroporous, so that he should be absorbing everything, not reverting back. So macroporous will absorb microfibroblasts, fibroblasts, collagen, and that is why better. Hydrophilic कि hydrophobic character और सारी चीजें होती हैं. Hydrophobic मतलब समझ गया ना बच्चे? Because if it is reflecting water, it is less prone to get infected. So all these things are discuss. अब I don't know what was the option, किसी ने भी option recall नहीं किए, पर मैंने ये चीज आपको बताई. Then post cholecystectomy, swelling and pain in the leg muscles. बच्चे, what could be the answer? Post surgery, swelling and pain. Answer is it could be DVT, and thus I would be going for Doppler study here. This is what is. If this was the question, ये question ही है DVT का, cholecystectomy से लेना देना नहीं. Yes, I was going through the question. There was again someone said that there is a question of cholecystectomy with post-surgery detected to be cancer invading the muscle. What is the next? If it is post-surgery cancer invading the muscle, you have to go for radical cholecystectomy. What is radical cholecystectomy? If that question was there, I don't know what is the authenticity. So if that question was there, radical cholecystectomy with 2 centimeter mass of the, you can say, gallbladder fossa around the liver. If radical cholecystectomy cannot achieve healthy margins, you will go for extended cholecystectomy, where you will be taking out the segment 4B and 5 also. Next is patient with history of progressive dysphagia, initially to solid. Agar solid hai, then that is either because of the malignancy or because of the stricture. With weight loss, now this is what is malignancy, what is the best investigation. I think upper J endoscopy tha, barium was there in the option, or CT was there. CT is the investigation of choice for this case. This is the malignancy that we are having. Now, sure sign of abdominal descent. I am not able to understand who has recalled this question, because someone who has recalled has not told me the options. How can I tell you? However, if there is abdominal wall dehiscence, let me tell you, not the wound dehiscence, divarication or the gapping of or gaping of the recti, divarication of recti is very, very, very common here. Condomylata acuminata, what is the management? Answer is excision. This is one option. So second option, by what is condomylata? It is a locally eruptive mass, warts. Second option is topical podophyllin, topical imicumod or podophyllin can be also used. So topical imicumod or podophyllin can be. Agar nahi dekha, so go to Surgery Dada. In my YouTube channel, I have uploaded this case of condylomata acuminata of the perineum. But say apart from that, there were other questions which I can recall. Boundaries of the Hasselbeck's triangle. When we talk about the Hasselbeck triangle, you have the base made by the inguinal ligament. Then who is making the superolateral border? Try to understand. Inguinal ligament is one boundary. The superolateral boundary, who is making the superolateral boundary? Answer is inferior epigastric vessels. And along with that, the medial boundary is made by the lateral border of rectus. So this was the question. Then the inferior epigastric vessels. एक question था EHS, European Hernia Society में, what is the PL2? What do you mean by PL2? You know, EHS में E for etiology, H for hernia size, S for the site. वैसे ये है EHS ऐसे नहीं, remember it like this, but it is European Hernia Society. So etiology, it is not associated with any cause, so it is primary. When we talk about the hernial defect, so it is one finger space, so 1F is one finger width up to 1.5 centimeter. What do you mean by students? 2F, 2F means more than 1.5 up to 3, and 3F is more than 3 centimeter, and S means if it is M, then that means a direct hernia, that is medial. If it is L, that is indirect, and if it is F, that is femoral. So यहाँ पर क्या है? PL2, it's a primary. PL2 stands for it's a primary indirect inguinal hernia with at least 1.5 to 3 centimeter defect or 2 finger breadth defect size. Then there was a question, what is not seen in refeeding syndrome? Hypokalemia, hyperkalemia, hypophosphatemia and hypocalcemia. बच्चे hyperkalemia is not seen, hypokalemia देखी जाती है. Amongst them hypophosphatemia is the most important. Then there was a question with MEN syndrome और उन्होंने पूछा था MEN1. Remember MEN1 3 target organ, parathyroid, pituitary and pancreas. Amongst them parathyroids are the most important. Parathyroid adenoma is seen. FIO is seen with MEN2, not MEN1. Parotid tumor नहीं होता है. Parotid tumors और यू कैन से पैरोटिड ग्लैंड ट्यूमर है, पिट्यूटरी ट्यूमर नहीं है. सो वो विजुअल हेलुसिनेशन मत करना, समझे कि नहीं. पैराथायरॉइड एडिनोमा इज द आंसर. देन समवन टोल्ड मी दैट देयर वाज अ क्वेश्चन ऑन ईसोफेजियल एट्रेसिया, बट आई कुडंट रिकॉल. मैंने जानने की कोशिश करी कि भाई क्या मैनेजमेंट हो गया, तो सर याद नहीं आ रहा है. सो ईसोफेजियल एट्रेसिया, इफ दैट वाज रूलिंग ऑफ सलाइवा, इनिशियल इज बेबी ईसोफेगोग्राम. Yes, if you get to see a blind pouch, that's an atresia is confirmed. Blind pouch with a gas in the stomach, it is atresia with fistula and type C type. This is what is very, 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 very important. So what is the next line management? If you suspect it is pure atresia, go for an esophagogram, done. If you suspect it to be tracheoesophageal fistula, the next line investigation is not an esophagogram, क्योंकि esophagogram में contrast दिया तो सीधा का सीधा वो कहाँ चला जाएगा? ट्रेकिया में चला जाएगा. So bronchoscopy, flexible bronchoscopy is the investigation. Then I think someone has shared an image. I don't know, it's an Edison forceps was asked or DeBakey's forceps was asked, because DeBakey is the vascular forceps similar to looking like that. We have a DeBakey's also. We have the Edison forceps also. Then there was a question with gastrochesis basically. Gastrochesis का management पूछा है. So what is the management? Gradual reduction with a silo bag is the initial thing. So you will tie and suture up a silo bag and reduce it gradually. Once it is reducible, the traction reduces, then you have to go for primary approximation. बच्चे first line management immediate surgery नहीं होता. You need to prevent this bowel from hypothermia. So put a silo bag, close it, tighten it progressively and try to reduce the bowel as much as possible. Then there was a question on the breast cancer drug tamoxifen. So I don't know what was the question, but yes, if tamoxifen was asked, it's a SERM and it is used as a chemopreventive drug also in post-surgery for premenopausal or perimenopausal females who are ERPR positive. I think there was an image of SAH, subarachnoid hemorrhage. So if you see SAH, दिस इज क्लासिकल इमेज ऑफ SAH. ये पूछी थी कि SDH पूछी थी, ये बताना जरूर कमेंट में कि क्या पूछा था. आई एम स्टिल वंडरिंग व्हाई स्टूडेंट्स वर नॉट एबल टू रिकॉल दीज इजी क्वेश्चन. देयर वाज अ क्वेश्चन ऑफ मोबाइल लम्प with ERPR positive, HER2 negative. So if ERPR positive, HER2 negative, it could be luminal A, luminal B. अब ये नहीं पता है luminal A और B के लिए Ki67 values were given or no. Low Ki67 values, yes, it's a luminal A. High Ki6 values, it's a luminal B. Then there was a question on choledochal cyst. Someone has asked us. I don't know whether it is there or no. Choledochal cyst, I have covered this is again in revision in the class also. Abnormal biliopancreatic junction, ABPJ is the cause, reflux of pancreatic juice causing cystic dilatation, and yes, it's a risk for cancer. But remember, the management is not open and drain. Resect it above the level of the confluence of cystic duct with the common hepatic duct. Excise that level and Roux-en-Y is the call. Then I think burn patient with the burn involving the anterior chest and the abdomen. So if you talk about anterior part of the chest and the abdomen, 18%, let us see. Then the full arm, then 9%. Anterior and posterior thigh, again you should take it like 5%, 10%. So almost it is turning out to be 35 to 36% is the call. This is what is the answer. Next 36%. CAGB with muscle invasion, I have already told you. Post orchidectomy, Ringke's crystal, this is straightforward. It is a Leydig cell tumor. It is a Leydig cell benign tumor. Patient with hypercortisolic symptoms, ये अच्छा question आपके level पे आया. Patient with hypercortisolic symptoms with ACTH elevated, majority of the case of this is a Conn's disease. It is from the pituitary or the central origin. लेकिन अगर central origin का tumor होगा, that would always responds to a dexamethasone suppression. So dexamethasone suppression fails. So this is an ectopic ACTH which is or producing tumor. This is what is the best answer. So one is far better than the third. Next question is RTA with maxillofacial trauma, severe. What is the next way to establish airway? Either cricothyrotomy or tracheostomy. I don't know what were the options. Then history of women with 10 years surgery. And I think ये वही lymphangiosarcoma या Stewart Reeves का है. Again, students, whatever has been done. Don't panic. This was your attempt, your chance. Just stay cool, calm, enjoy your day. Whatever questions I could have recalled, I would have brought. हम दोबारा आएंगे again with the better options, better and more correct recalls. So I hope you're enjoying learning with Ellen next.
Hello, good evening students. Hope your paper went well. Hope you have fought well. I am really excited for the fact that in orthopedics for the first time there were 3 questions asked which you already were aware of. Like we taught it in great detail to a great extent.
We have talked about it. And let's talk about the recall what we have collected in the form of the questions. You see, this probably in my experience in the recent years, this probably is for the first time asked question, like in a patient with localized bone pain exaggerated in night, relieved on taking aspirin. Now, possibility is there that you already are aware of the answer for this question. The moment you have seen this sentence, you know that there is more bone pain which is happening at night and is relieved dramatically by aspirin. We have talked it in detail that if you get this sense in a question, then answer for your that particular question is certainly osteoid osteoma. So what is the most likely condition the patient is suffering from? Now, इस point पे we also trying to gain that whatever is being mentioned in the question in the form of the options, was it correct or not, right? Because it's all about the recall that is happening right now. So what is the most likely condition the patient is suffering from? And obviously the answer for this question straight away is osteoid osteoma. Like majority of you must have answered this question. All right. Why this osteoid osteoma is having this kind of a feature where there is a relief of pain on taking aspirin? Because the lesion it contains prostaglandins and cyclooxygenase. And when you give a COX inhibitor to the patient, obviously there is going to be a dramatic relief in the clinical features. That is point number one. Point number two, the X-rays were provided to you, and in the X-ray there is a radiolucent nidus within the long bone cortex. All right, a radiolucent nidus within the long bone cortex, which is diagnostic for osteoid osteoma. You see, in any other benign tumor, the diagnosis is not certain. The diagnosis means it is always suggestive of, like the X-rays are suggestive of this particular tumor. But in osteoid osteoma, because the possibility of getting this tumor to convert it into a malignant one is extremely rare, so you can make out or you can come out with the diagnosis, and the diagnosis for this condition is certainly the osteoid osteoma, right? All right. So hopefully you have answered this particular question correct. This is possibly the first time, I mean, those who have attended the class, just by reading the question out might have appeared, means answer would have flashed in front of them, all right, in the form of osteoid osteoma, right? Next question is, a 34-year-old patient after sustaining injury to his right lower limb had a limb kept in external rotation and apparently lengthened. That means the right lower limb is lengthened and was kept in external rotation. What is the most probable diagnosis the patient is suffering from? You see, let's talk about the dislocations of the hip joint. Now, you already are aware of the fact that in posterior dislocation of the hip joint, there is adduction and internal rotation, while in case of anterior dislocation of the hip joint, there is abduction and external rotation, right? Now, in case of posterior dislocation of the hip joint, because when the head of the femur is out of the acetabulum, it will migrate proximally, so there has to be a true shortening of the limb. But in case of anterior dislocation of the hip joint, when it is moved out, the proximal migration of the head of the femur is prevented by rectus femoris muscle anteriorly, as a result of which there is no shortening. All right. So possibly the question is pointing towards anterior dislocation of the hip joint. Now, what are the key features which goes in favor of, or before marking the correct answers down? External rotation is one thing which is provided to you that goes in the favor of anterior dislocation of the hip joint. Point number two. Now, there is apparent lengthening of the limb which doesn't mount to true lengthening of the limb, but in posterior dislocation of the hip joint, there is certainly a shortening. In fracture neck of femur, there is to some extent a shortening, while in case of subtrochanteric fracture, if it was provided to you in the option, in any fracture of the lower limb, there has to be a shortening because of the overriding. This is the only condition you are left with where there could be apparent lengthening of the limb along with the external rotation deformity. So what is the most probable answer for this particular question is the anterior dislocation of the hip joint. Now, in anterior dislocation of the hip joint, Devendra, yes, very good. It is Faber or father. But you know, father is for flexion, adduction, internal rotation, which is posterior dislocation of the hip. Faber is for flexion, abduction, external rotation, that is for anterior dislocation of the hip. But remember, it is not always clinically that anterior dislocation comes with flexion. Majority of the time, it could be kept neutral also as far as antero-posterior deformities are concerned. So it could be kept in extension, it could be kept neutral, but there has to be a certainly abduction and external rotation deformity. That has to be certain, right? So true, the anterior dislocation of the hip was the answer for this particular question if it was the correct language posted in your question in your examination, right? Another question, I mean hundreds of the times we have discussed it. So many times this question has been asked previously also. Here, 8-year-old, a girl which was mentioned as we were told, sustained fracture around the elbow or in the arm or in the humerus around 2 years back. Now, obviously, the examiner is asking about the abnormality in the form of its complication. Now, the patient is having a difficulty in hanging school bag and the deformity is as shown. What is the most probable diagnosis the patient is suffering from? Now, what we have over here is that in this case, there is a deformity, the certain deformity which is shown with the extended elbow, and this deformity is having an apex which is pointing away from the elbow, away from the midline, so it is a varus deformity. So this is cubitus varus deformity, and you already know that cubitus varus is the complication of supracondylar fractures of the humerus, right? It is a complication of the supracondylar fractures of the humerus, that is cubitus varus deformity. This is not something new for you, all right? All of you are aware of this fact that supracondylar fracture of the humerus goes into malunion and resulting in a progressive cubitus varus deformity. All right. If you look at the other options, olecranon, obviously not. Supracondylar, yes, it is the answer for this question. Lateral condylar fracture will result in non-union, and because of this non-union, there will be a progressive cubitus valgus deformity. So lateral condylar fracture is obviously not the answer for this question, and posterior dislocation of the elbow has to be something else. Means in the question there has to be something else provided to you. All right. So Nishant, you are asking about that most common complication of the lateral condylar fracture. You know, lateral condylar fracture results in non-union, while supracondylar fracture results in malunion, and malunion resulting in cubitus varus deformity progressive, while non-union resulting in cubitus valgus deformity progressive. All right, and both these two deformities can only be said varus or valgus when it is demonstrated with the extended elbow. Until and unless the elbow is not extended, you cannot comment upon whether the patient is having a varus or valgus deformity, right? So key clinical question, very easy to answer. All right. All right. So here we have talked about the 3 questions which were asked possibly in your examination. Next, identify the marked structure. You know, on the flexor aspect of your wrist, there is a possibility that you can see the 3 tendons. All right. Like when you try to pinch it, the tendon which gets prominent is the palmaris longus tendon. Just radial, that means lateral to that palmaris longus tendon, is the flexor carpi radialis tendon. So if we want to talk about that, if this tendon was highlighted in the center, in the middle, which is prominent, it is palmaris longus tendon. But if this tendon was highlighted in your question, then it has to be flexor carpi radialis tendon. These are the 2 tendons which could be demonstrated with this pinching mechanism, which will make them appear more prominent. Apart from this, there is another tendon which could be demonstrated, and that is flexor carpi ulnaris, but it has to be on the medial aspect, right? So just by its appearance, this can be very easily obtained. All right, identify the marked structure. So if the marked structure was on the center, when the 2 tendons were prominent, then it was palmaris longus, but if it is on the radial side, if the structure was marked, then it has to be flexor carpi radialis. All right. Hopefully you get the answer for this question. Clone, there was an option ignorance of the fracture, something like that. Very good. If this was Adarsh, yes, I know that terrible triad related question was there, and I'm again very much excited. Like this is for the first time asked question, terrible triad. We'll be having a discussion on that again. But yes, Clone, if we are having this option that there was ignorance of the fracture or ignorance of the injury, that is particularly pointing towards, means was it there in the options or was it there in the question itself? Because yes, when the supracondylar fractures of the humerus are ignored, and because of this ignorance, because of ill treatment, because of maltreatment, because of no treatment, it tends to unite with the displaced fragments. And when there is a displaced fragment union, then it will result in the complication. So if it is provided to you, then it obviously has to be a part of the question. That means examiner was very sane in writing down these questions for you. All right, very good. Okay. Next is next question. As I told you, terrible. The others we will be talking about this terrible triad later. Clon, you are asking about that it was towards thumb on the lateral side. You know, if this was your question, like if you are asking about the thumb on the lateral side, then look at this. The thing which is getting prominent over here, this one, if it is getting prominent over here, now this is extensor pollicis longus tendon over here, if this is getting prominent, all right, if this was your question, all right. So they switched arrow for snuff box too. So snuff box, no, not exactly. If they are asking anything related to the tendon, then possibly they are asking about the tendon which is guarding the snuff box laterally, and that has to be a extensor pollicis longus tendon, because you know the movement of the thumb, this is abduction and this is extension. So if the extension, you know, if the thumb is in extension and this thing is getting prominent, then it is extensor pollicis longus tendon. Hope you get the answer for that particular question. All right. All right. I don't know whether this question was there or not, but we are having mixed segments like young male, bleeding gums, bow legs. Now again, in the question itself, the moment you see the word bleeding gum, you are ready with the answer, and the answer is scurvy, because you know this is the only condition that we talk about that that gives you, that the examiner gives you as a hint, that is delayed healing of the wound or the bleeding gums, which is because of the scurvy. Now what it has to do with the bow legs? All of you are aware of the fact that scurvy will result in various changes in the bones at the metaphyseal and the epiphyseal end, leading to the progressive deformities in a growing individual or a growing child. So young male, bleeding gum, bow leg, what is the vitamin deficiency? Then answer for this question is obvious, that is ascorbic acid, that is vitamin C. You know, vitamin C, which is acting as a cofactor in maturation of the amino acids, that is lysine and proline into hydroxyproline and hydroxylysine. Vitamin C is a cofactor for hydroxylase enzyme. If vitamin C is deficient, then there will be no maturation of these enzymes. As a result of it, there will be a defective collagen type 1 formation, and that will result in this weak kind of the bones. All right. So this is possibly the answer. All right, Avjeet, very good. Painful costochondral bleeds was also mentioned. Excellent. Means why not? You know, painful, first of all, try to understand that the costochondral prominence over the sternum, these are the junctions in between the sternum and the ribs. So if these junctions are getting prominent, these are appearing as a beads, all right, in a rosary. Now these rosaries are found in two metabolic conditions. One is rickets and the other one is scurvy. All right. Now the characteristic finding of these rosary in case of ricket is that they are painless and they are round. That means they are non-tender. But the characteristic finding of these rosary in case of scurvy is that they are sharp and they are tender. That means they are painful to touch. All right. So in case of scurvy, they will be painful, while in case of rickets, they are painless. So it is another condition, very good Avijit, that this is another condition which is helping you out in making the correct diagnosis of scurvy. All right. Nishant, yes, this time they left their favorite GCT. That is true. I mean, you were very much prepared for that GCT. All right. Age was around 10 for scurvy, again, as it is very commonly seen in case of a growing individual. All right. So don't get confused with the word bow legs. And we have already discussed this condition, you know, when we were talking about, like in case of rickets and scurvy, what are the things which are common in both of them, that they might come with the progressive deformities of the lower limb, both of them, and they also come with the costochondral junction prominences. But these costochondral junction prominences in case of rickets are painless and they are round, while in case of scurvy, they are painful and they are sharp. All right. So that goes with the answer for this question. That is ascorbic acid, obviously. All right. So calciferol obviously is not the answer. That is vitamin D deficiency was not the answer, because we are not dealing with the rickets. We are dealing with the scurvy in this particular condition. Hopefully you get the answer right, and hopefully this was the question. Yes, as you have confirmed that it was a question present. All right. Next is that what is the name of the muscle which is attached to the mark structure. Now all of you are aware of the fact that this is, what is this? This is the lesser trochanter of the femur, and the muscle which is attached to this lesser trochanter of the femur are the tendons of the iliacus and the psoas muscle, that is iliopsoas. Iliopsoas is attached to it, all right, which is the major flexor of the hip joint while sitting. When you are sitting, then these are responsible for flexing up the hip joints, all right. So iliopsoas is the name of the muscle which is attached to this, all right. Okay. Now identify the given condition. Hopefully this is the last question in orthopedics which was asked, and again I find myself overexcited when I saw this question that this was the question, if at all was asked, then it is probably for the first time asked question, and you already were aware of the answer for this particular question. Now what are the three things which you can visualize in this particular question? One is that there is a dislocation of the elbow, all right, dislocation of the elbow joint. Now this is something which you can very clearly see. The second point is that the radial head, as you can very clearly observe it over here, that the radial head is also fractured. Basically it is broken into multiple fragments, so there is a comminuted fracture of the radial head. And finally the last thing over here is that there is a fracture of the coronoid process also. So the fracture of the coronoid process. So these are the three conditions which are present in this particular question, all right. Yes, thank you Adarsh, you are helping us out, that there was a history which was provided, that there was a fall on outstretched hand, and possibly you were getting a question where there was a x-ray given, and this x-ray was having these three findings. The first finding is dislocation of the elbow, another one is the fracture of the coronoid process, and the third one was the fracture of the radial head. When you combine all three of them, then it mounts to terrible triad of the elbow, all right. So here the answer for this particular question is the terrible triad of the elbow. These are the three components of this particular question. Yes, so hopefully you get the sense, hopefully you get the essence of, hopefully we have fracture was not in the option, so dislocation of the radius. Okay, so basically what we got is that there was a x-ray provided where all these three features were provided to you in the particular question, and then they have asked that what is the possible injury that the patient has sustained, all right. Okay, so thank you very much for attending this session. Hopefully you went, hopefully the paper went well. All of you, we pray that all of you will go through this examination, will get through this examination, and all the best for your future. Thank you so much.
202. Hey guys, this is Dr. Aman Setia, medicine faculty at NExT. So today we'll discuss like recall questions of FMG exam. So again, there are some partial questions, so I'll need your participation. So let's get started. Starting with question number 1. Patient complains of difficulty breathing, fatigue on examination, distended neck vein and muffled heart sound. Even like some students are saying, कुछ बच्चे बता रहे कि JVP finding mention थी, that was absent. Why? यही था क्वेश्चन. So again this is सबका क्वेश्चन सही हुआ ये वाला. तो क्या आंसर होगा इसका? क्या आंसर होगा? ऑप्शंस पे मत जाओ. So this was the question on cardiac tamponade. तो कुछ एक रिकॉल सेशन जो मैं करूँगा दैट विल बी आफ्टर 2 days, 2 दिन के बाद, जो जिसमें आपके पूरे एग्जैक्ट ऑप्शंस होंगे. तो दिस इज़ लाइक मिलता जुलता एक क्वेश्चन, जो जितना क्वेश्चन बच्चों ने दिए है उसके हिसाब से बना हुआ है. तो ये क्वेश्चन एक सही हो गया. देखो मेडिसिन के क्वेश्चन पेपर में आए थे, लेकिन तुम्हारे सब सही हुए, डोंट वरी. ओके, सो देखो दिस इज एब्सेंट वाई और यू कैन से प्रोमिनेंट टैक्स. तो मैंने अगर आपको याद हो तो बताया था पे टैक्स. सो पे टैक्स से हमारा एक क्वेश्चन सॉल्व हो गया. डन. आगे चले. कार्डियक टैम्पोनेट. ओके, इट वाज जेवीपी प्रेजेंट. ओके, जेवीपी प्रेजेंट. जेवीपी में क्या था? एब्सेंट वाई डिसेंट था आई थिंक. सही हो गया ना. तो 12 क्वेश्चन. आगे चलते. चलो. ओके, देन देयर वाज अ क्वेश्चन कि पेशेंट को टिंगलिंग सेंसेशन है. टिंगलिंग सेंसेशन है, सीरम फेरेटिन डिक्रीज्ड, TIBC इंक्रीज. सो अगेन व्हेन यू सी दिस टाइप ऑफ क्वेश्चन, टिंगलिंग से कंफ्यूज नहीं होना. व्हेन दे आर गिविंग यू एब्सेंट वाई आंसर में था. ओके, एब्सेंट वाई वाज इन द आंसर. सो एब्सेंट वाई इज द आंसर. So diagnosis cardiac tamponade and answer is absent Y. This was the answer. Clear? Okay, आगे चलते हैं. So एक क्वेश्चन करेक्ट हो गया. Moving to next one. Serum ferritin is less, TIBC increase. TIBC increase. So क्या डायग्नोस होगा? It's a case of iron deficiency anemia. So कुछ क्लिनिकल केस था. Right? कुछ स्मॉल साइन नहीं पूछा था. I think they have asked you question on pulsus paradoxus. So I'll come to that. Right? उस पर भी आएंगे अभी. सो एक क्वेश्चन मिलता जुलता था, अ क्लिनिकल केस वेयर सीरम फेरेटिन वाज द हिंट, सीरम फेरेटिन इज डिक्रीज्ड, TIBC इज इंक्रीज्ड. सिर्फ टिंगलिंग देखकर आपको आंसर नहीं मार्क करना है, जस्ट बाय सीइंग द टिंगलिंग. राइट? तो अंडरस्टैंड दिस थिंग. सीरम फेरेटिन वाज मेंशन, इट मींस इट्स अ केस ऑफ आयरन डेफिशिएंसी एनीमिया. फिर B12 नहीं देखना, B12 ऑप्शन में था कि नहीं था. फेरेटिन जब दिया हुआ, इट मींस दे आर थिंकिंग, दे आर आस्किंग अबाउट आयरन डेफिशिएंसी. Okay, then there was a case where they have mentioned like patient is having flapping tremors or hysterexis. Sideroblastic था तो नहीं होगा. हाँ आदर्श, ये जो क्वेश्चन है 15 mmHg, ये मैंने आगे डाला हुआ है, ये आएगा. ओके आदर्श, दिस क्वेश्चन विल कम, ये आएगा अभी. सिडरोब्लास्टिक नहीं होगा आंसर. सो फेरेटिन इज डिक्रीज. सिडरोब्लास्टिक में फेरेटिन बढ़ा हुआ मिलेगा. दैट इज एन आयरन ओवरलोडेड स्टेट. क्लियर? ओके, जो 15 mmHg वाला क्वेश्चन था उसमें ऑल एक्सेप्ट आया था, तो क्वेश्चन वाज ऑल एक्सेप्ट, दैट विल डिस्कस. उसका आंसर HOCM है, वो अभी आगे बताऊंगा मैं. राइट? सो टिंगलिंग सेंसेशन विद हाई TIBC, दिस वाज द क्वेश्चन. सो आंसर इज आयरन डेफिशिएंसी एनीमिया. मूविंग टू नेक्स्ट वन, एस्टेरिक्सिस. सो बेसिकली इट इज ड्यू टू लाइक CO2 नार्कोसिस और हाइपरकार्बिया. तो ये ऑप्शन में था हाइपरकार्बिया. So asterixis basically you can see in many whenever there is hypercarbia or CO2 narcosis, or I can say metabolic encephalopathy, like hepatic encephalopathy, तब भी होएगा. Okay, so this is question number 2. Moving to third one, this is question number 3. Asterixis वाले का क्या आंसर होगा? hypercarbia. Fourth question is MEN1 disease. So MEN1 syndrome में क्या होता है? 3P. 3P means pituitary, parathyroid and pancreas. So pheochromocytoma is a part of MEN2A, MEN2B. Renal cell carcinoma, it is not in MEN syndrome. MEN4 में हो सकता है, parotid tumor नहीं होगा. So answer will be parathyroid adenoma, pituitary, parathyroid, pancreas. फेरेटिन बढ़ा हुआ था, TIBC लो था, वही लिखा है मैंने. फेरेटिन बढ़ा था, TIBC लो है. रेड सेल साइज भी स्मॉल था. ओके, आई एम एडिंग, थैंक यू फॉर द इनपुट. सो रेड सेल साइज was less, means microcytic हो गया. अब तो आंसर क्लियर है. नाउ इट इज डेफिनेटली एंड ऑफ एनीमिया. क्लियर? ओके. Asterixis, anybody can recall a question on asterixis? Okay, पेशेंट से हैंड मूवमेंट करवाया गया था. ऑप्शंस वे थायरोटॉक्सिकोसिस एंड हाइपरकार्बिया हाइपोक्सिया. सो अंडरस्टैंड दैट हैंड मूवमेंट जो करवाया गया था उसको बोलते हैं फ्लैपिंग ट्रेमर. सो अंडरस्टैंड, अगर देखो मेरे को, जस्ट लुक एट मी, इफ दिस टाइप ऑफ ऐसे ट्रेमर्स अगर आ रहे हैं, हैंड मूवमेंट मींस अगर इस टाइप के ट्रेमर्स आ रहे हैं, इफ अगर ऐसी हैंड मूवमेंट कराई गई है, पीछे से हाथ को खींचा जा रहा है, देन यू कैन सी फ्लैपिंग ट्रेमर्स. दिस इज द मूवमेंट. इसको बोलते हैं एस्टेरेक्सिस. सो एस्टेरेक्सिस कहाँ मिलेगा? थायरोटॉक्सिकोसिस में अनलाइकली. थायरोटॉक्सिस यू कैन सी नॉर्मल ट्रेमर्स यू कैन गेट देयर. सो आंसर विल बी हाइपरकार्बिया. सो इसका आंसर क्या होगा? हाइपरकार्बिया. क्लियर? ओके आदर्श, मूविंग टू नेक्स्ट वन. मैन सिंड्रोम, दिस इज क्वेश्चन नंबर 4. तो ये भी करेक्ट हो गया, सिंपल है. मैन सिंड्रोम डन. 4 सही हो गए तुम्हारे. डोंट वरी, अगर एक का गलत भी हुआ तो कोई बात नहीं. मेडिसिन क्वेश्चन वेर सिंपल. पेपर वॉज रिलेटिवली इजियर देन प्रीवियस अटेम्प्ट. ओके, others is telling same movement, so that is asterixis, a case of asterixis. Okay, then there was an X-ray base image, cannonball appearance. I think most of you have marked the answer correct. It is METS. So lung metastasis in lung, and mostly they come from breast cancer. CA breast से आते हैं. So cannonball, this is question number 5. Again an easy one. Okay, then there was a question on surfactant deficiency. So surfactant deficiency. So again, surfactant is produced by type 2 pneumocytes. So answer of this question should be IRDS. But since students are saying IRDS was not, IRDS means infant respiratory distress syndrome. अगर ये ऑप्शन में नहीं था तो क्या होगा? ARDS. So I think ARDS was given in the option surfactant deficiency. Sideward movement of hand. Sideward movement ऐसे थोड़ी दिया होगा. It this type of movement, right? There was 2 questions. One was cannonball and there was one more question on pleural effusion. जिसमें tracheal shift दिख रही थी, right? So surfactant deficiency as such means basically IRDS is also type of ARDS, right? So दोनों में difference क्या होगा? IRDS is seen in infant. ARDS you can see in any age group. And IRDS you will see damage only on of type 2 pneumocyte. In ARDS you will see damage to both type 1 and type 2 pneumocyte. दोनों का damage होगा, right? अच्छा, वेरी गुड. ये राघव विक्रम, थैंक यू फॉर योर कॉपरेशन. ऑप्शन में RDS दिया था, तो अगेन दे मेड इट वेरी क्लियर. इट इज RDS मीन्स रेस्पिरेटरी डिस्ट्रेस सिंड्रोम. सो डिफरेंस इन दीज टू एंटाइटी विल बी, इन IRDS you will see damage to type 2 pneumocyte. In ARDS you will see damage to both type 2 as well as type 1. Both pneumocytes will be damaged. So RDS दिया था, तो क्वेश्चन इज रिलेटिवली इजियर नाउ. क्लियर? आगे चले. मजा आ गया पेपर देख के. आई होप यू हैव एंजॉयड अ लॉट. मेडिसिन के क्वेश्चन आए थे. इन्वेस्टिगेशन ऑफ चॉइस फॉर सब एक्यूट कंबाइंड डिजेंशन ऑफ स्पाइनल कॉर्ड. दिस वाज गिवन. अभिजीत बोस, इफ इट इज गिवन इन द ऑप्शन देन इन्वेस्टिगेशन ऑफ चॉइस. अगर ऑप्शन में इफ इट इज गिवन सीरम B12 दैट इज द आंसर. इफ इट इज नॉट गिवन देन MRI spine could be the answer, right? Are you in lung? You will not see the mass. Mass नहीं मिलेगा आपको because it is metastasis. Mass तब होगा when it's a primary lung tumor. Clear? Am I clear? Okay, then there is one more doubt students are asking. एक और ऊपर doubt आया था. Which option rules transudative? Okay, I am coming to this. वो लिखा हुआ है मैंने. I'll come to that question. Okay, आगे चलें. Moving to next one, refeeding syndrome. Refeeding syndrome, it is again whenever we feed a person with different types of solution, then sometimes it can lead to due to fluid shift. So again it's an easy one. So because of refeeding, generally you will see there is loss of electrolyte. So it can cause a loss of potassium, loss of calcium and loss of phosphate. So hypokalemia is seen, hypocalcemia is seen, hypophosphatemia is seen, hyperkalemia is unlikely. So in refeeding syndrome, what you will not see, you will not see hyperkalemia. So answer for this question will be hyperkalemia. Clear? आदर्श मैं उस पर भी आऊंगा, right? So this is hyperkalemia straight away. Easy one, easy question. Okay, then there was question number 8, Reiter syndrome. Straightforward question पूछा था, what is the name of HLA? So HLA with Reiter syndrome. So answer is HLA B27. HLA B27. It is in like I told you, Jaipur. Jaipur means it is juvenile rheumatoid arthritis, ankylosing spondylitis, inflammatory bowel disease arthritis, psoriatic arthritis, undifferentiated arthritis, and reactive arthritis or Reiter syndrome. So these are the conditions which are seronegative, so rheumatoid factor is negative and HLA B27 is positive. So in all these conditions, कई जगह आपने पढ़ा होगा mnemonic pair और Jaipur. So there are two more entities. Clear? So answer is simple. Okay, then there was a question on Duke's criteria. I hope you remember question number 9. Duke's criteria. So understand again, it was a tricky question. They have asked you how many culture you should take. So it is, remember, 3 culture, and it was clearly mentioned what type of culture. So remember, it should be 2 aerobic culture and 1 non-aerobic or anaerobic, right? तो आपको 3 कल्चर लेने हैं, 2 एरोबिक बैक्टीरियाज के लिए, एक एनारोब्स के लिए. सिंपल. Cryptococcus hint in the MCQ was India Inc preparation. India Inc preparation, and second hint in the MCQ was it is HIV positive. So patient is HIV positive. So this is like a straightforward. Question number 10 is relatively easy. I hope most of you have marked this correct. सबका सही हुआ है तो. Am I clear? Faizan, Ilyas, any other और कुछ question अगर है, if you are having any other questions, you can just add in the comment box. Am I clear? आगे चले. आयु, कृष्णा, राघव, आदर्श. Why I can't see your comment? Okay, moving to next one. So this was question number 11. A patient with hypertension. So hypertension was mentioned. ये इनके comment नहीं आ पा रहे. Hypertension with hypercortisolism. Cortisol is increased, right? ACTH levels remained elevated after high dose dexamethasone. So you can know, like, it's a case of Cushing syndrome. So diagnosis is simple. Diagnosis is simple. It's a case of Cushing syndrome, right? But now they are asking you, like, a patient is having diagnosis is simple. They are asking you what is the cause of Cushing, right? Okay, some are saying it was not cannonball, but most of the students are saying कि वो cannonball nodule था. Okay, so let us see this case, Cushing syndrome. PSVT पे अभी मैं आऊँगा, वो अभी आएगा. That smoker question, chronic smoker will also come. So Cushing syndrome, now they are telling you like ACTH values are high even after giving high dose dexamethasone test. It means it is not suppressed. It means there is some ectopic source. So ectopic source, it is ectopic, means ectopic ACTH secreting tumor. What it could be a lung carcinoid. It could be, sorry, a carcinoid anywhere, or it could be small cell lung cancer. So mainly it could be due to small cell lung cancer, or it can be due to carcinoid, or it can be sometime due to CA breast. So basically अगर आप देखोगे क्वेश्चन में हिंट क्या है, ACTH is still elevated, right? एक्सोजीनस अगर होगा तो उसमें हाई डोज में एलिवेटेड नहीं आएगा ना, राइट? So that is why answer will be ectopic ACTH. It is like ectopic ACTH tumor. Clear? So answer is A. Okay, moving to question number 12. Heel to shin test. Heel to shin test means आपको अपने पैर को heel को टिबिया को टच करते हुए लेके जाना है. That is called heel to shin test. So heel to shin test. कौन सिंड्रोम पे अभी आएंगे कृष्णा? Don't worry, कौन सिंड्रोम का क्वेश्चन अभी आएगा. Heel to shin test, where we do this in cerebellum dysfunction. So basically it's a part of cerebellar examination. So whenever a lesion is in the cerebellum, अगर कोई cerebellum में प्रॉब्लम हो रही है, then that will cause heel to shin test. Heel to shin test will be abnormal. Okay, ऑप्शन देखो, ये ऑप्शन जो दिखा हुआ है, it is mentioned like steroid की वजह से, that is exogenous steroid. Okay, it was not given, so what was given, it is due to exogenous steroid. तो ये तो सेम ऑप्शन हो गया, राइट? all of the following are causes of pulmonary edema except answer is increased plasma protein. That will we come to that question. Okay, right. So अब इसको देखो ये clear हो गया. Now moving to this one, heel to shin test. ये question पूछा था. So it is basically due to dysfunction of cerebellum. Means if there is a stroke or I can say hemorrhage that is involving your cerebellum. Pendular knee jerk भी इसमें होता है. You can see like there will be a drunken gait. So these are the findings. Dysdiadokinesia. So all these things we will see there in cerebellum dysfunction. कौन सिंड्रोम आगे आपका क्वेश्चन. सो ये क्वेश्चन था कृष्णा पटेल. ऑप्शंस में क्या था? मेटाबॉलिक एसिडोसिस, मेटाबॉलिक एल्कलोसिस, हाइपरटेंशन वाज गिवन, palpitation was given या लो रेनिन दिया हुआ था. ओके, नाउ अंडरस्टैंड व्हाट इज कौन सिंड्रोम. कौन सिंड्रोम इज प्राइमरी हाइपर एल्डोस्टेरोनिज्म, मींस देयर इज मोर एल्डोस्टेरोन. So what a more aldosterone will do? It will cause sodium and water retention in exchange of potassium and H positive ion loss. Aldosterone क्या करेगा? सोडियम और वाटर का रिटेंशन करेगा. तो सोडियम भी ज़्यादा होगा, वाटर भी ज़्यादा. Then there is loss of H positive ion. So more loss means that will cause metabolic alkalosis. So alkalosis तो होगी. सोडियम का रिटेंशन हो रहा है, so this will cause hypertension. It can cause palpitation. Right? Low renin था तो low renin भी होगा. So answer will be metabolic acidosis. It will not cause metabolic acidosis. It will cause metabolic alkalosis. लो रेनिन था तो क्या नहीं था? palpitation नहीं था या hypertension नहीं था? What was not given? Hypertension नहीं था. Okay. This was low renin. So still आंसर क्या होगा इसका? आंसर विल बी मेटाबॉलिक एसिडोसिस. आई थिंक ये भी सही लोगों का सही हुआ है. क्लियर? ओके. आदर्श, यू आर आस्किंग समथिंग ब्रेन एंड स्पाइनल, व्हाट इट इज? ओके, दिस वाज क्वेश्चन नंबर 13. Okay, then this is the question which some of you are telling. During inspiration, systolic blood pressure decreased by more than 15. Normally it is more than 10. So अगर 15 से ज़्यादा fall हो गया, so this is what question किस पे पूछा है? It is a question. So question on pulsus paradoxus. It is a question on pulsus paradoxus. So I think it was given. कहाँ नहीं मिलेगा, right? आदर्श, कृष्णा, आयु. It was given कहाँ नहीं मिलेगा, where you will not see pulsus paradoxus, right? ऑप्शन में मतलब कहाँ कहाँ मिलता है? You can see this where? You can see this in bronchial asthma, you can see this in cardiac tamponade, you can even see this in restrictive cardiomyopathy. कौन सी कार्डियोमायोपैथी में नहीं होगा? HOCM में नहीं होता. So this is the answer. So just let me know HOCM was in the option or not. HOCM था ऑप्शन में कि नहीं था? Was it given in the option? HOCM था? Then this is the answer. If HOCM is given, this is the answer, because in HOCM what you will see? In HOCM you will see reverse pulsus paradoxus. Here you will see reverse pulsus paradoxus. Simple? Okay, very good. 14 out of 14. I know most of you have marked more than 10 correct. Trust me. Medicine questions were simple. Moving to next one. Okay, this was the question like some students are saying there were two questions on fasting blood sugar and I don't think like it's the exact question, so you can tell me the question. क्या क्वेश्चन आया था फास्टिंग ब्लड शुगर से? कोई बताएगा क्या क्वेश्चन आया था फास्टिंग ब्लड शुगर से? Okay, so understand. Okay, so let me, if I try to frame a question, so if they ask you like what is fasting value, so fasting value, understand, कार्डिक टेम्पोनेट में क्या होगा? कार्डिक टेम्पोनेट में पल्सस पैराडॉक्सिस होगा. इन कार्डिक टेम्पोनेट यू विल सी पल्सस पैराडॉक्सिस. So there were two questions on fasting blood sugar. So suppose maybe they can give you like normal value less than 100, right? So less than 100. अगर 100 नहीं है, इसको उज्जवल गजेंद्र सेम क्वेश्चन था. What is the amount of glucose? Was it the same question? HbA1c था, वो आगे आएगा क्वेश्चन. So there was a question on target HbA1c. So remember target HbA1c in any patient. So that is always less than 7%. So this as per Harrison it is always less than 7%. राइट। फास्टिंग ब्लड शुगर कहाँ से लेना है, ये क्वेश्चन था। What is best way to measure 2 or postprandial blood? Raghav, that question is separate. Best way is HbA1c. जिसमें after inspiration do not decrease systolic blood pressure, options were after inspiration do not decrease systolic blood pressure, options were cardiac tamponade, tension pneumothorax. हाँ, ये same question I am telling you. In cardiac tamponade you will see this will decrease. In asthma this will definitely decrease, right? Postprandial blood sugar level of diabetes mellitus according to WHO. Postprandial according to WHO is more than 200, right? Okay. So just let me write the values, all the values, so that you can get an idea what type of question it was given. So just I am writing here fasting sugar, postprandial blood sugar, and HbA1c. So just try to understand this. Fasting blood sugar values less than 100, postprandial value less than 140, HbA1c less than 6.5. This is normal. Then I can say fasting more than 126, postprandial more than 200, HbA1c sorry less than 5.6, more than 6.5. This is diagnosis of diabetes. अब इसके बीच की वैल्यू जो होगी that is 100 to 125, 140 to 199, 5.6 to 6.4. This is called pre-diabetes. Pre-diabetes or impaired glucose tolerance. Okay, and one was oral glucose test में what will be the range? So OGTT में पूछा oral glucose कितना देते हैं, that is 75. Okay, I am not getting exact question. Can someone write? No sir, question was in order to measure 2R postprandial blood glucose, what is standard glucose given? Option where slice of bread 75 milligram, other were too high value. Okay, again we are not getting exact question what they are asking. Let us see your comments again. So goal of treating, that is another Reshma Manzoor, goal of treating chronic diabetes, that HbA1c value उस पर क्वेश्चन था that I have placed, उसका आंसर होगा less than 7%, right? Postprandial level, मैं सारे क्वेश्चन के आंसर करता हूँ. Postprandial level of diabetes mellitus according to WHO. Postprandial level WHO के हिसाब से कितना होगा? That is more than 200 to diagnose diabetes. 75 milligram 200 less than 6.5, and one was oral glucose test में what will be the range? Question was in order to measure 2R postprandial blood sugar glucose, what is standard glucose given? 75 ग्राम में ऑप्शन होना चाहिए फिर, right? Then option will be in the gram. Okay, so can anyone give me a complete question? Try इसका कोशिश करो कि पूरा complete question मिल जाए. What is the sugar level? तो ये sugar level WHO level के हिसाब से मैंने लिखे हुए. वो ग्राम में होगा फिर, mm में नहीं होगा फिर. That will be कितना देना ग्लूकोज, that will be in the gram, right? Capillary, usually it should be capillary. One was of HbA1c value. उस अगर जो टारगेट पूछा, आयु if target is given, then answer will be less than 7. Yeah, it should be in gram. Raghav, it should be in gram, not milligram. If it is given in gram, then it's 75 gram. यहाँ पर तो mm में दे दिए, mm तो नहीं होगा, ग्राम में होगा. ऑप्शंस पे लेस देन 6.6, लेस देन 6, लेस देन 7, लेस देन 7. आयु दैट वो भी अभी मैं उस पे आऊंगा, उस पे आएगा, राइट? ओके, वीनस कैपिलरी मोर देन 200. यस उज्जवल, दिस इज द आंसर. ग्राम में था, देन ठीक है. कितना ग्लूकोज देना है for OGTT, that we give in gram. If a person has glucose 200, what would be HbA1c? HbA1c पूछा है सिर्फ आपसे, तो इसको 75 ग्राम 2 आवर में टेस्ट करेंगे. ओके, Now understand, this was given कि patient is having 200 milligram glucose. तो आपको क्या करना है, HbA1c को 30 से मल्टीप्लाई कर देना है. Suppose if I say like if it is given 70, 7, if it's HbA1c gives 7, if you multiply this by 30, this will be 210. So close to 7, right? Close to 7. Okay, चलो उस पर भी बात करेंगे अभी और. Moving to next one, you can see this was a question, stroke patient. Question number 15 was something related to this. Target, now see, if target they have asked, then answer will be less than 7. Target is always less than 7, right? Okay, next is question number 16. Okay, I think there was a clinical case. Try to understand this case. Question was, a patient is having stroke followed by irregular rhythm. So understand, question क्या पूछा है, patient को stroke है, stroke के बाद irregular rhythm हो गई. So you can see whenever they mention irregular rhythm means patient have developed AF. So patient have developed AF, it means there should be some embolus which is migrating to your brain, and that is called embolic stroke. So it's a case of embolic stroke. ये TIA नहीं होगा because TIA will not present with AF, right? एक क्वेश्चन था, पर्सन को अर्ली मॉर्निंग में सीवियर यूनिलैटरल हेडेक होता है, उसको फोटोफोबिया और हेडेक में स्किप करने पे. हाँ, वो मैंने अभी लिखा, इशाक रियाज दैट आई हैव मेंशन, दैट इज माइग्रेन, right? And phrenic zone, if they are asking question on target HbA1c, then answer is less than 7, not 6.5. Now you cannot completely treat the patient. ना आपको पूरी तरीके से ठीक तो नहीं कर सकते. So what is the target as per WHO range? It is 7. इशाक रियाज उसका आंसर होगा माइग्रेन. Clear? Okay, moving to next one. RTA plus bradycardia. RTA mention था, bradycardia. What was the type of shock? Cardioembolic mention था. Okay, very good. When cardioembolic is mentioned, this is the answer. It is a case of cardioembolic stroke because patient is developing AF. But symptom resolve, it was mentioned. Some students are saying, Raghav, like patient was having this for more than 48 hours, this was mentioned. Some students are telling me like it was for more than 48 hours, so it cannot be TIA. अब 24 था कि 48 hours था. Ischemic stroke दिया था. Now understand, embolic, thrombotic, lacunar, all these are type of ischemic stroke. Even if it is not given, then ischemic stroke is given, that is the answer. So embolic stroke, thrombotic stroke, all these are type of ischemic stroke. So cardioembolic था, symptom resolve within 48 hours. Now see, Ujjwal, ध्यान से देखो क्वेश्चन को. Ujjwal, try to understand, symptoms are not resolving in 24 hours. When they are not resolving in 24 hours, it cannot be TIA, right? When they are mentioning 48 hours, अगर mention है तो TIA तो नहीं होगा ना. They mention that patient skipping night meals in morning headache. That is another question, right? Resolve था, पूरा रिकवरी 48 आवर्स में आपने थ्रोम्बोलाइज कर दिया ना, इसलिए रिकवर हो गया. बट अगेन इट विल नॉट बी अ फुल रिकवरी, देयर इज पार्शियल रिकवरी. ओके, आई ट्राई टू गेट द कंप्लीट क्वेश्चन, बट आप याद रखो, अगर क्वेश्चन में ये इफ इट इज मेंशन लाइक दिस, सपोज इफ आई से इफ इट इज गिवन लेस देन 24 आवर्स, इट इज TIA. इफ इट इज लाइक मोर देन 48 आवर्स, इफ इट इज गिवन, देन इट कुड बी अ केस ऑफ स्ट्रोक. अब स्ट्रोक में ऑप्शन क्या था, इस्केमिक स्ट्रोक था, राइट? Or they are asking you it is like cardioembolic. So cardioembolic is also a type of ischemic stroke. Simple. Ischemic stroke के types होते हैं. Simple. Symptom resolve. Then I don't think they have given you 48 hours. They can't give the word 48 hours. Shock का question ये दूसरा था. Now understand. If it is bradycardia, then it's a case of neurogenic shock. If it is bradycardia, it's a case of neurogenic shock. Again, it's a simple, straightforward question. Clear? Acute ischemic stroke था, acute ischemic hematoma दोनों था. Then answer will be acute ischemic stroke. Embolic stroke, ischemic stroke, TIA and one more. Okay, Ayu is giving you these three options. Ayu ने ये तीन option बताए हैं. Embolic, ischemic, TIA. So it now see. Embolic, ischemic, TIA. So 48 hours is mentioned, it cannot be TIA, right? Ischemia, again, when embolic is given, because there is an embolus, that is embolus is due to AF, right? So more chance the answer is embolic stroke. So embolic correct answer hoga. Is it clear? So this is what there will be, answer will be embolic stroke, because patient ka embolus, this embolus is actually causing AF, atrial fibrillation. Okay, then there was a question like which hormone is responsible for hyperpigmentation. So now look at the options. क्या क्या option दिए थे? ACTH option में था, और you can see POMC, pro-opiomelanocortin और MSH, इन तीनों में से कुछ option में था. You can choose one answer. Any one was given in the option, ACTH, pro-opiomelanocortin और MSH. Migraine पे भी आएंगे, that is given. Tell me anything given from this? कुछ दिया हुआ था इसमें? Okay, so students are saying like MSH was given, so answer will be MSH. So these are the hormones which can cause hyperpigmentation. Okay, moving to next one, cystic fibrosis. Again, a case was given. It was a question on the clinical case, cystic fibrosis. MSH था, बस सही हो गया. देखो सही हो रहा है क्वेश्चन. पेपर इज इजी. अब पार्टी स्टार्ट. BP low, but bleeding absent on E-fast. Bleeding absent on E-fast means hemorrhagic stroke. नहीं है, simple, तो अच्छी बात है. So they are mentioning like bleeding absent on E-fast. So again, it is a easy question. It is a case of neurogenic shock, right? Embolism का अलग question था. Then try to recall that question. कोशिश करो उसको recall करने की. Moving to next one, case of cystic fibrosis. Okay, ये मुझे खुद पूरा क्वेश्चन नहीं मिला है, so I'm skipping this. Moving to next one. This was the question. A patient with infertility has ciliary disorder, situs inversus, chronic cytositis and bronchiectasis. So it was easy, straightforward. Okay, Shaq Riaz, you are confusing. वो क्वेश्चन pulmonary embolism का था, वो मैं भी डिस्कस करूंगा. So it's a case of Carter-Gainer syndrome. Straightforward question was asked. That is a case of Carter-Gainer syndrome. I think most of you have marked this correct. Very good. Breathlessness दिया था, that was another question. MSH was there, okay, good. Cuff with change in position, that is pulmonary embolism usual, that we'll discuss next. वो अभी आगे आएगा. Okay, this we have discussed. Cardiac tamponade में absent Y होगा, ये discuss कर लिया हमने. Moving to next. Okay, some are saying like ECG was given, so this type of ECG was given. कुछ लोग बोल रहे हैं VT का ECG था, and some are saying like ECG was given of SVT. So yeah, if you see like this ECG is given VT, in that case we will choose amiodarone. Ishaq, वो dyspnea Bardet, that is वो भी बताऊंगा मैं, वो pulmonary embolism था. If VT is given, then answer is amiodarone. If PSVT is given, then it will be a case of adenosine. Simple. हाँ, वो मैंने आगे लिखा है, like a bedridden patient suddenly became tachypneic, that is a case of pulmonary embolism. That I'll discuss next. PATHOLOGY याद था, PSVT था, then it's adenosine, definitely adenosine. This is question number 22. Okay, moving to next one. This was a question. ऐसा कुछ question था. Question number 23. 3 months history of diabetes mellitus, came to OPD. On examination, vitals are stable. HbA1c is done. What is the value? A value था या target था? PSVT था, then answer is adenosine. Now, what was asked in this question? They are asking you target. If it is target, then remember always less than 7%. Target पूछा था तो क्या होगा? 7% से कम. That is as per WHO. Clear? If they have asked the question on target HbA1c. Target is not 6.5, target is less than 7. But some are saying, दो क्वेश्चन 2Q was there, एक में ECG था, एक में VT लिखा था, तो दोनों क्वेश्चन थे ये. So you want to say if both are given, then this is VT, this is PSVT. Same option थे. टारगेट था, टारगेट पूछा था, देन आंसर इज 7%. इट इज नॉट many students they have marked the answer like 6.5, but target is not 6.5. पेशेंट हैज मोर देन 200, टारगेट था तो 7 ही होगा आंसर. इफ देखो वैल्यू आपसे नहीं पूछी बिकॉज देयर आर डिफरेंट फॉर्मूलाज. लाइक फॉर्मूलाज मींस इफ यू मल्टीप्लाई, सपोज इफ यू मल्टीप्लाई दिस बाय 30, then this will come 240. If you multiply this by 30, this will be 150. So target पूछा है generally, right? So target is less than 7%. It is not 6.5. और ऑप्शन में ये भी नहीं होना चाहिए. So answer will be less than 7. 7 था ऑप्शन में. गुड डॉक्टर एमबीबीएस वाला, ऑप्शन में 7 था नहीं था. टीएसएच अगर दिया हो उसमें तो भी आंसर एमएसएच ही होगा. टारगेट था ना. इफ टारगेट वाज गिवन देन आंसर इज 7. ओके, एक में 70 पी वेव 35 क्यूआरएस वेव इन मिनट था, डायग्नोस पूछा था. क्वेश्चन ऐसे पूछा था 70 पी वेव एंड 35 क्यूआरएस. SGL2 ब्लॉकर ग्लूकोसूरिया का क्वेश्चन था. QRS was normal. Normal QRS means that is PSVT. अगर normal QRS था तो that is PSVT. No value of 7, there was value written 7.5. Okay, अगर 7 नहीं दिया है, value 7.5 दिया है, then answer will be 7.5. Right? Okay, 7 भी था, 7 था तो answer is 7. Because मेरे हिसाब से 7 होना चाहिए. As per Harrison, as per WHO, you will see like target goal is less than 7%. 7 था तो 7 आंसर, बात खत्म. Okay, moving to next. There was a question, a patient who is 70-year-old female, palpitation, and I think a COPD or asthma was mentioned to confuse you. So what is the drug of choice? So options were two options were confusing, oral or IV. So remember, it's a case where patient is having hypertensive urgency, and maybe there will be like hypertensive urgency. In this case, what we give? In this case, we give IB labetalol. Okay, 80-year-old male था, so it was 80-year-old male. Done. कोई फर्क नहीं पड़ेगा उससे, आंसर will be same. If it is 80-year-old male, then answer is same. वन क्वेश्चन ऑन एमेड्रोन. एमेड्रोन पे एक साइड इफेक्ट पे क्वेश्चन था, मैं उस पर अभी बताऊंगा आपको. ओके, देन दिस वाज द क्वेश्चन जो आप बात कर रहे थे. अ पेशेंट हु इज बेड रिडन, पोस्ट सर्जिकल पेशेंट विथ रेस्पिरेटरी डिस्ट्रेस एंड टैकीपनिया और टैकीकार्डिया. What is the diagnosis? Now understand, bedridden means it is like a prolonged immobilization. So post surgery, that's a case of pulmonary embolism. Simple, straightforward diagnosis was asked. Easy one. आपसे diagnose पूछा था. Rate of atria 70 था, ventricles 35 था. Diagnose पूछा था. You can see atria and ventricles, they are moving at a separate rate. So that's a case of 3rd degree AV block. Yeah, pregnancy पूछा था, hypertensive crisis, even asthma is mentioned. So remember, labetalol की कोई as such contraindicated नहीं है. You can give this. Is it clear? Asthma था, कोई बात नहीं. Answer will be still IV labetalol. Non-fluent aphasia से question था. There was an MCQ on non-fluent aphasia. So this was, I think, 24. This is 25. Then this is non-fluent aphasia. So this is Broca's aphasia. Right? This was the question came in exam. Pregnant female, hypertension, asthma, BP was 160/90. 160/90 था. अगर 160/90 था, then answer you have to change. If it is 160/90, then answer will become oral drug. And if it is pregnant, then it will become oral drug. Oral labetalol you can use. फर्स्ट डिग्री एवी ब्लॉक था. फर्स्ट डिग्री एवी ब्लॉक में नहीं होगा ऐसा, 3rd डिग्री होना चाहिए या कंप्लीट 3rd ब्लॉक. Vicky Patil tried to give the exact question like 75 P wave, 35 QRS. और क्या पूछा था? What are more details? In question 22, BP more than 200. Target was asked. Target in question 22. In this question you are saying BP was more than 200. अगर BP 200, so what is the target is less than 130. It is 100% confirmed. Okay. Nifedipine था ऑप्शन में, तो nifedipine we can also use nifedipine. राइट. निफेडिन दे सकते हैं, यस. डायबिटीज में हाइपरटेंशन प्रेगनेंसी निफेडिपिन गिवन. ओके, दैट वाज द क्वेश्चन. ओके, मूविंग टू नेक्स्ट वन. एक ये क्वेश्चन था, इन्वेस्टिगेशन ऑफ चॉइस फॉर इसोफेजियल कैंसर. To understand in this, we will perform upper GI endoscopy plus biopsy. Because it is cancer now, so you have to do biopsy. So upper GI endoscopy plus biopsy. This should be the answer. Clear? Okay, next one. A patient with CHF on hydrochlorothiazide. Patient is taking already hydrochlorothiazide and hypokalemia. What drug should be added? पोटेशियम लेवल लो है ऑलरेडी. आदर्श लेवल लो नहीं करना, ऑलरेडी लो दिया हुआ है. व्हाट ड्रग यू विल ऐड? So we can use amiloride, we can use spironolactone. We need to add potassium sparing diuretics. So amiloride will be the answer, right? Okay, 29. 2-month pregnant, anticoagulant of choice. So there should be some heparin. 75-year-old patient has weight loss. उसमें क्या करेंगे? और भी क्वेश्चन में कुछ पूछा होगा. There should be something else, right? So this is again anticoagulant. What you prefer in pregnancy? We will prefer heparin. So students are saying heparin was not given. So which heparin we use? Enoxaparin option में था शायद. So enoxaparin will be the answer, right? No biopsy was mentioned. Biopsy mentioned नहीं था. Any other thing was option? There was the answer. QR prolonged, RR prolonged. आयु वो क्वेश्चन जो आप बोल रहे हो उसका था बेडाक्विलिन से एक क्वेश्चन था फार्माकोलॉजी का, वो अभी डॉक्टर सिराज बताएंगे. साइड इफेक्ट वाज आस्क्ड क्यूटी प्रोलॉन्गेशन. एमेडोरन पर मैं आऊंगा. आई विल कम टू एमेडोरन. Then this was the question again. There was more than 4 questions on diabetes. Endoxaparin, enoxaparin. Vital stable with long history of diabetes. What test you will perform? So again, the best test to confirm diabetes is HbA1c. So what will perform? HbA1c. So answer will be HbA1c without any doubt. Vicky Patel, any other option you remember? If it is not like any other option, biopsy अगर नहीं mention है, then that will be the answer even without biopsy. But that is actually not investigation of choice. फिर आपसे क्वेश्चन इन्वेस्टिगेशन ऑफ चॉइस नहीं पूछा होगा. थायराइड का मैकेनिज्म अभी सिराज सर बताएंगे. अभी CT was mentioned. CT था और क्या ऑप्शन में थे? CT was mentioned. What else? CT was mentioned. बायोप्सी का कुछ भी था? अगर बायोप्सी नहीं था, try to recall other options. If it is anything related to biopsy, that's the answer. Otherwise, upper GI endoscopy is the answer. फिर यही आंसर होगा. Maybe then they cannot ask you investigation of choice. Patient is non-adherent to his drugs. Barium was in the option. Okay, very good. Again, barium is not investigation of choice. Yes sir, manometry was there. Okay, manometry हो गया. So looking all these options again, answer will be upper GI endoscopy. CT भी दिया था तो भी आंसर क्या होगा? Manometry were given. Then still answer will be upper GI endoscopy. Clear? Manometry we do for a motility problem, like we do for eclasia cardia, for nutcracker esophagus, right? For jackhammer esophagus. In that case we do manometry. Okay. मूविंग टू नेक्स्ट वन. एक एबीजी पे क्वेश्चन था, मुझे पता नहीं क्या क्वेश्चन था, बट सम क्वेश्चन ऑन एबीजी. एबीसीडी 2 स्कोर पूछा था और नहीं पूछा था? बेरियम सॉल्व इज नेवर इन्वेस्टिगेशन ऑफ चॉइस. इट इज ऑलवेज लाइक इनिशियल टेस्ट. हमेशा स्क्रीनिंग टेस्ट होता है, राइट? बेस्ट इन्वेस्टिगेशन वाज आस्क्ड. ओके, सो बेस्ट पूछा है ना. एबीसीडी 2 स्कोर, दिस इज, ये पूछा था. एमआरआई भी था ऑप्शन में. एमआरआई था ऑप्शन में, नहीं था. ओके, ट्राई टू रिकलेक्ट दैट. एक्लेशिया कार्डिया का बेस्ट इज मैनोमेट्री. फॉर एक्लेशिया कार्डिया बेस्ट विल बी मैनोमेट्री. क्लियर? इट विल बी मैनोमेट्री, विच इज डिराइव्ड पैरामीटर. ओके, बॉयड स्कोर. एबीसीडी 2 स्कोर नहीं पूछा था. ओके, लेट अस रिमूव दिस. ये नहीं था. Drug of choice for acute rheumatic fever. Okay, let's just try to collect this. If it is given in the option benzathine penicillin, ये था ऑप्शन में नहीं था. So drug of choice, so they can ask you either this thing, या तो ये पूछा होगा, or maybe like they are asking you question on like acute manifestation which is migratory polyarthritis. तो polyarthritis में हम क्या देते हैं? We prefer to give aspirin, and we give aspirin in very high dose, right? That is 75 to 100 mg per kg per day. That is very high dose aspirin we give. What else? Agar maybe like if they are asking you about chorea, then they can mention valproate. ऐसा कुछ ऑप्शन में था, valproate या haloperidol. Or if they are asking you refractory chorea, then answer will be IVIG. Okay, so aspirin था, so answer is aspirin. So maybe the question will be like ऐसा कुछ था, शंकर नहीं था, ऐसा कैसे नहीं था? हमने भी पता किया है, हम भी सेंटर पर गए थे. There was a question on rheumatic fever, definite question था ना भाई? बड़ी हिस्ट्री थी, लेकिन आपको तो छोटी याद करनी है. तो मोस्ट स्टूडेंट्स आर सेइंग सर बेंजाथिन पेनिसिलिन ऑप्शन में नहीं था. It means what they want to ask. It means they want to ask like acute mention. It means patient is having migratory polyarthritis. तो पेशेंट को जोड़ों में दर्द हो रहा है, जोड़ों में इन्फ्लेमेशन है. In that case, what we give? We give aspirin. Clear? Haloperidol. If they mention chorea, so chorea, अगर in chorea we can use haloperidol. Chorea word is mentioned, then only you will use any of these three conditions. So IVIG we prefer only in rheumatic, means refractory chorea in end stage. History of arthritis पूछा, then answer is simple. It is aspirin. Aspirin is the answer without any doubt. Yes, question था, देखो था ये question. Clear? Moving to next one. Aspirin था, aspirin answer. Migraine. So this was the question. A patient migraine का question था. So again it was headache was mentioned, unilateral with skipping meal. Skipped meal, it's a trigger. तो अगर आप breakfast या lunch dinner नहीं करते when you skip the meal, that can act as a trigger for migraine. So diagnosis is migraine. Photophobia was also mentioned, I think. So they have also mentioned photophobia. So it's a case of migraine, right? Clear? Chorea was not given. Okay, STEMI question, treatment of choice. Option was streptokinase. STEMI का question है, then answer should be PCI. PCI था option में. Okay, then there was a question FEV1 less than 70% of predicted. So it's a case of COPD. Means some obstruct or asthma. So दोनों में से देखो क्या दिया था, that will be the answer. It's a case of obstructive lung disease. Migraine था, photophobia भी था, तो वो सही हुआ है तुम्हारा. टेंशन ना लो, जस्ट रिलैक्स. क्लियर? अर्ली मॉर्निंग हेडेक था, हो सकता है माइग्रेन कैन अकर एनी टाइम, राइट? इट कैन अकर एनी टाइम, सिंपल. ओके, देन देयर वाज अ क्वेश्चन, अ पेशेंट इज हैविंग करंट रेड जेली स्पुटम, अल्टर्ड सेंसोरियम, हाइपोटेंशन, क्लिनिकल केस. नाउ अंडरस्टैंड, करंट रेड जेली स्पुटम कहां मिलता है? वेयर वी सी दिस इन क्लेप्सियला. क्लेप्सियला में होगा. Now question, I think they are asked you like this type of question. It was oral antibiotic, IV antibiotic. ऐसा कुछ क्वेश्चन था. कुरान जेली स्पुटम. अब देखो क्लेप्सियला. Now when we see curve 65 score, curve 65 score means confusion. Urea increased means BUN is increased. Respiratory rate is increased. BP is low. 65 or more age. For each we will give one. Confusion पे एक, BUN बढ़ा हुआ उस पर एक, रेस्पिरेट अगर टैकिप नहीं है तो एक, बीपी कम है तो एक, 65 से एज ऊपर है तो एक पॉइंट, राइट? नाउ अंडरस्टैंड दिस थिंग. व्हेन यू कैन सी कुरांट रेड जेली स्पुटम मींस क्लेप्सियला, अल्टर्ड सेंसोरियम मींस कंफ्यूजन है, हाइपोटेंशन इज मेंशन्ड मींस बीपी लो है, मींस 2 पॉइंट ऑलरेडी है. So this was the question came in exam. So it's a case of Klebsiella pneumonia. So this patient, when score value is more than 2, what you will do with this person? What you will do with this patient? You will admit the patient in ICU. So this is the patient you will admit in ICU and you will start IV antibiotic. ये option था. Options were like what you will do. You will give oral antibiotic or IV antibiotic, right? IV antibiotic, yes, in ICU. IU it was not COPD, then answer is asthma. Simple. ये वाला सही किया है ना, इट्स बेस्ड ऑन कर्व 65 स्कोर. हाइपोटेंशन नहीं था, अल्ट्रासेंसोरियम था. इफ creatinine था, then again when you see 2 or more score, right? Yes, IV एंटीबायोटिक देंगे, ICU में एडमिट करेंगे. दिस वाज द आंसर. ओके, मूविंग टू नेक्स्ट वन. एक वाल्प्रोइड से क्वेश्चन था. आई थिंक इट वाज अ क्वेश्चन बेस्ड ऑन अ क्लिनिकल केस, लाइक अ पेशेंट हु इज हैविंग सीजर्स. So drug of choice for seizure was asked, tonic-clonic seizures. Tonic-clonic seizure. So in that case, what drug you will use? You will use valproate. Seizure in one arm was history option was subthalamic nucleus. Seizure दिया था या tremor दिया था? Hemibellismus होगा. Vicky Patil, if there is involvement of subthalamic nucleus, that will cause hemibellismus. In this case, NB asked about respiratory rate. So here it is more than 30. If it is more than 30, we give 1 point. दो के कॉम्बिनेशन थे. ओके, कौन कौन से दो ड्रग के? Akil Khan, for MI we do angioplasty. Angioplasty is a type of PCI. Yes, it was child with GTCS. GTCS था, right? Medicine questions are simple. It is paper simple tha. Okay, then this was a question. Imidazole can cause all except. So understand this, imidazole can cause both hyper and hypothyroidism because it is having a moiety which can cause even hyperthyroidism. So just let me write one more question. There was a question on hemibellismus, subthalamic nuclear involvement. So it's a case of, so can it cause pulmonary fibrosis? Yes, it can cause both hypo and hyperthyroidism. Gynecomastia नहीं करा था. तो आंसर क्या होगा इसका? गायनेकोमेस्टिया. गाबापेंटिन नहीं होना चाहिए ऑप्शन में, अगर था तो वो आंसर नहीं होगा. लेवोटिर्सेटम एंड डायजेपाम ऑप्शन में थे. They asked about respiratory 40. Respiratory 40 is given again. If it is given 40 means that is more than 30 is 1 point. So 200 ऊपर पॉइंट आ रहे हैं, 2 स्कोर से ऊपर आ रहा है. Okay, then hemibellismus. This is involvement of subthalamic nuclei. Subthalamic nuclei. Gynecomastia होगा उसका आंसर. Lorazepam plus valproate. Yes, I think this ये आंसर हो सकता है. This could be the answer. Because first you need to stabilize the patient, then it could be lorazepam plus valproate. Gabapentin, like understand this, when we give this like as an antiepileptic drug, so like its toxicity is sometimes like there is a very long T-half, so you can see patient can be sedated for a longer period. That's why we generally don't use gabapentin and pregabalin as an antiepileptic drug. We use them more for neuropathic pain. Phenobarbiturate was not in the option. अब उसको नहीं use करते हैं, तो आंसर इधर ये अच्छा आंसर है, valproate plus lorazepam. विक्की पाटिल, उसका आंसर एंजियोप्लास्टी ही होगा, राइट. मेनिया में फर्स्ट ट्रीटमेंट विल बी लिथियम. लिथियम ऑप्शन में था कि नहीं था? ओके, लेवी बॉडी पर क्वेश्चन था. समर सिंह हिरानो पर क्वेश्चन था. समथिंग वाज मेंशन. सो लेवी बॉडी वी सी इन पार्किंसन डिजीज and DLB, dementia with Levy body. Irano body you will see in Alzheimer's. So there was one question. Status epilepticus, maybe this could be a question. अगर ये option में valproate plus lorazepam था, that is up because just GTCS can convert into status. Gabapentin option में था, तो वो question मुझे बताना. What was the question? We'll discuss that also. Okay, there was a question on lights criteria. So lights criteria पे question था, तो understand this. What we do in lights criteria? Pleural fluid protein is to ascitic fluid protein is to serum protein, sorry. Then pleural fluid LDH, serum LDH, when its value is more than 0.5, more than 0.6, right? पार्किंसन का क्वेश्चन था. ओके, क्वेश्चन में रिजिडिटी मेंशन थी. देन अगेन इट बिकम्स अ क्वेश्चन ऑन पार्किंसन डिसीज. ट्रेमर्स और ब्रैडिकाइनेसिया भी था. मींस ट्रेमर्स वाज गिवन, ब्रैडिकाइनेसिया वाज गिवन. डन. ओके, लाइट्स क्राइटेरिया पे जो क्वेश्चन था, लाइक समटाइम अंडरस्टैंड व्हेन यू सी लाइक प्लूरल फ्लूइड, रेशियो ऑफ प्लूरल फ्लूइड प्रोटीन is to serum protein more than 0.5, pleural fluid LDH, serum LDH more than 0.6. And this if you see pleural fluid LDH value is more than 2/3 of upper limit of serum LDH, that is what we call So question पूछा था कि how we differentiate. So there are sometimes we can differentiate, we cannot differentiate whether it is exudative or transudative, because some exudate can present with transudative fusion. Answer था protein rich fluid. So the best way, best method is it is protein. So अगर आपको दोनों में से एक चूज करना है, so what we do like pleural fluid protein minus serum protein minus pleural fluid protein. So protein is best. Which of the following will rule out transudative? So answer is protein. Yes, differentiate. देखो क्या होता है, around 10 to 20% we can this fusion we can misdiagnose by the slides criteria. So what we do, then we need to see the subtraction of protein. So that's very important. So what will rule out transudative? So understand, we need protein. Clear? Yes, living body. It was yes, it was image based question. Myasthenia drug of choice was asked. Simple question था, drug of choice पूछा था. Then there was a question of patient who is suffering from bronchoria, watery sputum. So if it is given bronchiectasis in the option, that is the answer. Some are saying it is not given, then answer will be CA lung. CA lung can also present with bronchoria. Okay, so don't worry. I think we have discussed most of the question, around 40-42 question. So after 2-3 days we will discuss a detailed version of with proper options. Abhi bas shanti se enjoy karo. I think now you can see, you can cross check yourself. Just I'll move the slide once again. एक बार मैं शुरू से दिखा दूंगा. No cellular content will rule out. Yes, which cells we cannot rule out. So we have to check protein. आपको protein का differentiation check करना है. तो एक बार मैं दिखा देता हूँ like what are the mistakes which you did and what you need to rectify. So let us see this. तो कहाँ गलती करी है? Let us see this. Okay, starting with this. ये तो सबका सही हुआ है, right? Bronchiectasis was there, so that is the answer. So ये सबका सही हुआ है, easy one. Then you can see iron deficiency anemia. I think most of you have answered correct. Asterixis वाला कुछ लोगों ने गलत किया है, तो this is like relatively a difficult one. Then you can see this man syndrome, again most of you have did this correct. Cannonball सबका सही हुआ है. Surfactant deficiency सबका correct. Refeeding syndrome सबका सही हुआ है. Ritter syndrome is easy one. Dux criteria easy हुआ है. Cryptococcus, then you can see this ectopic ACTH, ये भी almost सबने सही किया. Heel to shin test, cerebral examination. कफ का हिस्ट्री था आंसर में, bronchiectasis था, that's the answer. वही आंसर होगा. कौन syndrome पूछा था. Then they ask you like all are causes. Simple question को clinical way में बना दिया, but question was all are causes of pulses, paradoxes except. कफ with changing position था, chronic smoker था. MG वाले क्या था? MG वाला मीन्स MG क्या है? हाइपोथर्मिया में क्या करेंगे पूछा था. ऑप्शन क्या कहते हैं? एस्पिरिन था, एस्पिरिन आंसर होगा. कार्टागेना सिंड्रोम का क्वेश्चन था. ओके गाइस, सो आई होप लाइक यू हैव एंजॉयड दिस. सो थोड़ा अपना देख लो, इसको रेक्टिफाई कर लो. देन आफ्टर फ्यू डेज विल डिस्कस द डिटेल वर्जन ऑफ दिस क्वेश्चन. थैंक यू सो मच. कीप वर्किंग हार्ड. बाय बाय.
You're live? इसमें आ नहीं रहा है? आ गया? तो बहुत पहले से लाइव है क्या जी? Alright, hi guys, I hope your exam went well and I was able to meet a couple of you after the examination at some of your centers. And the question of pharma, what we saw was relatively on the easier side. Most of the questions that we have discussed in our usual classes, some of the questions were directly also from computer-based offline test and also in the usual T&D that we are discussing. A lot of questions we have also got from our session that we have conducted just prior to the examination. That was a 4-hour session in which also we have discussed a lot of topics from where a lot of questions were seen. Now we have got a couple of questions from pharmacology. Let us quickly see. And once again, I'm telling you that these are just a recall-based questions that we have collected from some of the students, those who were able to provide their feedback. At any point of time, if you feel that options were not there or this question was having a different kind of language, please feel free to give your feedback in the comment section. The very first question that I'm having is about a 2-month a pregnant female having malaria. So some of the students were saying, sir, it was Plasmodium falciparum. Some of them were saying Vivax, preferred drug of choice. Now, please just confirm whether it was a case of Vivax or falciparum, and immediately we can start. Whenever there is any malaria in pregnancy, always and always remember what we do not give. Pregnancy में अगर malaria होता है, so what we actually do in the first trimester, I have discussed with all of you guys, in the first trimester, we are going to use quinine. Depending on the patient's requirement, we can also add one more compound, that is clindamycin. In the second, third trimester, I have discussed with all of you guys that we are going to use artemisinin combination therapy. In any of the scenario, always and always remember, we never give a primaquine. Primaquine is contraindicated throughout. Apart from that, you should also remember that doxy तो एक tetracycline है ना, that is associated with the teeth staining and bone growth abnormality. The table that I have discussed with all of you guys, I hope you have seen here. So from the given question that we are having, if it is going to be a case of Vivax, let's not discuss in that case scenario. I hope all of you guys were able to get this one, that quinine will be the best choice that we are going to see here. Primaquine तो देंगे ही नहीं ना. She is a 2-month pregnant, first trimester है. Artemisinin combination therapy, again that will be utilized in second, third trimester. Always and always remember that artemisinin combination therapy in animal model have been associated with some teratogenic effect. Doxy देंगे नहीं, मैंने पहले ही बता दिया. There will be a tetracycline associated with teeth staining and bone growth abnormality. ठीक है? First question, we are done here. Which of the following is the least common side effect, or I would say least side effect of amiodarone? So was it a least word or was it not a word? Because in any of the scenario, least होगा या not होगा, in any of the scenario, there are only few reports of gynecomastia. अगर मैं बात करूँगा, तो amiodarone is one of the class 3 antiarrhythmic drug that is associated with multiple side effects. I told you that amiodarone always keeps your thyroid in the confused state. Sometimes it can lead to hyper, sometimes it can lead to hypo, है ना? Apart from that, pulmonary fibrosis, corneal microdeposits, all of them can be associated. Corneal microdeposits, your hepatotoxicity, corneal microdeposits, hepatotoxicity, and also your QT prolongation, because they are class 3 antiarrhythmic drug. So correct answer for this question that we have seen here is gynecomastia will be the best answer that I could choose. At any point of time, as I'm telling to all of you guys, please feel free to give your feedback that whether this question was there or not. What is not mentioned, guys? It was not mentioned. Okay, so it was not mentioned, that means ठीक है, Vivax हो गया. It was not mentioned, that means कि not side effect था. Which of the following is not a side effect? So in that case scenario also, you can go ahead with the gynecomastia as an important side effect. Gynecomastia will not be a side effect of the same. ठीक है, clear? Next question is going to be patient with congestive heart failure and was on thiazide diuretics, developed hypokalemia. So thiazide diuretics will be causing everything. They will be causing loss of sodium. They will be causing loss of potassium.
they will be causing every electrolyte will be lesser on the lesser side, but at the same time I have told you that they will be associated with hypercalcemia. Whenever they are associated with hypokalemia, because they themselves are causing hypokalemia, which of the following agent will inhibit the loss of potassium? So inhibiting the loss of potassium will always and always be, guys, potassium sparing diuretics. And if you have attended the session, all the potassium sparing diuretic we used to remember by the simple mnemonic of SETA, SETA. And here S stands for your spironolactone, eplerenone, triamterene, and amyloride. Correct answer for this question will be amyloride, because there is already a case of hypokalemia. We need to inhibit the loss of potassium. So in that case scenario, amyloride will be the correct answer. We are not going to use furosemide because they will further cause loss of potassium. Adenosine is a drug of choice for your PSVT, and amiodarone again is a potassium blocker, that is class 3 antiarrhythmic drug. It has no such role here. I hope all of you guys have got this correct, and most of you have got this correct, I am pretty sure. देन ये क्वेश्चन मैंने क्लास में बोला था बार बार, या तो इसका साइड इफेक्ट आता है या इसका मैकेनिज्म ऑफ एक्शन. सो व्हाट डिड दे आस्क इन द प्रीवियस एग्जामिनेशन? इन द प्रीवियस एग्जामिनेशन दे गिव bedaquiline and option was ATP synthase inhibitor. Instead of ATP, what they give? Adenosine triphosphate. And I told you in the class as well that since they have already asked bedaquiline, there are two questions that is possible. Either there will be predominant delaminate, or there will be a question on the side effect. So this time they have asked side effect. In the upcoming examination, either there will be delaminate or predominant. So this is how we apprehend, this is how we guess that what kind of question examiner can think of in the upcoming examination. Correct answer for this one will be your QT interval. Bedaquiline is associated with important side effect like QT interval. In fact, the other newer drug that we are having, pretomanid, and other one is delamanid. इसका अगला एग्जाम में क्वेश्चन आ सकता है. Manid and manid, they are the mycolic acid synthase inhibitor. Mycolic acid synthase inhibitor, that will be one of the sidal drug, and this one is also associated with the same kind of side effect, that is QT prolongation. ठीक है. A 2-month-old pregnant female require anticoagulation. Which of the following is the preferred agent? So I think we have discussed this many times. We have seen this question in our multiple reels as well. है ना, हमने अपने reel में भी इसको अच्छे से देखा है कि how to do anticoagulation during the pregnancy. So in the 1 to 12 week, I have discussed with all of you guys, according to American Heart Association or according to American College of Cardiology, we used unfractionated heparin or low molecular weight heparin. Preferably low molecular weight heparin. From 13 to 35 we use warfarin, and in the previous examination what they asked, that the patient is on in the 36th week, she is on warfarin, what will you do, hai na? So from 36th week you will again switch to, you are going to again switch to low molecular weight heparin or unfractionated heparin, preferably low molecular weight heparin. So again from the given choices we are having enoxaparin. They are needing anticoagulation. Aspirin is one of the antiplatelet drug. Apixaban and anticoagulant, they are the 10A antagonists. Preferred one is always and always your low molecular weight heparin. Warfarin is anticoagulant. We are not going to use warfarin because they are going to be associated with a side effect, that is Contradi syndrome. Now since they have asked this question, what we can expect in the upcoming examination is what will be the teratogenic effect of warfarin. So this is how examiner thinks, and we have to think like an examiner again. Correct answer for this one is enoxaparin. I hope all of you guys have got this one. Please feel free to provide your feedback, and this is the best form of question that I could come up by this when I was discussing with many of our students, and every question, every option was well discussed before I came in front of all of you guys. A patient was given antipsychotics, haloperidol. She developed one-sided neck stiffness and altered body tone. So again, haloperidol is which type of drug, guys? Haloperidol is one of the typical antipsychotics. That is one of the D2 blocker, a typical antipsychotics, D2 blocker. It's actually associated with your extrapyramidal symptom, that is dystonia, and this is exactly what we see. Other side effect will be hyperprolactinemia. So next examination there can be a question, what could be the other side effect, hai na? Or a patient is on antipsychotic drug and she is, let's say, not able to conceive, what could be the possible reason? Again, same topic, different type of question can be framed for all of you guys, right? So next step in the management, what will you do? Can you guys tell me that what will you do? Increase the dose of haloperidol. You see, if the patient is already having extrapyramidal symptom, why will you ever increase the dose of haloperidol? For the management of this one, we always discuss that for the management, we are always going to use centrally acting anticholinergic drugs like your benzhexol, benztropine, right? Or I told you there is antihistaminic drug having anticholinergic property by the name of your promethazine. ठीक है. Among the given choices, you are having a benztropine. Why don't you use benztropine? Now examiner is telling switch to clozapine. Immediately switching to clozapine is not going to be an option. Although clozapine looks a very convincing answer and many of you may have made a silly mistake. I'm not telling that you guys have made it only, but अगर आपने किया है तो possible उसका reason क्या है? Reason उसका ये है कि आपको लगा होगा clozapine तो typical है. क्लोजापिन इज टिपिकल है ना, तो क्लोजापिन, ओलांजापिन है ना, रिस्पेरिडोन, दे आर ऑल टिपिकल एंटीसाइकोटिक, सॉरी एटिपिकल एंटीसाइकोटिक. टिपिकल तो हमारा हेलोपेरिडोल दे ही रहे थे, है ना. क्लोजापिन इज मेनली प्रिफर्ड इन रेजिस्टेंट केसेस. इट्स मेनली प्रिफर्ड इन द रेजिस्टेंट केसेस. फ्लूफेनाजिन इटसेल्फ इज ऑल्सो वन ऑफ द टिपिकल एंटीसाइकोटिक्स. It's also one of the typical antipsychotics. They will also worsen the problem of extrapyramidal symptom. Flufenazine will also worsen the problem of extrapyramidal symptom. I hope each one of you have got the answer here. Add benztropine नहीं था क्या? Add clozapine था, ठीक है. Switch to clozapine, add clozapine, ठीक है. दोनों में से अगर कोई भी ऑप्शन है. Did you had an option of either benztropine or benzhexol? Any one of you got the option of either benztropine or benzhexol? इनमें से कोई ऑप्शन था क्या? Any student, those who are listening to me, you can quickly reply. क्या ये ऑप्शन में था? I think there is slight delay in whatever you are writing here. But again, according to me, the option is going to be B, that is add benztropine, that is one of the centrally acting anticholinergic. अगर benztropine था तो वो आंसर होगा. Now this was the question. A patient was on anti-amoebic drug because maybe they have amoebic cyst or whatever amoebic condition that they have given, consumed alcohol and developed flushing, hypotension, nausea, vomiting. What is the diagnosis? Again, I have told you anti-amoebic drug, like metronidazole, they are also having a effect that they are associated with the aldehyde dehydrogenase inhibiting property, and they are associated with the disulfiram like reaction. It's not a case of delirium tremens or alcohol withdrawal. There is no sudden stoppage of alcohol, so mainly anti-amoebic drug is definitely associated with anti-amoebic like metronidazole associated with the disulfiram like reaction. Many students are marking like Faizan, Sachin, that yes benztropine था. अगर benztropine है और IV है तो बेस्ट है ना. अगर IV है तो बेस्ट है because it's an immediate condition. अगर injectable दिया हुआ है तो that is going to be the best choice that you are going to choose here. B will be the correct answer, guys. B will be the correct answer. ठीक है. Now this was the question. I could not get many option here because students said sir postmenopausal women था, breast cancer का case था. We did not look for left and right. आपने पढ़ाया था breast cancer में SERM, selective estrogen receptor modulator, like tamoxifen, raloxifene can be given. Now in the previous examination what they did that a patient presented with the breast cancer, she was given a drug tamoxifen. Which of the following cancer risk will increase? This was in the previous examination. They have already asked this one in the previous examination and the answer to this was endometrial carcinoma, है ना. But here they did not mention, they just change. ठीक है, ब्रेस्ट कैंसर कैसे ट्रीट करोगे तो टैमोक्सिफेन. इफ यू गाइस कैन रिकॉल एनी अदर ऑप्शन प्लीज फील फ्री टू गिव द other option in the comment section. If there was a case of let's say a platinum compound, or if there was an option of methotrexate, or if there was an option of let's say cyclophosphamide, है ना, या bleomycin busulfan, कुछ ऐसा ऑप्शन था that could be considered as an option. But again breast cancer के लिए SERMs are considered as the preferred drug, है ना. So there is one that is tamoxifen. Now in upcoming examination they can think and you think like an examiner, but can we ask अगर मुझे यही मिल जाए पेपर में, थोड़ा एडिटिंग करके नया पेपर बनाना हो तो मैं क्या करूँगा? If you think like that, you will start making question out yourself when you read the topic of PYQs. Next one is raloxifene. Raloxifene is not having this problem of endometrial, है ना. They will be causing endometrial proliferation. They are going to cause endometrial proliferation or increasing the risk of endometrial carcinoma. ठीक है, ये होता है. रेलॉक्सिफिन के साथ ऐसी कोई बात नहीं है. ठीक है. Methotrexate was also given. Okay, very good, Dr. Faizan. If methotrexate was given, let's take methotrexate as an option. Again, that's not a drug of choice. If it is a case of osteosarcoma, or if there is another case of let's say choriocarcinoma, or for inducing abortion and other condition, we can utilize that. Next question, which of the following anti-diabetic drug increase the loss of glucose in the urine? So glucosuric drug, है ना. So glucosuric drug, they are going to be none other than your empagliflozin. They are one of the SGLT2 inhibitor. This is going to increase the loss of glucose. Now since they have asked this one in glucose, upcoming exam ka expected question, very potential MCQ, the important side effect, where the most common side effect will be UTI. Sometime you may look for UTI as an option, but it will not be an option. Examiner is very fond of this word called urosepsis, so they can give you urosepsis. Euglycemic ketoacidosis could be the other important side effect. Fournier gangrene, this one has already been asked in one of the AIMS examination. They can also be associated with the weight loss and other side effect. In one of the PYQ, they said that they also increase the fracture risk. But this one, this statement, fracture risk, it is denied in the 14th edition of Goodman-Gilman, saying that although there were previous report of fracture risk that is associated with your canagliflozin, but this one is not found in the further studies. It was not found in the further studies. तो further studies में उनको मिला कि it is possibly increasing the amputation risk, but fracture risk को ये बढ़ाता नहीं है, ये नहीं बढ़ाता है. I hope all of you guys have got this one, और इसको आप आसानी से कर पाए होंगे. ठीक है. Now apart from that, they can change this one and they can increase which of the following anti-diabetic drug can have a lot of GI related side effect like malabsorption or other GI related side effects. So A-carbose आप सभी को पता है, it is one of the alpha glucosidase inhibitor. A-carbose is one of the alpha glucosidase inhibitor. Lots of GI related side effect that we have, like malabsorption will be one of the important side effect. Exenatide is one of the GLP analog associated with the pancreatitis, hypoglycemia. Glipizide is one of the second generation sulfonylurea, causing your weight gain, bone marrow suppression, and other important side effect, right? But they will not be associated with the loss of glucose in the urine. Next one is which of the following is the site of action of thiazide diuretics. अब देखिए क्या किया, पिछले एग्जामिनेशन का पेपर उठाइएगा, अगर आपको आपने देखा भी होगा इन FMG solution और also in our previous YouTube session, same question. What they did, they actually made previously, है ना, ऐसे करके ट्यूब्यूल ड्रॉ कर दिया पिछले एग्जामिनेशन में, है ना, पिछले एग्जामिनेशन में एक ट्यूब्यूल ड्रॉ कर दिया एंड दे मार्क्ड एन एरो हियर. पिछले एग्जाम का क्वेश्चन है एंड दे सेड विच डायरेटिक विल बी वर्किंग हियर, है ना. ऑप्शन में था फ्यूरोसमाइड, थायाजाइड, ऐसे करके ऑप्शन में था. तो विच डायरेटिक विल बी वर्किंग, दिस इज वन ऑफ द PYQ. ये PYQ है. अब उसमें क्या किया कि हटा दिया. अब बोला कि भाई थायाजाइड डायरेटिक्स कहाँ काम करेगा, तो देखिए यहाँ पे तो थायाजाइड काम करता है. थायाजाइड विल बी एक्टिंग बाई ब्लॉकिंग NaCl को ट्रांसपोर्टर एट द अर्ली पार्ट ऑफ DCT. NaK2Cl co-transporter will be inhibited by loop diuretic. Epithelial sodium channel blocker. अभी बता दिया आपको. Amyloride could be one of the answer. Triamterene amyloride could be one of the answer. Aldosterone receptor blocker will be none other than your spironolactone. तो ये सारे के सारे क्वेश्चन तो काफी ही इजी लग रहे हैं ना, काफी इजी. यस, फॉर्नियर गैंग्रीन आई थिंक मैंने लिखा है ना, देखिए ये रहा डॉक्टर, मैंने फॉर्नियर गैंग्रीन लिखा हुआ है. डॉक्टर दर्पण, डॉक्टर जे दर्पण, आई हैव रिटन ऑलरेडी फॉर्नियर गैंग्रीन. आई होप आप इसको देख पा रहे हैं. Definitely Dr. Faizan and all the other students, I hope all of you guys have got a good question from FMG solution as well. Sir, pre-menopausal drug of choice for breast cancer. देखिए breast cancer है pre-menopausal, post-menopausal, दोनों ही condition में SOMS will be the drug of choice. A 70-year-old female presented with the palpitation from past 2 days, BP measured 210/90. Now इसमें क्या हुआ है मैं बता रहा हूँ. इस क्वेश्चन पे there is a lot of question mark because स्टूडेंट्स ने क्या किया है, 2 क्वेश्चन को मर्ज कर दिया है. 2 क्वेश्चन हैव बीन मर्ज, है ना. सो देयर इज पॉसिबल एरर इन रिकॉल. आई एम जस्ट मेंशनिंग इट हियर बिकॉज समटाइम, है ना, यू कैन टेक अ स्क्रीनशॉट सेइंग कि सर ने ऐसा बोल दिया वैसा बोल दिया. देखिए रिकॉल बेस्ड क्वेश्चन में देयर आर चांसेस ऑफ एरर, बट मोस्ट ऑफ द क्वेश्चन दैट वी हैव ट्राइड टू ब्रिंग बिफोर ऑल ऑफ यू गाइस इज द मोस्ट रिफाइंड वर्जन. एंड अगेन व्हेन वी विल हैव द अदर ऑप्शन दैट इज कंप्लीट, वी विल come back again and we can have another session. But here, since I am pretty sure that all of you guys are having this anxiety, what could be the possible answer for the question that I have attempted, I hope that you guys have seen this question. and इसमें 2 तरह के क्वेश्चन मर्ज हो रहे हैं. एक तो ये 70 ईयर का अलग क्वेश्चन था, आई बिलीव, ये मुझे ऐसा लगा, और एक दूसरा था कि प्रेग्नेंट फीमेल है और उसको जो है कि आस्मा है और उसको हाइपरटेंशन है. तो इसलिए इसमें 2 तरह के क्वेश्चन, मेरे समझ से 2 तरह के क्वेश्चन इसमें मर्ज हो रहे हैं. अगर आपको इसमें कुछ चेंजेस करना है, विच आई बिलीव इज अ पॉसिबल चेंज, यू कैन लेट मी नो. बट इफ दिस इज द केस, वेयर 70-year-old female have palpitation from last 2 days and BP is very very high, that is already going into the hypertensive urgency and emergency, है ना, उसकी तरफ जा रहा है ना. although there is no mention of any end organ damage, but again if it's already on the hypertensive crisis side, we will try to usually utilize IV drug, IV labetalol, right. राइट। तो अगर ये क्वेश्चन है तो इसका आंसर IV लेबेटालॉल होगा, अगर बीपी कुछ और था तो आंसर में चेंज, है ना। तो डिपेंडिंग ऑन, है ना, अगर मान लीजिए जैसे एक डॉक्टर हैं, डॉक्टर मेडिको AKR, ही इज राइटिंग कि सर क्वेश्चन थोड़ा और था, तो लेट्स से इफ यू आर हैविंग, है ना, 2 डिफरेंट क्वेश्चन था, बिल्कुल बिल्कुल, है ना। सो इफ देयर इज अ प्रेग्नेंट पेशेंट विथ आस्थमा, है ना, इफ देयर इज अ प्रेग्नेंट पेशेंट विथ आस्थमा, यू कैन लेट मी नो if the BP will be, let's say, 150/90, if the BP is 150/90, if you're saying sir BP 150/90 tha, then in that case scenario, since there is no mentioning of end organ damage, I would strongly say that guys, please proceed or go ahead with the oral labetalol, है ना, oral labetalol, ठीक है। अगर डोपामीन ऑप्शन में नहीं था तो क्या था? दिलीप यू कैन टेल मी, दिलीप यू कैन लेट मी नो। ये 2 क्वेश्चन का मर्जिंग हुआ है, फ्यूजन हो गया 2 क्वेश्चन का, 2 क्वेश्चन आया हुआ था, एंड आई एम प्रीटी श्योर, ये मेरा अपना एजम्पशन है, बिकॉज मेनी अ टाइम्स आई हैव सीन दैट स्टूडेंट गेट कंफ्यूज आफ्टर कमिंग फ्रॉम द एग्जामिनेशन। 1-2 दिन लग जाते हैं उनको इस पर्टिकुलर 3-5 घंटे का जो एक वॉर लड़के आ पाए हैं उसको पूरी तरह से समझने में, क्या आया था क्या नहीं आया था, इट टेक सम टाइम, आई टोटली अंडरस्टैंड, है ना। अगर ऑप्शन में मान लीजिए इसके अलावा निफेडिपिन था, प्रेग्नेंट पेशेंट विद ब्रोंकियल आस्मा, तो ये अलग क्वेश्चन है ना। 70 ईयर वाला, तो फिर 70 ईयर की फीमेल फिर प्रेग्नेंट कैसे होगी यार, मतलब आप समझ रहे हैं, है ना। 2 क्वेश्चन अलग अलग था, 2 अलग अलग क्वेश्चन था। निफेडिपिन, निकार्डिपिन भी कोई बोल रहा था क्या? दिलीप कुमार साहू इज टेकिंग निकार्डिपिन, एक्सीलेंट एक्सीलेंट। चलिए, तो आप समझ पा रहे हैं, आई होप यू गाइस आर अंडरस्टैंडिंग हियर कि यहाँ पे 2 क्वेश्चन का फ्यूजन हुआ है। विल ट्राई टू कम अप विद द मोस्ट रिफाइंड वर्जन ऑफ दिस वन। तो इस क्वेश्चन को अगर मैं यहाँ पे बोलूँ कि 70 ईयर की फीमेल है और BP 150/90 है, ओरल लेबेटालॉल, बाकी प्रेग्नेंट पेशेंट विद द ब्रोंकियल आस्मा, इसके ऑप्शन जैसे ही आते हैं विल ट्राई टू कम अप एंड विल ट्राई टू ब्रिंग द मोस्ट रिफाइंड वर्जन, ठीक है। नेक्स्ट क्वेश्चन देख लेते हैं। 7-year-old child present with a history of generalized tonic-clonic seizure, what will be the treatment? जनरलाइज टोनिक-क्लोनिक सीजर। नाउ इस क्वेश्चन में भी थोड़ा सा मुझे लगा कि इट नीड्स सम रिफाइनिंग। वेलप्रोवेट फॉलोड बाय गाबापेंटीन, ओनली इथोसक्सिमाइड, लेवेट्रासिटाम फॉलोड बाय गाबापेंटीन एंड कार्बामाजिपिन फॉलोड बाय गाबापेंटीन। वाज देयर अ क्वेश्चन लाइक दिस? आदर्श वो क्वेश्चन है, आई विल बी डिस्कसिंग दैट, है ना। ऐसे नोट वाला जो ग्राफ वाला क्वेश्चन था ना, दैट क्वेश्चन इज देयर डॉक्टर आदर्श, आई विल बी डिस्कसिंग दैट। Just allow me some time, others, I'll be discussing that. Please let me know this question. इसका लिख लेते हैं। ब्रोंकियल आस्मा, ऑप्शन आर कमिंग इज फ्रॉम फैजान इज निफेडिपिन, B is propranolol, C is labetalol, D is verapamil. Okay. You are pregnant female with bronchial asthma. Anything else? ये वाला सेकेंड वाला, इसकी बात कर रहे हैं डॉक्टर दिलीप। ओके, ठीक है, मैंने बताया ना, इसका एक बार जैसे जैसे रिफाइंड वर्जन आ जाता है, विल ठीक है। अगर आप मुझसे पूछेंगे कि इस कंडीशन में, अगर ये क्वेश्चन था, इस कंडीशन में सर क्या यूज करेंगे, तो मैं बोलूंगा कि देखिए निफेडिपिन विल बी द बेस्ट चॉइस बिकॉज देयर इज अ हिस्ट्री ऑफ ब्रोंकियल आस्मा। लेबेटालॉल इज वन ऑफ द बीटा ब्लॉकर, लेबेटालॉल इज वन ऑफ द बीटा ब्लॉकर विथ अल्फा 1 blocking property. Now because of the beta blocking property, sometimes there is a precipitation of bronchial asthma. Nifedipine will be the safer option. Now always remember in the calcium channel blocker, calcium channel blocker by non DHPs, verapamil, diltiazem तो मना करते हैं ना प्रेगनेंसी में। अगर आपको याद होगा तो मैंने बताया भी था कि देयर इज समथिंग कॉल्ड लेडी हार्डिंग मेडिकल कॉलेज। तो मैंने बताया था प्रेग्नेंट फीमेल हो गई तो उसको कहाँ भेजोगे? सेंड हर टू लेडी हार्डिंग मेडिकल कॉलेज, लेडी हार्डिंग मेडिकल कॉलेज, LHMC, लेडी हार्डिंग मेडिकल कॉलेज। दैट इज गोइंग टू बी सेफ, दैट इज गोइंग टू बी लेबेटालॉल, हाइड्रोलाजीन, अल्फा मिथाइल डोपा एंड कैल्शियम चैनल ब्लॉकर एंड कार्डियो सेलेक्टिव बीटा ब्लॉकर। कार्डियो सेलेक्टिव बीटा ब्लॉकर, नॉन सेलेक्टिव बीटा ब्लॉकर नहीं देते हैं, नॉन सेलेक्टिव बीटा ब्लॉकर आर अवॉइडेड, है ना। तो अवॉइड DNB वाज द नेमोनिक है ना। आई यूज टू टेल यू दैट अवॉइड क्या करना है, तो हमेशा क्या करिएगा, अवॉइड करिएगा डीएनबी को, डीएनबी इज अवॉइडेड, सो अवॉइड डीएनबी स्टैंड फॉर योर एस इनहिबिटर एआरबी, है ना, एस इनहिबिटर एआरबी। जस्ट अ मिनट प्लीज, लेट मी, हाँ पेन काफी थिक है, ACE inhibitor ARB, that is avoided. All form of diuretics are avoided. Sodium nitroprusside also, and non-DHP also is avoided. Plus beta blocker. कौन सा बीटा ब्लॉकर नहीं देते हैं, नॉन सेलेक्टिव आर नॉट सेलेक्टेड, नॉन सेलेक्टिव आर नॉट सेलेक्टेड। तो ये तो बहुत ही फेमस निमोनिक है ना, जो मैं बताता हूँ। डीएनबी कॉलेज को अवॉइड करना है, कहाँ भेजना है पेशेंट को, सेंड योर पेशेंट टू लेडी हार्डी मेडिकल कॉलेज। सो ये बी और डी तो दे ही नहीं सकते ना, बी और डी इज समथिंग दैट इज स्ट्रांगली कॉन्ट्राइंडिकेटेड, बी और डी को तो बिल्कुल देना ही नहीं है बच्चे, ठीक है। तो अगर ये सिनारियो है तो निफेडिपिन विल बी द करेक्ट आंसर, और ऊपर वाला भी आई थिंक, तो दोनों क्वेश्चन रिफाइन हो गया ना। तो ये दो अलग अलग क्वेश्चन थे, बच्चे मर्ज कर दिए थे, बट थैंक्स टू ऑल ऑफ यू गाइस दैट ऑल ऑफ यू गाइस हैव गिवन इट करेक्टली। नाउ इट्स एब्सोल्युटली फाइन नाउ, है ना, अब ये गुड कंडीशन में आ गया है, ठीक है। डर आकिब अल्ताफ, वैल्प्रोएट प्लस लेवेट्रासिटाम वाज इन ऑप्शन। 7-year-old child present with a history of generalized tonic-clonic seizure. What will be the next coming to this question? I am pretty sure कि इसका भी कुछ एक refined version definitely है ना, इसका भी एक रिफाइंड वर्जन है। वेलप्रोएट प्लस लेवेट्रासिटाम वाज इन ऑप्शन, एक वेलप्रोएट फॉलोड बाय गाबापेंटीन, इथोसक्सिमाइड, लेवेट्रासिटाम फॉलोड बाय गाबापेंटीन, कार्बामाजेपिन फॉलोड बाय गाबापेंटीन। कैन यू गाइस रिकॉल द ऑप्शन इफ इट इज करेक्ट? विवेक यादव, अगर अप्रैल है, अगर कोई कैप्टोप्रिल है उसको भी नहीं देंगे, दे आर ऑलवेज अवॉइडेड। एस इनहिबिटर ARB आर नॉट गिवन। लेबेटालॉल, देखिए अगेन विवेक यू आर गेटिंग कंफ्यूज, लेबेटालॉल ओरल IV वो 70 ईयर वाले में आई थिंक स्टूडेंट्स हैव कंफ्यूज, दे हैव ऑलरेडी गिवन, वी हैव डन दैट ऑलरेडी। इस क्वेश्चन का अगर आपके पास कोई रिफाइंड वर्जन है तो यू कैन लेट मी नो, इफ यू नो दैट द ऑप्शन हियर वी कैन क्विकली करेक्ट दिस वन। वेलप्रोएट प्लस लेवेट्रासिटाम वाज इन ऑप्शन, ओके। गाबापेंटीन ऑप्शन में नहीं था, okay. Valproate plus levetiracetam, I think Dr. Akib Altaf and other students agree to this one. Lorazepam and levetiracetam also, lorazepam followed by levetiracetam, ठीक है। जनरलाइज टोनिक क्लोनिक सीजर हो रहा है, द ड्रग ऑफ चॉइस फॉर जनरलाइज टोनिक क्लोनिक सीजर, दे मेंशन जस्ट द ड्रग ऑफ चॉइस फॉर जनरलाइज टोनिक क्लोनिक सीजर, और वाज इट अ केस ऑफ स्टेटस एपिलेप्टिकस? कुछ ऐसा हिस्ट्री था क्या कि पेशेंट को एपिलेप्सी बहुत देर से हो रहा है एंड कुछ लॉस ऑफ कॉन्शियसनेस है, वाज देयर अ हिस्ट्री लाइक दैट देयर इज अ केस ऑफ स्टेटस एपिलेप्टिकस? वाज इट अ केस ऑफ स्टेटस एपिलेप्टिकस, है ना। पांच ऑप्शन हो गए अभी तक के लिए, 5 ऑप्शन हो गए। अगर सिर्फ ही जनरलाइज टोनिक क्लोनिक सीजर की बात कर रहा है तो इन दैट के सिनारियो आई वुड से दैट यू गाइस कैन प्रोसीड डेफिनेटली विद द वेलप्रोएट फॉलोड बाय लेवेट्रासिटाम, वेलप्रोएट फॉलोड बाय लेवेट्रासिटाम। सर 1 फॉलोड बाय गाबापेंटीन इज था फॉर श्योर, तो लेवेट्रासिटाम फॉलोड बाय गाबापेंटीन तो हो गया, लोराज़ेपाम प्लस गाबापेंटीन वाज देयर, नॉट ओनली GTCS, नो ओनली GTCS वाज मेंशन, ठीक है। तो अगर GTCS मेंशनड है, ठीक है, इन दैट केस सिनारियो आई वुड आस्क ऑल ऑफ यू गाइस टू प्रोसीड विद वेलप्रोएट फॉलोड बाय लेवेट्रासिटाम। हाँ देखिए, अब अलग अलग स्टूडेंट्स के अलग अलग व्यूज आने लगे ना, कि GTCS कंटिन्यूड फॉर 30 मिनट्स, है ना, 45 मिनट्स टाइम मेंशन, कुछ बच्चे बोले टाइम मेंशन नहीं था, लॉन्ग हिस्ट्री, है ना। चलिए जैसा भी था, अब अलग अलग बच्चों के अपने अपने रिकॉल के बेसिस पे मैं आपको इसको क्लैरिफाई कर दे रहा हूं, एंड यू गाइस कैन चूज व्हाट विल बी द पॉसिबल आंसर। इफ इट वाज अ केस ऑफ status epilepticus, if it was a case of status epilepticus, then in that case scenario we can actually proceed with lorazepam, अगर लोराज़ेपाम के साथ एक SV2A ब्लॉकर लेवेट्रासिटाम है तो उसके साथ भी हम प्रोसीड कर सकते हैं, लेवेट्रासिटाम। ठीक है, अगर ये ऑप्शन था, स्टेटस एपिलेप्टिकस का केस था, ठीक है, तो वी कैन प्रोसीड विद दिस वन। और अगर आपका वर्जन ये कह रहा है कि सर GTCS था on given the option that we are having, then in that case scenario I would say valproate followed by levetiracetam, either levetiracetam जो भी था, लेवेट्रासिटाम या गाबापेंटिन, दोनों में से जो भी था आप इसको प्रोसीड कर लीजिएगा। तो डिपेंडिंग ऑन आपको क्या याद आ रहा है, यू गाइस कैन वर्क इट आउट एंड यू गाइस कैन चूज योर आंसर। एज आई एम टेलिंग यू, अगर GTCS का था तो वैल्प्रोएट फॉलोड बाय लेवेट्रासिटाम या गाबापेंटिन, दोनों में से था, दोनों में से कोई एक हो जाएगा। अगर आपको याद आ रहा है कि नहीं सर 45 मिनट से एपिलेप्सी का हिस्ट्री था, देयर वाज लॉस ऑफ कॉन्शियसनेस या ऐसा कुछ टाइम मेंशन था, कंटिन्यूअस उसको सीजर आ रहा था, तो स्टेटस एपिलेप्टिकस का केस था, उस कंडीशन में लोराजिपाम फॉलोड बाय लेवेट्रासिटाम। आई होप इट इज क्लियर टू ऑल ऑफ यू गाइस। मैंने सारे वर्जन को यहाँ पे क्लैरिफाई कर दिया। वंस अगेन आई एम टेलिंग यू, वी विल हैव अ डिस्कशन आफ्टर सम टाइम, बट अभी के लिए आपके मेंटल एक स्टेबिलिटी के लिए मैंने तीनों वर्जन को यहाँ पे आपके सामने रख दिया। आई हैव गिवन यू ऑल द 3 वर्जन। PSVT-ECG, आई थिंक डॉक्टर अमन हैज जस्ट डिस्कस विद ऑल ऑफ यू गाइस ECG के साथ। तो पैराक्सिप्सन सुप्रावेंट्रिकुलर टेकिकार्डिया में एडिनोसिन विल बी द ड्रग ऑफ चॉइस। नाउ अपकमिंग एग्जामिनेशन देयर कैन बी अ केस ऑफ सुप्रावेंट्रिकुलर टेकिकार्डिया, इन दैट केस सिनेरियो द नेक्स्ट आंसर विल बी योर वेरापामिल। ठीक है, तो PSVT वाला हो गया सर, ठीक है। हाँ देखिए, आकिब ने बिल्कुल सही बात बोला है कि पॉसिबल है कि देयर विल बी 2 क्वेश्चन एंड स्टूडेंट्स आर गेटिंग कंफ्यूज्ड, है ना। एडोरेबल वाइब कौन बोलेगा, है ना, शेर के ना मुंह में हाथ डालेगा कौन, बोलेगा कौन कि सर बोनस क्वेश्चन दे दो। ठीक है, चलो देखते हैं अगला क्वेश्चन। अ ड्रग हैज बायो अवेलेबिलिटी ऑफ 25%, व्हाट डज इट मीन, राइट। व्हेनेवर इसे देखिए कितना आसान सा क्वेश्चन है, बोला कि बायो अवेलेबिलिटी 25% है, ठीक है। ये आपका ब्लड वेसल है, दिस इज द ब्लड वेसल दैट वी हैव। Whenever you are going to give a 100% drug, not 100% will be coming to the systemic circulation. So some will undergo first pass metabolism, and after first pass metabolism, whatever the amount of drug that is coming to the systemic circulation, उसको हम बोलते हैं बायो अवेलेबिलिटी। ठीक है, तो अगर बायो अवेलेबिलिटी मान लीजिए 25% है, तो कैन यू से कि 25% ड्रग रीचेज द सिस्टमिक सर्कुलेशन, बिकॉज बायो अवेलेबिलिटी क्या है, व्हाट इज बायो अवेलेबिलिटी, इट इज द परसेंटेज ऑफ ड्रग, bioavailability is the percentage of drug reaching the systemic circulation after post pass metabolism. अगर 25% ही आ रहा है, that means 25% drug reaches the systemic circulation, not 75% drug reaches the circulation, or not the 45, है ना। तो 25 आई थिंक ये ऑप्शन तो करेक्ट है सबके लिए, ये क्वेश्चन सही है ना। अगर 30% लेफ्ट प्रोटीन करके भी था, ठीक है। अगर बायो अवेलेबिलिटी 25% है, दैट मीन्स 25% है ड्रग हैज रीच्ड टू द सिस्टमिक सर्कुलेशन। ATT कॉजिंग ऑक्यूलर साइड इफेक्ट, आई मीन इससे आसान क्या ही हो सकता था, एंटी ट्यूबरकुलर ड्रग कॉजिंग, है ना, ऑक्यूलर साइड इफेक्ट ऑप्टिक न्यूराइटिस। नेक्स्ट एग्जाम में क्वेश्चन आएगा रेड ग्रीन कलर ब्लाइंडनेस, रेड ग्रीन कलर ब्लाइंडनेस, ठीक है। सो ये मल्टीपल टाइम डिस्कस्ड है इथम्ब्यूटॉल। फिर अगले एग्जाम का क्वेश्चन हो सकता है मोस्ट हेपाटोटॉक्सिक, तो प्यारजिनामाइड, प्यार बहुत टॉक्सिक होता है बताया था। रेड ऑरेंज यूरिन डिस्कलेशन, है ना, रिफाम्पिसिन, पेरिफेरल न्यूरोपैथी, आइसोनियाजिन। सो दिस काइंड ऑफ क्वेश्चन हैज बीन आस्क्ड एंड कैन बी आस्क्ड वंस अगेन फॉर ऑल ऑफ यू गाइस, ठीक है। Next is the patient has snake bite at leg, presented with pain and swelling. Patient was stable. Next step in the management, है ना। Whenever there is a snake bite case, in that case scenario, आपको anti venom first you will have to give anti venom to this patient, है ना। Identify the dead snake, immobilize the limb, and whatever is the next option, है ना, you guys can check it out. What will be the next option? You can let me know, and give poly anti venom. Anti venom will be the most correct answer here. Obese patient was started on antipsychotic. Which of the following drug इसका which of the following drug will be preferred among antipsychotics, तो ध्यान रखिएगा अगर प्रिफर्ड among antipsychotics पूछता है और ऑप्शन में जिप्रासिडोन था, तो जिप्रासिडोन बिकॉज वो ओबीज है, तो जिप्रासिडोन विल बी द प्रिफर्ड, बिकॉज अगर आपको याद होगा तो मैंने बताया था अरिशिप्रा को देखा क्या, उसका तो वेट नहीं बढ़ रहा है, तो वी हैव ड्रग्स लाइक योर aripiprazole and ziprasidone. These are the 2 drugs that we have, aripiprazole and ziprasidone. They are having very less weight gain. Apart from that, all other atypical antipsychotics, antipsychotics, they are associated with metabolic syndrome. They are associated with the metabolic syndrome, dyslipidemia, insulin resistance, है ना. So ziprasidone, अगर ये क्वेश्चन ऐसे था, है ना, least likely to cause weight gain, है ना. तो इसको मैं बोल दे रहा हूँ least likely. अगर उसमें least likely to cause वेट गेन होगा तो ये डायरेक्टली हमारे उसी निमोनिक से सॉल्व हो गया ना. अरे शिप्रा को देखा क्या, है ना, जो आंटीज बात करती थी, कहानियां याद है कि नहीं, जितने क्लास में मैंने कहानियां सुनाई थी आपको, वो सारी कहानियों पे मैक्सिमम क्वेश्चन आप कर लोगे. रोमैटिक फीवर, आई थिंक इट्स प्रीटी वेल डिस्कस्ड बाय डॉक्टर अमन सेतिया साहब ऑलरेडी. हाइपरटेंशन प्रेगनेंसी, तो ये वाला क्वेश्चन वो है जो निफेडिपिन वाला आप बोल रहे थे, निफेडिपिन प्रोप्रानोलॉल, है ना. देन देयर वाज अ ऑप्शन ऑन लेबेटालॉल, है ना. हाइपरटेंशन प्रेगनेंसी विद ब्रोंकियल आस्मा, ये वो वाला क्वेश्चन है ना. लेबेटालॉल एंड डी फॉर वेरापामिल, ये वही वाला है जो ऑलरेडी वी हैव डिस्कस. निफेडिपिन इज द करेक्ट आंसर फॉर दिस वन. इफेक्ट ऑफ ड्रग ग्राफ एड नोट्स, है ना. तो इसका ग्राफ मुझे एक्चुअली कोई प्रॉपर ग्राफ मिला नहीं मुझे, बट ग्राफ की अगर बात करेंगे, ड्रग ग्राफ एट नोट्स, यू गाइस कैन सेंड मी आउट एंड आई कैन सी, है ना, किस तरह के ग्राफ आए हुए थे. बिकॉज आई हैव सीन मेनी अ टाइम्स स्टूडेंट हैव गिवन दिस ना इमेज कि सर ये ग्राफ आया था, बट अभी तक वो रिकॉल नहीं हो पाया कि किस तरह का ग्राफ आया था, और ऑप्शन क्या यही थे या ऑप्शन कुछ और था. ऑप्शन क्या यही थे या ऑप्शन कुछ और था. ऑप्शन क्या यही थे या ऑप्शन कुछ और था. अगर ऐसा था और साथ में मान लीजिए नॉर्मल था और इसके बाद से इसमें दे दिया है कि ये ऐसे जा रहा है आफ्टर गिविंग द ड्रग, अगर ये आगे की तरफ बढ़ गया, अगर ये दिखा रहा है कि आफ्टर गिविंग द ड्रग, ऐसे एरो करके दे रहा है, क्या ऐसे था, यह ग्राफ लेफ्ट की तरफ गया था, राइट की तरफ जा गया था, लेफ्ट की तरफ गया था. एक और क्वेश्चन दैट इज गिवन बाय द अदर्स, ड्रग ऑफ चॉइस फॉर ग्लोकोमा इन एडल्ट. आई थिंक वी ऑलरेडी नो ग्लोकोमा इन एडल्ट में वी आर हैविंग PGF2 अल्फा एनालॉग, दैट इज गोइंग टू बी आइदर लेटानोप्रोस्ट, बीमाटोप्रोस्ट, टैफ्लूप्रोस्ट, ट्राइवोप्रोस्ट, एनी ऑफ द प्रोस्टाग्लैंडिन एनालॉग. इस वाले ग्राफ में मैं अब बता दे रहा हूँ. अब मान लीजिए यहाँ पे 0 है, somewhere here it will be let's say 40, यहाँ पे मान लीजिए 40 हो गया, और ये मान लीजिए माइनस, ये मान लीजिए आपका 60 मिलीवोल्ट हो गया. ठीक है. हाँ, तो ये जो ग्राफ है ना, ये ग्राफ नोडल टिश्यू का ही है. दिस ग्राफ विल बी एट द नोडल टिश्यू ओनली. ऐसा ग्राफ नोडल टिश्यू का आता है बिकॉज मायोसाइट, अगर मायोसाइट का देखोगे तो ग्राफ उसका ऐसे आएगा, देयर विल बी प्लेटो फेज इन दैट. ठीक है. एक्शन पोटेंशियल अगर डिक्रीज हो गया है, मैं आपको सिंपल सा आइडिया दे रहा हूं, अगर एक्शन पोटेंशियल डिक्रीज हो गया है, देखिएगा, तो इन विच टाइप ऑफ ड्रग विल बी गेटिंग टू सी दिस वन. अगर आपने कैल्शियम चैनल ब्लॉकर दिया तो पॉसिबली दैट विल बी वन ऑफ द कॉज. अगर आपने सिंपैथेटिक ड्रग दे दिया, लाइक एपिनेफ्रिन दे दिया, है ना, एपिनेफ्रिन अगर दे दिया तो एपिनेफ्रिन क्या कॉज करेगा. एपिनेफ्रिन इट्स अ सिंपैथोमाइमेटिक ड्रग, तो सिंपैथेटिक में और फायरिंग जल्दी होगा, सिंपैथेटिक में फायरिंग और जल्दी होगा. बट ये पॉसिबली दिस कुड बी केस ऑफ कैल्शियम चैनल ब्लॉकर. अगर वो ऑप्शन में नहीं है तो पॉसिबली दिस कुड बी अ केस ऑफ एसिटाइलकोलिन एज वेल, बिकॉज एसिटाइलकोलिन विल ऑल्सो बी एक्टिंग एट द नोडल टिश्यू. ठीक है. बट अगेन अगर ग्राफ जब तक नहीं आएगा तो उसमें कमेंट करना बहुत मुश्किल होगा. डाउन गोइंग ग्राफ था, ऐसा नहीं था, तो लेट्स नॉट स्पेंड एनी टाइम ऑन दिस वन. ठीक है. इस पे कोई टाइम स्पेंड करने का कोई मतलब नहीं. देयर इज नो पॉइंट ऑफ डिस्कसिंग दिस क्वेश्चन. देन विल वेट फॉर द ग्राफ एंड देन वी विल टॉक अबाउट इट. रिपोलेशन वाले फेज में नीचे गया था. ठीक है. You guys have already have access to my all the social media handles. You can just draw it on a piece of paper and send me across, because after 1 to 2 days only I can just tell you what will be the possible answer, है ना. रिपोलराइजेशन में नीचे गया था, अब मैं इसमें डिस्कस करूंगा तो अगेन दैट विल टेक लॉट ऑफ टाइम. अभी के लिए बस इतना देख लो, मैंने आपको बता दिया कि अगर सिंपैथेटिक ड्रग होगा, सिंपैथोमाइमेटिक ड्रग होगा, तो सिंपैथोमाइमेटिक में क्या होगा, फायरिंग बहुत जल्दी होना शुरू हो जाएगा. और कैल्शियम चैनल ब्लॉकर होगा तो जो हमारा स्लोप ऑफ डिपोलराइजेशन फॉर द नोडल टिश्यू और द फेज 0 दैट वी आर हैविंग, है ना, कैल्शियम चैनल ब्लॉकर फेज 0 क्या हो जाएगा, थोड़ा सा और डिक्रीज हो जाएगा, स्लोप विल बी डिक्रीज्ड. ठीक है. इसका ग्राफ प्लीज ड्रॉ करके भेजिएगा. आई एम प्रीटी श्योर आई विल बी एबल टू एक्सप्लेन यू वेरी नाइसली. Now ये वाला क्वेश्चन एक नया था, and I believe this is going to be the last question for the day. A patient with a history of HIV and antiretroviral therapy, lamivudine 300 mg, tenofovir 150 mg, dolutegravir 50 mg once daily at night. He was diagnosed with tuberculosis and started on ATT. ठीक है. तो HIV में TB का कई बार बहुत ज़्यादा हाई चांसेस होता है ना, opportunistic infection. Which of the following dose adjustment will be required, है ना. तो क्या दिया गया इसको, lamivudine दिया गया, lamivudine. Then we are having tenofovir. Tenofovir is one of the nucleotide reverse transcriptase inhibitor. Nucleotide nucleotide reverse transcriptase inhibitor. Now tenofovir as a drug, excreted unchanged in the tenofovir as a drug excreted unchanged in the kidney. Through the renal route, they will be excreted. That is why tenofovir is mainly associated with a very important side effect, that is the renal toxicity and bone toxicity. Renal toxicity and bone toxicity is a very, very common side effect. Now next that we are having is going to be a very lovely drug that is known as your lamivudine, a very safe drug. Lamivudine that we are having is a very safe kind of drug that we have, and lamivudine is not a substrate of it's not a substrate of your CYP3A4. Rather it is mainly getting metabolized by sulfation. Sulfation is one of the phase 2 metabolism reaction that we have discussed already. Now अगर बात करें dolutegravir की, dolutegravir guys, it is one of the substrate of, dolutegravir is considered as the one of the substrate of CYP3A4. Now whenever you are going to start your patient on anti-tubercular drug, TB वाले ड्रग में, तो TB में क्या क्या देते हैं आप? TB में we used to give drugs like your isoniazid, rifampicin, pyrazinamide and ethambutol. Isoniazid, rifampicin, pyrazinamide and ethambutol. Pyrazinamide is pyrazinamide basically. So rifampicin, don't you know that it's a very very potent enzyme inducer? तो in that case scenario किसके डोज को बढ़ाओगे, है ना? ये tenofovir तो इसका माइक्रोसोमल एंजाइम से कोई लेना देना नहीं है. Lamivudine that we are having, it is not a substrate of CYP3A4, mainly metabolized by non-microsomal enzyme by the sulfation. And next that we are having dolutegravir, it is a substrate of CYP3A4. So there are high chances rifampicin will cause treatment failure of which drug? Dolutegravir. तो dolutegravir के डोज को बढ़ा दोगे, है ना? जब भी ट्रीटमेंट फेलियर होता है, तो मैंने क्या बताया था, जब ट्रीटमेंट फेलियर हो रहा है, इंड्यूसर विल इंड्यूस, जो बार बार इंड्यूस, बार बार मैंने बताया, 10 बार बोला था कि मेटाबॉलिज्म से क्वेश्चन आता ही है. इंड्यूस करके क्या करेगा? जब इंड्यूस करेगा तो फेल होगा, बताया था ना, मैसेज आ रहा है इंड्यूस हो जाओगे, फेल हो जाओगे. तो इन दैट के सिनेरियो व्हाट इज द क्लिनिकल आउटकम होगा? यू हैव टू इंक्रीज द डोज, है ना? तो वारफरिन वाला एग्जांपल मैंने आपको क्लास में भी दिया था. इस कंडीशन में तो dolutegravir का डोज यू आर गोइंग टू इंक्रीज, dolutegravir का डोज यू आर गोइंग टू इंक्रीज. आई होप इट इज pretty clear to all of you guys that correct answer for this one will be इंक्रीज और एड dolutegravir. सो dolutegravir का डोज सीधे डबल कर देते हैं. जैसे पहले अगर 50 ले रहे थे उसको 100 कर दीजिए. तो इज ऑलरेडी टेकिंग 50 मिलीग्राम इन द इवनिंग, तो 50 मॉर्निंग में भी कर दो, बिकॉज यू आर गोइंग टू यूज rifampicin as a very potent enzyme inducer. C will be the correct answer. Now this is an example of let's say newer question that has been given in the pattern of old question, है ना? पुरानी बोतल में नई शराब वाली कहानी है यहाँ पे, ठीक है? ये वाला हो गया ऑलरेडी. ये मायस्थीनिया ग्रेविस वाला केस है. मायस्थीनिया ग्रेविस वी ऑलरेडी नो पाइरिडोस्टिग्मिन, बिकॉज मायस्थीनिया ग्रेविस में एनएम के अगेंस्ट, न्यूरोमस्कुलर के अगेंस्ट देयर इज ऑटो एंटीबॉडी अगेंस्ट एनएम. तो उस कंडीशन में हमें पेरिफेरली एक्टिंग देना है, सेंट्रली एक्टिंग आई मीन लिपिड सॉल्युबल ड्रग नहीं देना है ना, जो टर्शियरी अमाइन. फाइसोस्टिग्मिन तो टर्शियरी अमाइन है ना, इट विल बी क्रॉसिंग ब्लड ब्रेन बैरियर. वी डू नॉट वांट योर एक्शन इन द ब्रेन. मायस्थीनिया ग्रेविस में पेरिफेरल जो मसल है उनमें एनएम रिसेप्टर के अगेंस्ट हमारे ऑटो एंटीबॉडी हैं, तो वी आर गोइंग टू यूज पाइरिडोस्टिग्मिन. एंड दिस वाज वन ऑफ द क्वेश्चन दैट इज done already, right? So this was everything that I wanted to discuss. Let me quickly take you through whatever we have discussed here in the last 1 minute. We are having myasthenia gravis. The drug of choice for that one is going to be your pyridostigmine. And asthma hypertension वो हो चुका ऑलरेडी. देन डोज एडजस्टमेंट कैसे करेंगे? dolutegravir को डोज बढ़ा देंगे बिकॉज इट्स अ सबस्ट्रेट ऑफ CYP3A4. rifampicin इज अ पोटेंट एंजाइम इंड्यूसर. ये क्वेश्चन पेंडिंग है. मैं आप ग्राफ आपसे रिक्वेस्ट कर रहा हूँ. Send me the graph. I'm pretty sure I'll explain you in a way that you are never going to forget. Hypertensive emergency in pregnancy, we have already told you. Hypertension with bronchial asthma, ये वाला हिस्ट्री है. इस कंडीशन में निफेटिपिन will be the preferred. Rheumatic cancer आपको मेडिसिन में करा दिया गया. List weight gain will be associated with the ziprasidone. अरे शिप्रा को देखा क्या? Was the mnemonic here? Then antivenom will be the first step that we are going to do in a snake bite case. Ethambutol causing optic neuritis is the next question. Bioavailability 25%. That means 25% of the drug is reaching the systemic circulation. PSVT ECG adenosine, again there was a medicine case. Then this question again, I have told you 3 different versions of the same question. Whichever version you want to choose, you can, or you can send me one version. I'll try to have another session with all of you guys. Oral labetalol for this one, and ये pregnancy with hypertension, ये भी मैंने discuss कर दिया आप सभी के लिए. NaCl co-transporter inhibitor will be thiazide diuretics. Empagliflozin is going to cause loss of glucose for all of you guys, and tamoxifen for the breast cancer in postmenopausal women. Disulfiram-like reaction with the anti-amoebic drug like metronidazole. Then add benztropine because this is a case of your extrapyramidal symptom. For this one, injectable benztropine is the best one. A question that has been directly taken from our test and discussion that we have done at the NExT, and also this question I have given also for all of you guys in computer-based offline test. You can check it out in the booklet. A 2-month-old pregnant female require anticoagulation, so low molecular weight heparin. We are going to utilize QT interval will be increased by bedaquiline. I have already told you multiple version of this question that can be asked in upcoming examination. Next is going to be amiloride, that will be again added if there is already a case of hypokalemia because it's a potassium sparing diuretic. Next is not a side effect of your amiodarone. Gynecomastia will be the best answer because all other are the most fit answer for this one. Quinine is going to be the preferred one because all other options are not used. We are not using in the first trimester artemisinin combination therapy. Doxy is contraindicated. Chloroquine, primaquine is not going to be chosen because primaquine will be contraindicated, right? So this was everything in pharmacology. I hope all of you guys have got this one and most of you have got most questions correct. I'll be more than happy to receive more messages from all of you guys. If any question that was missed, like I see there was a question on local anesthesia where we are going to give लिपिड इमल्शन, वो वाला जो भी क्वेश्चन था, है ना. बाकी जो भी है आप हमें मैसेज करिए. यू ऑलरेडी नो दैट वेयर टू मैसेजेस, है ना. एंड आई विल सी यू गाइस इन अपकमिंग क्लास. थैंक यू वेरी मच टू ऑल ऑफ यू गाइस एंड आई विश यू ऑल द वेरी बेस्ट. आप आराम करिए, आप रिलैक्स करिए. अभी के लिए आपके कंधे का बोझ हल्का हो गया. इस फेज को एंजॉय करिए बिकॉज अभी आपको लग रहा होगा अब क्या करें. पहले था उठ के लगता था कि नहीं पढ़ाई करना है, अब लगेगा अब करें क्या, जिंदगी में कुछ बचा नहीं है. तो जिंदगी में अब वो सब करिए जो आपने 4 महीने मिस किया है. कोई अगर फेवरेट आपका सीरीज रह गया है, मूवी रह गया, डेट रह गया, जो भी था, जो भी वेटिंग पे आपने डाला था, उस सबको करिएगा. मेरा मतलब है हर काम लीगल वे से था. ठीक है. थैंक यू वेरी मच टू ऑल ऑफ यू गाइस. आई विल सी यू इन द अपकमिंग क्लास. बाय बाय, गुड नाइट.
Hello students, welcome to the recall session of forensic medicine. First of all, I hope आप लोगों का एग्ज़ाम अच्छा गया and I personally wish all of you best of luck. Hopefully आप सबका रिज़ल्ट अच्छा ही आएगा. Now as we all know, it's a very early recall session. आज के जो कुछ क्वेश्चंस हम डिस्कस करने वाले हैं उसमें बिकॉज ऑफ दी फास्ट रिकॉल कुछ क्वेश्चंस की फ्रेमिंग में कुछ ऑल्ट्रेशन हो सकती है, कुछ चॉइसेस अभी पूरे नहीं आए हैं. बट आई स्टिल वांटेड टू सिट एंड टॉक विद यू सो दैट वी कैन सी कि कौन कौन से एरियाज़ हैं फोरेंसिक मेडिसिन के जहाँ पर हमारे 28 जैन के FMGE एग्ज़ाम में क्वेश्चंस अपीयर हुए हैं. A concised recall, a comprehensive recall will later on follow. So let's begin with our first question. The first question says, there is a mentally ill pregnant female who will give consent for MTP. The answer is very simple. As per MTP Act, MTP consent has to be given by फीमेल. MTP एक्ट कहता है कि अगर MTP होनी है तो MTP का कंसेंट फीमेल देगी, किसी और के कंसेंट की ज़रूरत नहीं है. बट हमारे क्वेश्चन में एक हाईलाइट क्या है, दैट दिस इज़ अ मेंटली इल फीमेल. इट्स अ मेंटली इल फीमेल. यहाँ पर एक्ट की गाइडलाइंस क्या हैं? यहाँ पर एक्ट की गाइडलाइंस है दैट इट हैज़ टू बी गिवन बाय हर लीगल गार्डियंस. यानी कि जहाँ पर मेंटल इलनेस है वहाँ पर कंसेंट गार्डियंस देंगे, मेंटली इल का कंसेंट वैलिड नहीं होगा. सो आंसर इज ऑप्शन ए, दैट इज लीगल गार्डियंस. ठीक है, काफ़ी स्टूडेंट्स ने बताया कि इसमें और भी कुछ ऑप्शंस थे. हर पार्टनर, शी हर सेल्फ, ट्रीटिंग डॉक्टर. सो ट्रीटिंग डॉक्टर तो कंसेंट दे ही नहीं सकता. शी हर सेल्फ कैन नॉट गिव बिकॉज ऑफ हर mental illness, as you understand. Her partner, we don't know whether her partner is husband or not. So whether her husband can be called as her legal guardian if he is available. But if we go by the law, the amended MTP Act 2021 specifically says in one of its clause that if a female is mentally ill, the consent has to come from guardians. और जो कि हमारे ऑप्शन में दिया हुआ चॉइस था, यही करेक्ट आंसर रहेगा. नेक्स्ट क्वेश्चन देखते हैं. अगेन फ्रॉम प्रेगनेंसी. 22 weeks pregnant female, pregnancy because of contraception failure. So यहाँ पर हाईलाइटेड पॉइंट क्या है? प्रेगनेंसी इज बिकॉज ऑफ कॉन्ट्रासेप्शन फेलियर. कम्स फॉर abortion, or I should say termination of pregnancy. According to amended MTP Act, what can be done? The options are: 2 doctors' opinion are required for MTP. Pregnancy can be terminated if fetal anomaly. MTP can be done on permission of superintendent of hospital, or MTP can be done on permission of medical board. So अगर हम इस क्वेश्चन का डिसेक्शन देखें, amended MTP Act 2021. Okay, what does it say? It says that MTP can be done till 20 weeks, but in certain special category female, special category female, it can be done till 24 weeks. Okay, and beyond 24 weeks only if fear of substantial fetal malformations. ओके, तो सबसे पहले तो ये चीज़ याद रखनी है कि नॉर्मली 20 वीक्स तक कर सकते हैं. स्पेशल कैटेगरी में 24 वीक्स तक का अलाउंस आ गया है. एंड बियॉन्ड 24 वीक्स अगर प्रोग्रेशन ऑफ प्रेगनेंसी is going to develop a fetus which is having substantial fetal malformations. ठीक है, इन तीनों ही कैटेगरी में कौन कर सकता है? परमिशन कैसे आएगी? If it has to be done till 20 weeks, one doctor can decide and do the procedure. Special category of females, that is from 20 to 24 weeks, consensus of 2 doctors. यहाँ पर 2 डॉक्टर का कंसेंट का ज़रूरत है. एंड बियॉन्ड 24 वीक्स ये परमिशन आएगी मेडिकल बोर्ड से. ठीक है, तो ये तो नॉर्मल प्रोविजन है. अब ये देखते हैं स्पेशल कैटेगरी फीमेल्स जो हमने यहाँ पर हाईलाइट करी है. हु आर दीज स्पेशल कैटेगरी फीमेल्स? राइट, सो हु आर दीज स्पेशल कैटेगरी फीमेल्स वेयर द प्रेगनेंसी कैन बी टर्मिनेटेड up to 24 weeks? Number 1, survivors of sexual assault or rape or incest. Minors. Change of marital status during ongoing pregnancy with because of widowhood or divorce. Right? Women with physical disabilities. Then mentally ill women including mental retardation. Now comes the very important part. the fetal malformation that has substantial risk of being incompatible with life, or the child is born, it may suffer from such physical or mental abnormalities to be seriously handicapped. इस केस में भी हम स्पेशल कैटेगरी फीमेल मानेंगे उसको. Women with pregnancy in humanitarian settings or disaster or emergency situation as may be declared by the government. ये भी स्पेशल कैटेगरी है, right? So if we go back to our question, what do we find? Is there a special category? क्योंकि बेसिकली प्रेगनेंसी जो कॉन्ट्रासेप्टिव फेलियर से हुई है, विच मीन्स शी कुड हैव टर्मिनेटेड हर प्रेगनेंसी अप टू 20 वीक्स, बट अभी वो 22 वीक्स की है. सो क्या ये एमटीपी हो सकती है अभी? सो करेक्ट आंसर अगर आप देखोगे, इट इज गिवन इन ऑप्शन नंबर बी. प्रेगनेंसी कैन बी टर्मिनेटेड इफ देर इज substantive fetal anomaly, and if it has to be terminated, the consensus of 2 doctors will be needed, right? And that is our correct option. So इस केस में हमारा correct option क्या है? हमारा correct option है option B, right? If she lands up being a special category female, it can be done. Otherwise, it cannot be done, right? Let's move to next question. Next question is, to identify dried seminal fluid on handkerchief, which test is best? So 4 ऑप्शन दिए हुए हैं, प्रेसिपिटिन, एसिड फॉस्फेटेज, बारबेरियोज एंड फ्लोरोसेंस टेस्ट. सो प्रेसिपिटिन और फ्लोरोसेंस तो सेमिनल डिटेक्शन के लिए यूज ही नहीं होते, ये तो हम अपनी क्लास में भी पढ़ते हैं, ठीक है. तो हमारे पास में कौन कौन से टेस्ट हैं जो सेमिनल डिटेक्शन के लिए यूज होते हैं? एक बारबेरियोज है, एक फ्लोरेंस टेस्ट है, फ्लोरेंस टेस्ट, और एसिड फॉस्फेटेज भी यूज होता है. एब्सोल्यूट प्रूफ ऑफ सीमन भी यूज होता है. यहाँ पर 2 दिए हुए हैं, एसिड फॉस्फेटेज एंड बारबेरियोस टेस्ट, बट साथ में हमें क्या दिया हुआ है? इट्स अ ड्राइड सेमिनल फ्लूइड ऑन हैंकरचीफ, जिसमें एक्सपेक्टेंसी क्या है? एसिड फॉस्फेटेज लेवल्स आर गोइंग टू बी equivocal as the stain becomes old. एसिड फॉस्फेटेज लेवल धीरे धीरे गिरते रहेंगे, राइट? ऑल्दो एसिड फॉस्फेटेज लेवल्स फ्रेश सीमन में बहुत हाई होते हैं, मोर देन 100 बोडेंस की यूनिट, वी कंसिडर इट एट सीमन ओनली, ठीक है. बट ड्राइड स्टेन है, कुछ समय पुराना हो गया, इसमें बेटर टेस्ट क्या रहेगा? टू डू अ बारबेरियोस टेस्ट. बारबेरियोस टेस्ट क्या आइडेंटिफाई करता है? बारबेरियोस टेस्ट आइडेंटिफाइज स्पर्मिन पिक रेट crystals microscopically, right? So correct answer इस चॉइस में रहेगा बारबेरियोस टेस्ट. नेक्स्ट देखते हैं, व्हाट इज द नेक्स्ट बेस्ट स्टेप ऑफ मैनेजमेंट आफ्टर स्नेक बाइट? द वाइटल्स ऑफ द पेशेंट प्रॉब्ली वर गिवन नॉर्मल. यानी कि पेशेंट जो है वो हॉस्पिटल आ चुका है. क्वेश्चन पढ़ के मुझे तो ये लगता है वाइटल्स आर नॉर्मल मीन्स पेशेंट हॉस्पिटल आ चुका है. बेस्ट नेक्स्ट मैनेजमेंट का स्टेप क्या होगा? सो इमोबलाइजेशन तो नहीं होगा, क्योंकि इमोबलाइजेशन इज समथिंग जिसको करके आपको स्नेक बाइट साइट से हॉस्पिटल तक लाना होता है. इमोबलाइजेशन इज द बेस्ट थिंग टू डू विदाउट वेस्टिंग एनी टाइम एट द स्नेक बाइट साइट, so that patient can be brought to the hospital as early as possible, right? हॉस्पिटल में आने के बाद क्या चीज़ करनी चाहिए? एंटी स्नेक वेनम इज द बेस्ट थिंग टू बी डन इफ द बाइट इज पॉइजनस. बट हमें क्या दिया हुआ है क्वेश्चन में? दैट वाइटल्स आर नॉर्मल, विच मीन्स डजंट लुक टू बी अ पॉइजनस स्नेक बाइट. इस केस में द बेस्ट थिंग टू डू इज reassure, clean the wound and observe the patient for 24 hours. So ये ऑप्शन हमें कहाँ दिया हुआ है? ये ऑप्शन हमें दिया हुआ है ऑप्शन नंबर सी में, दैट इज रीअश्योरेंस एंड वॉश द एरिया। कुछ स्टूडेंट्स ने बोला वॉश द एरिया भी था, कुछ स्टूडेंट ने बोला रीअश्योरेंस के साथ में कुछ और लिखा हुआ था, बट द बेस्ट पॉलिसी इन दिस केस इज वेयर इट लुक्स टू बी अ नॉन poisonous snake bite is reassurance and observation for 24 hours, right? So जिस तरीके की फ्रेमिंग के साथ ये क्वेश्चन आया है, दिस लुक्स टू बी द बेस्ट आंसर राइट नाउ। नेक्स्ट क्वेश्चन देखते हैं। द डायमीटर ऑफ अ गन इज मेजर्ड बाय, राइट? किस तरह की गन है? राइफल्ड वेपन है, स्मूथ बोर वेपन है, ये रिकॉल में ठीक से नहीं पता चल पाया, या प्रॉब्ली इसी तरीके का क्वेश्चन फ्रेमिंग आया था कि डायमीटर ऑफ गन किस तरीके से मेजर होता है। सो चॉइसेस को देखते हुए लगता है इट लुक्स टू बी अ राइफल्ड वेपन, ठीक है। राइफल्ड वेपन क्या होता है हम अपनी क्लासेस में देखते हैं, वेपन जिसके बैरल में इस तरीके की मेटालिक स्कोरिंग होती है, इस प्रोसेस को बोलते हैं राइफलिंग, और जिन वेपन्स में राइफलिंग होती है दोज आर कॉल्ड एज राइफल्ड वेपन। सो इफ वी कट the barrel of the weapon, if we do a section of the barrel, तो वो हमें दिखेगा कैसे? अगर आप देखोगे तो कट सेक्शन आपको कुछ इस तरीके का दिखेगा, इसके अंदर मेटालिक स्कोरिंग्स की वजह से इस तरीके की मार्किंग्स होंगी, राइट? ओके, these are called as लैंड्स, एंड दो लैंड्स के बीच में जो स्पेस है, दिस स्पेस इज कॉल्ड एज ग्रूव। ओके, नाउ अगर आप इस बैरल के अंदर मैक्सिमम परमिसिबल डायमीटर देखो, यानी कि कौन सी चीज इस बैरल के अंदर से अंदर बाहर आ जा सकती है, तो वो स्पेस कौन सा है? वो स्पेस है दिस स्पेस, दिस इज द स्पेस which is the maximum permissible diameter. Which is the space between two opposite lands. ठीक है ना? तो हम डायमीटर गन का कैसे देखते हैं? हम देखते हैं इट इज डिस्टेंस बिटवीन a land and another land which are diagonally opposite. So दो diagonally opposite lands के बीच का जो distance होता है वो permissible diameter है गन का। So I am hoping कि क्वेश्चन कुछ इस तरीके से ही फ्रेम हुआ है, जहाँ पर they wanted to ask कि वो जो स्पेस है, वो जो permissible diameter है, वो कैसे मेजर करते हैं। It is the distance between two diagonally opposite lands. Okay. Okay, let's move again to our next question, right? Our next question is, the police found some bone in open space. How will you differentiate between human and animal bone? ठीक है, तो ये बड़ा कॉमन सा यूनिवर्सल क्वेश्चन है। इसमें बेसिकली हमें बोन की स्पीशीज आइडेंटिफाई करनी है, ह्यूमन है या एनिमल है। ऑप्शंस जो मेरे पास आए हैं वो एक ही है, प्रेसिपिटेंट टेस्ट, जो कि करेक्ट ऑप्शन है, क्योंकि प्रेसिपिटेंट टेस्ट स्पीशीज आइडेंटिफिकेशन के लिए किया जाता है, और यही हमारी करेक्ट चॉइस है। इसमें 3 और ऑप्शंस होंगे, बट वो ऑप्शंस अभी पता नहीं चले हैं, हम इलैबोरेटिव डिस्कशन में बाद में करेंगे। ओके, so right now the correct answer is precipitin test itself. Okay, next question. A woman was raped 2 years back. The accused has to be given death sentence. Who can give death sentence? Okay, so इस क्वेश्चन का अगर क्रक्स देखोगे ना, तो वो क्रक्स जो है वो रेप की पनिशमेंट नहीं है। The question is who can give death sentence. Whosoever can give death sentence in a case of rape, they can give death sentence in any other crime also wherever death sentence is available. रेप के भी कुछ सिचुएशंस में डेथ सेंटेंस अवेलेबल है, ये हम अपनी क्लासेस में बात करते हैं। बहरहाल फिलहाल हम इस क्वेश्चन पे वापस आते हैं। हु कैन गिव डेथ सेंटेंस, हमें इस क्वेश्चन में डायरेक्टली पूछा हुआ है कौन सा जज या कौन सा कोर्ट डेथ सेंटेंस दे सकता है। ठीक है, पहला ऑप्शन है क्लास 1 जुडिशियल मैजिस्ट्रेट। आई एम नॉट वेरी श्योर कि ये ऑप्शन था या नहीं था या कोई और ऑप्शन था। दूसरा भी चीफ जुडिशियल मैजिस्ट्रेट है, शायद मैजिस्टेरियल कोर्ट था या कोई और ऑप्शन था, बट मोस्ट ऑफ द स्टूडेंट्स हैव सेड कि दो ऑप्शंस मैजिस्टेरियल कोर्ट के थे। तो मैजिस्टेरियल कोर्ट के पास तो पावर नहीं होती डेथ सेंटेंस देने की। मैक्सिमम पनिशमेंट मैजिस्ट्रेट रैंक का जो जुडिशरी है, जो कि चीफ जुडिशियल मैजिस्ट्रेट होता है, उसके पास होती है 7 years ऑफ इम्प्रिजनमेंट। ओके, तीसरा लोगों ने बताया दी पर्सन वाज असिस्टेंट सेशन जज। असिस्टेंट सेशन जज की भी मैक्सिमम पनिशिंग पावर is up to 10 years of imprisonment, यानी कि असिस्टेंट सेशन जज 10 साल से ज़्यादा की सज़ा नहीं दे सकता। एंड डेथ सेंटेंस इज मोर देन 10 years ऑफ इम्प्रिजनमेंट, राइट। एलिमिनेशन से भी हमारे पास जो चॉइस बची वो है एसोसिएट सेशन जज, जिसको हम बोलते हैं एडिशनल। एक्चुअली ज़्यादातर लोगों ने एसोसिएट बताया, बट आइडियल चॉइस होनी चाहिए थी एडिशनल। एडिशनल सेशन जज या फिर सेशन जज प्रॉपर, ये दोनों ही जजेस जो हैं दे कैन गिव एनी पनिशमेंट अवेलेबल इन इंडियन लॉ। सो करेक्ट आंसर इन दिस केस वुड बी एन एडिशनल सेशन जज और सेशन जज, या फिर एसोसिएट सेशन जज भी लिखा होगा। सो हो सकता है कि एडिशनल की जगह एसोसिएट उन्होंने लिख दिया हो, बट एसोसिएट इज नॉट द करेक्ट वर्ड। Correct word is additional session judge. Okay, so I would go with additional session judge as the correct choice who can deliver death sentence. Okay, next question. In air blast which organ is more affected? बड़ा ही पुराना, बड़ा ही स्ट्रेट फॉरवर्ड क्वेश्चन है, कई बार एग्जामिनेशन में पूछा गया हुआ है। ये हम बात कर रहे हैं बॉम्ब ब्लास्ट की। ठीक है, बॉम्ब ब्लास्ट अगर एयर में होता है तो यहाँ पर मोस्ट वल्नरेबल बॉडी ऑर्गन कौन सा होता है? दिस इज लंग्स। ठीक है, तो इस केस में हमारा करेक्ट आंसर तो लंग है, बड़ा सिंपल। बट एक इंफॉर्मेशन और याद रखेंगे कि बॉम्ब ब्लास्ट अगर अंडर वाटर होता है तो यहां पर मोस्ट वल्नरेबल बॉडी ऑर्गन कौन सा बन जाता है? नाउ इट बिकम्स जीआईटी। ओके, तो अंडर वाटर ब्लास्ट में जीआईटी इज मोर वल्नरेबल, एयर ब्लास्ट में लंग्स आर मोर वल्नरेबल, बिकॉज ब्लास्ट के साथ होता क्या है, प्रेशर डिफरेंसेस क्रिएट होते हैं। ब्लास्ट क्या करता है, फ्रॉम द एरिया ऑफ ब्लास्ट इट सेंड्स कंसेंट्रिक एयर, चारों तरफ एयर को बाहर की तरफ फेंकता है, जिसकी वजह से ब्लास्ट के आसपास का एरिया जैसे जैसे हवा फैलती जाती है बाहर की तरफ, उसमें वैक्यूम क्रिएट होता है। सो वो बॉडी ऑर्गन्स जो कि प्रेशर मेंटेन करते हैं बॉडी का, एटमॉस्फेरिक प्रेशर, लाइक ईयर ड्रम्स, लंग, ठीक है, और जीआईटी, ये सारे जो है दे बिकम वल्नरेबल। सो एयर ब्लास्ट में हमारे पास इस क्वेश्चन में ईयर ड्रम की चॉइस नहीं दी हुई थी, टिम्पैनिक मेम्ब्रेन, राइट। अगर तो टिम्पैनिक मेम्ब्रेन की चॉइस होती तो वो ज़्यादा वल्नरेबल होता, बिकॉज उस केस में एयर ब्लास्ट में टिम्पैनिक मेम्ब्रेन्स पहले रप्चर होती है, लंग इंजरीज बाद में आती है। ओके, तो यहाँ पर चॉइस लंग था तो हमने लंग का ऑप्शन लिया। अंडर वाटर जीआईटी इज मोर वल्नरेबल एज कंपेयर टू टिम्पैनिक मेम्ब्रेन एंड लंग्स बोथ, राइट। सो ये कुछ क्वेश्चंस थे जो अभी रिकॉल में मेरे पास आए हैं। एज आई शेयर्ड विद यू अर्लियर, आई वांटेड टू टॉक विद यू ताकि प्रेजेंटेशन में आपके साथ में शेयर कर पाऊँ कि किस तरीके के क्वेश्चंस हमारे पास आए हैं। विल वर्क ऑन द इलैबोरेटिव रिकॉल लेटर ऑन एंड वी विल टॉक अबाउट इट ऑल्सो। एज ऑफ नाउ, बेस्ट ऑफ लक फॉर योर रिजल्ट्स, राइट।